What's up, world? You already know what the deal is. You already know what the deal is. Hey, welcome. Today is, hell, I thought today was Wednesday, but today is, today's Friday, y'all. Today's Friday. You already know what we about to do. Shout out to y'all. Appreciate everybody that's about to jump up in here. We're going to be doing NCLEX questions today. We might actually go through a good lengthy amount of exam questions today. We'll kind of see what's going on, see what y'all like, but let for a little bit of people jump up in here. Hey, if you start jumping in, let me know who you are, where you're from, where you're at in your nursing journey. Yeah, let's do it. Hey, we're gonna jump into some questions, but like once I get a good amount of folks up in here, you already know what we about to do. You already know. Hey, you already know. If you guys are new here, welcome. My name is Kevin. I go by the Boot Nurse on all social media platforms. Make sure you guys go over there and check that out, so you guys can look at this glamorous, just glorious face. Avery, ma'am, hello, how are you? If y'all don't know Avery, Avery is she's our avid contributor. What's up, PJ? How are you? How are you? Michigan, or the guy that says she's Michigan RN 3 out of 4. Shout out to you. Shout out to you. I'm good, Avery. I appreciate you asking. So, got a bunch of people jumping up in here. Make sure y'all smash that like button. Make sure you guys share. Y'all already know what the deal is. If you're new here, we're going to be going over NCLEX questions, and then after that, we'll do like some nursing Q&A, so on and so forth. I've been a nurse for about 3.5 years. I've been an educator for it'll be 9 years in January. So yeah, I love doing this. I love teaching everybody. I love contributing back to the nursing aspect. So yeah, once we get once we get some more folks up in here, we can get it on and popping. But I want to know who y'all are, where you're from, where you're at in your nursing journey, all that good jazz. I got a bunch of links in my bio. Well, I got a bunch of links that are attached to my link tree in my bio. So make sure y'all go over there and y'all check that out too. PJ said, I'm doing my PN, taking OB and mental health. Shout out to you. Hey, mental health is a very, very important aspect of nursing and in the medical field that is just going to skyrocket. So, hey, if you're one of those people that wants to do mental health, as in like a nurse practitioner or anything like that, go do it. Go make it happen. I had mental health today. Shout out to you. Mental health is hard. Mental health is hard. It's a very hard thing. Shout out to us. Well, we got like almost 60 people up in here. Cool. Hey, make sure y'all smash that like button. Make sure y'all share. We're about to do these questions, but I want to know who y'all are, where y'all are from, where you're at in your nursing journey. And then, essentially like what questions you guys have. Remember, I'm only one person, so I can't answer all your questions all at the same time. I'm a little slow. That's why I got these gray hairs that are somewhere here. I'm a little slow. So, Sarah said, damn, you got me. You got me here. Look. Sarah, I'm glad you over here. Oh, was it the code blue? That's how I get them all. I know. Hey, who heard the code blue and it triggered them to come over here? Because I can tell you every time I hear it, it triggers me real bad. My bad, Sarah. My bad. Hey, well, we doing questions over here. We doing NCLEX questions. So shout out to you for coming over here. My bad for triggering you. I won't do it again. I'm lying. I'll do it again. So shout out to y'all. Hey, we got 100 people up in here. So without further ado, since we got a good amount of people up in here, we're going to check out these questions. All right. Let's see what we got. Here we go. Make sure y'all like. Make sure y'all share. Hey, I'm just saying the more that you like, the more questions that you get. Let me go back. All right. Hey, so here we are. We're going to be doing NCLEX questions. Hey, I do these little things right here every like 5 to 10 questions, okay? Because I want to make sure we're doing our thing. Not gonna lie, you look like Jason Derulo. Yeah, bro. Yeah, tell me something I don't know. I get told that all the time. Every so often, I might start singing. So, just I take requests. I don't only know one chorus from one song. It doesn't matter. So anyway, hey, make sure y'all participate. I'm kind of funny, kind of sorta, but to each their own. Hey, I'm just letting y'all know I talk a lot because this is the only way I get to interact with y'all. I got to see how the chat goes. So just saying, hey, the more likes that you give me or whatever, hey, the more questions that you get. I want all them likes. I want all of them. Not some of them, all of them. Don't troll my chat. Don't come in here acting a fool. You troll my chat, I'm going to give you a 600. So a 600 is 600 seconds, which means 10 minutes, and that's how long I'm going to ban that ass. So don't be rude, all right? I'm just letting y'all know. I don't gatekeep. I got these questions from nurselabs.com. You guys can go over there. You guys can check that out. I will be doing a nursing school summit, which is presented by TrueLearn and Picmonic. And that link for the registration for that is in my bio. It'll take you to the link tree. It's the very first one up top. So anybody that's interested, I'm not the only one that's doing it. So there's a bunch of other panelists that are on there. Go over there and get y'all some free knowledge. Stop playing with me, all right? 7-day NCLEX course. That's a course I created It's in its pre-launch phase. The link is in the bio. Hey, $48. Once you get it, you have it forever. We're updating all the time. Hey, make sure y'all check out thebootnurse.com because, we out here. All right, here we go. Without further ado, let's jump into the questions. All right. Question number 1. The nurse educates individuals on the risk factors for developing hypertension during a community health fair. Which of the following individuals are at the most significant risk for developing hypertension? Right? So who is at the most risk to getting hypertension? High blood pressure. NCLEX is a joke. I mean, it depends. Did you fail it? Because if you fail it and you saying that's a joke, hey, you can laugh your way to the bank, so it doesn't matter. So we have a 45-year-old African-American attorney with a family history of hypertension, who has a sedentary lifestyle and consumes a diet high in sodium. A 60-year-old Asian-American shop owner with a BMI of 28 who has well-managed type 2 diabetes and engages in regular physical activity. A 40-year-old Caucasian nurse who is a vegetarian with a healthy BMI and is a non-smoker but reports high levels of work-related stress. Or a 55-year-old Hispanic teacher who smokes occasionally, has a healthy BMI, and participates in moderately intense exercise program. Got a bunch of people saying A. I'll give you guys a time limit as well. Usually my time limit is just based off of whatever I think of on top of my head, so I'll give you guys about a good 30 seconds. Sarah says diabetes, old age, African-American, hyperlipidemia, hypertension. Look at you, Sarah. Shout out to you, Sarah. Hey, make sure you guys like, make sure you guys share. Hey, and make sure you guys follow. Those are 3 of the most important things that'll 1, push the algorithm. That'll 2, get me to 10,000 followers. And that'll 3, unghetto me so I can not have to stream it like this. All right, so make sure everybody follows. All right, the follows are by far the most important, but I like them likes. All right, I'm gonna give you about 15 more seconds. Emmy says C. So think about the risk factors for somebody that has hypertension or somebody that can develop hypertension. All right, it's A. Okay, you gonna die on that hill? That's what I'm talking about. I love certainties. Hey, this is why we do this. So here's your answer. Everybody that chose A is correct. It's your 45-year-old African-American attorney. All right. African-American adults have a high prevalence of hypertension compared to other racial and ethnic groups in the United States. This individual also has a family history of hypertension, a sedentary lifestyle, and a diet high in sodium, which are all risk factors for hypertension. Therefore, this individual is at greater risk for developing hypertension among the given choices. Okay. So remember, when you guys study, remember when you study, you always read the rationale to understand why the answer is correct, but also understand why these are the incorrect answer for this specific question, okay? And the category, based off of the 8 sections of the NCLEX pie, it comes from the reduction of risk potential, okay? Don't forget there's 8 sections, management of care, pharmacology, so on and so forth, all right? Shout out to y'all for everybody that got the answer right. Let's see what we got. Question number 2. Appreciate everybody jumping in here. My name's Kevin. Go by the Boot Nurse on all platforms. Make sure y'all check those out. Smash that like button and share and follow. I need all 3 of them. 3 of them. All right. Question number 2. A 15-year-old female with a history of depression is rushed to the emergency department after ingesting 15 tablets of maximum strength acetaminophen 45 minutes ago and a suicide attempt. That'll probably be her last headache. I'm sorry. I shouldn't have said that. The patient's vital signs are stable, but she is visibly anxious and tearful. The healthcare provider has written several orders to manage the situation. Which of the following orders should the nurse prioritize and carry out first? Just like you guys say, hey, what is the very first thing that I could do based off of a systematic approach? So 1, 2, 3, and 4. Is it A, perform gastric lavage? Do we want to give, Mucomix orally, IV dextrose 5%, and 0.33% normal saline, or drink activated charcoal with water? The antidote for B is the antidote for Tylenol. Okay. Obviously B. You can't say obviously B because there's some people who are not at that position yet. So can't say obviously B. Kenzie says D. Okay. And if you think that it's B, then drop out of school. Once again, user 2. Like I said, some people are not where you are, so you can't say that they need to drop out of school. Don't even know what that means. Hey, and that's another thing. I do a thing on democracy. So user 22, I don't know if you were in here, but if you come in here and you troll my chat, you're going to get a 600, which means I'm going to ban you. So don't do that. Don't do that. Shout out to everybody that's following. So I usually don't give warnings, but I'm giving you a warning right now. Got D? Okay. All right, I'm going to give you about 15 more seconds. I don't know about nursing, but I feel it's C. All right, Emily, cool. I like the feeling. I like the feeling. All right, here we go. Here's your answer. And three, two. So the answer is B, right? See, look at that, user two. You were correct. Some people didn't know that, right? Although gastric lavage can help remove any remaining acetaminophen from the stomach, it is not the priority intervention in this situation. Administering the antidote, which is the mucomist, should be the primary focus for to counteract the toxic effects of acetaminophen on the liver. It's the antidote for acetaminophen toxicity and should be administered as soon as possible to maximize its effectiveness in preventing liver damage. Right? Yes, correct. Yes, user two, you are correct. You are correct. Shout out to everybody that's following. Hey, make sure you guys share, follow, smash that like button. Hey, I'm just saying, the more likes that y'all give me, the more questions that you get. I got a lot. Hey, I got a lot in the chamber. I'm just saying. I'm just saying, whatever y'all want. I might have 25 questions. I might have 50. Hell, I might even have 100. I don't know about that. All right, here we go. Question number 3. A 68-year-old male with a history of hypertension and diabetes has undergone a cardiac catheterization to evaluate potential coronary artery disease. He has a known allergy to iodine-based contrast agents, which require premedication with corticosteroids and antihistamines. The procedure was successful, but the patient experienced brief hypotension during the administration of the contrast material. The patient has been transferred to the cardiac step-down unit for observation, and the nurse is aware of the potential complications that can arise in the initial 24 hours post-procedure. Which complications should the nurse monitor closely during this period? So paint that picture for you. So paint the picture for yourself. All right, so if somebody who went into the cath lab had an allergic reaction or had a reaction to the contrast, and now they're in step-down. So what can happen, to this patient 24 hours post-op? All right. Is it a persistent angina despite being at rest and receiving nitroglycerin? Is it thromboformation leading to a decreased peripheral pulse and cyanosis? Is it dizziness accompanied by a sudden drop in blood pressure when standing? Or is it gradual decrease in blood pressure with no other symptoms? Got C's, got B's. I think it's B. Got some D's. I think it's B. Got C. Okay. All right. Spartacus says A. Chrissy says A. All right, so think about what are the things that I'm thinking about when somebody goes to the cath lab, right? And for those that don't know, like when they go to the cath lab, and usually they're going into, big vessels. So like the femoral artery, all those big vessels, right? So what am I thinking about for somebody who's coming out of that position? Bleeding, absolutely. So what's accompanied with bleeding? What's accompanied with that? And you got to think, that's coronary. Talking about coronary artery disease. All right, I'm gonna give y'all about another 20 seconds. This was a pretty lengthy one. You gotta think about clots, right? Right. So what's associated with that? This is what the NCLEX wants, y'all. Critical thinking. So you think critically, and then you make a good clinical judgment based off of what is presented to you. All right. Here we go. Answer in 3, 2. So the answer is B. It's thrombus formation, right? So in the initial 24 hours after a cardiac catheterization, the nurse should closely monitor for thrombus formation. Thrombus formation at the catheterization site could lead to serious complications such as decreased flow to the extremities or embolization to other parts of the body. Look, I'm trying to tell you, you ever seen somebody have a pulmonary embolism? That'll be the first and last time you ever want to see something like that. While the other options can be potential concerns, thromboformation is the most critical complication to monitor for during the immediate post-procedure period, and that is a management of care question, right? Management of care is the largest section on the NCLEX at like 17 to 23%. Well, there's different doctrines out there, but 17 to 23%. It is the largest section anywhere. It's big, right? And it doesn't matter if you're taking the LPN or the RN exam, okay? So shout out to all the follows. Hey, if you guys are new here, my name is Kevin. We're going over NCLEX questions. I want to know who you are, where you're from. Make sure y'all smash that like button, kill that like button. Last time we got 50,000 likes. Y'all are being real stingy with the likes, all right? Make sure y'all share as well, okay? So here we go. Question number 4. A 43-year-old male with a history of recurrent renal calculi is admitted to the emergency department presenting with severe left flank pain radiating to the groin, nausea, and episodes of vomiting. He also reports burning and urgency during urinization. His vital signs reveal a temperature of 100.8. Sorry if y'all hear my son crying. He'd be acting up every time I get on a live. Blood pressure 145/90 and a heart rate of 100, respiratory rate at 20. The client is visibly anxious and uncomfortable due to the severity of the pain. The nurse is assigned to care for the patient and must prioritize the nursing goals to ensure optimal care. Which nursing goals should be the top priority for this client? All right, is it maintain fluid and electrolyte balance, control nausea, manage pain, or prevent urinary tract infection? We got C's all over the place. C, D, okay. C, D, got an A up in there. All right, manage pain, okay. All right, so for those that don't know what's a renal calculi, for those that don't know, I think it's A, IV fluids can bring down the BP, pain would be secondary, I think, okay. It's pain management first, nothing suggests fluid imbalance. That's true. Kidney stones, that's right. That's right. How do y'all think kidney stones feel? Right? So remember, this is a priority question. So what is the top priority that I want to think about for somebody that's having this issue? And somebody said there's nothing that shows maintaining fluid-based imbalances, right? And they are painful. If anybody's ever had a renal calculi or a kidney stone and has ever passed it, it's like jagged shards just passing through. And it'll put you out. All right, I'll give y'all about 10 more seconds. We got C's. Y'all are kind of all over the place, but I see some C's and I see some A's. I see some C's and I see some A's. So let's find out what this answer is. In 3, 2, and the answer is C. We want to manage pain. Managing pain is always a priority because it ultimately improves the quality of life. The cornerstone of urethral colic management is analgesia, which can be achieved by exponentially by giving narcotics and non-steroidal anti-inflammatory drugs. So yeah, the very first thing that you want to take care of is pain management when it comes to somebody that has a kidney stone. You just did this topic. Shout out to you, Melissa. That's my sister name. You my sister? My sister from another mister? All right, cool. That's what I'm talking about. Shout out to y'all. Shout out to y'all. Hey, I appreciate all the likes. Make sure y'all smash that like button. Make sure y'all share. Make sure y'all follow. Hey, I need all the friends. I need all the friends I ever have, okay? Be friends with me, all right? Here we go. Question number 5. During a school screening program for children ages 6 to 12. All right, so think about it like where they fall in that category, okay? A nurse is tasked with evaluating their growth parameters. She encounters a 9-year-old girl who is shorter than her peers and seems to have less muscle development. To align her observation with typical growth expectations for school-age children, what would the nurse expect to see? Is it a decreased amount of body fat and muscle mass? Is it a little change in body appearance from year to year? Progressive height increase of 4 inches each year? Or a yearly weight gain of about 5.5 pounds per year? Somebody says D. I'm not even going to lie to y'all. Like pediatric stuff and pharmacology, when I took my NCLEX, was probably one of the hardest. They were the 2 hardest spots for me. So if you already know all of the above, ma'am, all of the above is not even an answer, okay? Not even an answer. You can't even do that. Make sure y'all smash that like button. Make sure y'all follow. I hate peds. Look, peds is shout out to everybody that likes to work out with little people. I'm just saying. But I'll give you about 20 more seconds. Got D's, got B's. But yeah, farm is a monster. Pediatrics, maternity, that was a monster for me. So I really had to learn. I had to learn. All right, cool. We got some A's, we got some C's. Got B's. 4 inches per year seems like a lot, right? Shooting up. End up with scoliosis out here. All right, here we go. In 3, 2, and the answer is D. Yearly weight gain of about 5.5 pounds per year. School-age children gain about 5.5 pounds each year and increase about 2 inches in height. Between ages of 2 to 10, they will grow at a steady pace. And this one's part of the health promotion and maintenance categories for the NCLEX. And that's okay. Hey, if you got it wrong, that's okay. That's how you know this is one of the sections that you really need to like look over for yourself. Okay? Okay, fine. What do you mean okay, fine? I don't even know what happened. Y'all, I have no idea what happened. I'm right here. No idea what happened. I think somebody changed the Wi-Fi password on me. So, all right, we good. Yo, I was just like, yo, what the hell happened? Somebody changed the Wi-Fi password on me because I think they might divorce me. Joke's on them. I'm already divorced. It doesn't matter. Another question. Hey, I got you. I just want everybody to jump back up in here. I don't know what happened. All right, so hey, here we go. So hey, about every 5 to 10 questions, I do this little break, and that way I let everybody know what's up. All right, so for all those that are in here, welcome. My name is Kevin. I go by the Boot Nurse. Make sure you guys check me out on those social media platforms. For anybody that misses this live, they will go up on YouTube. Okay, so if you know somebody that may need this, hey, tell them to go check it out. Okay, make sure you guys participate. You know, I'm funny, only kind of sort of though. So I mean, you know, your opinion is whatever. Anyway, so hey, give me all the likes. I want all the likes or whatever. The more likes I get, the more questions that you get. So give me all them likes. This is just y'all's fair warning. Don't troll my chat, because if you troll, I'm gonna troll you, and then I'm gonna give you a 600, and the 600 is a ban. So I will ban that ass really fast. So don't be rude, all right? And also, if you tell me you're going to the next question, you better put a smiley face or something after that, because I don't know what y'all talking about out there. I don't gatekeep. I got the questions from nurselabs.com, so you guys make sure you guys go over there and check that out. They're all free. I found these and I was like, man, I think this will be really great for you guys. So decided to do that. I will be doing a nursing summit, the nursing school summit, and it's presented by True Learn and Picmonic. Make sure you guys go over there and register for it. It's free. There's a bunch of different panelists that are out there that are going to be doing it, and it's on October 1st. So make sure you guys go over there and that you guys register. Archer or UWorld is better. Depends on you, but I like Archer. I've used Archer and UWorld, but I liked Archer. So it all just depends on you and how you learn. I created an NCLEX course. Y'all, I failed my NCLEX 3 times. None of y'all would have ever known that unless I told you, unless you've known that before. All right. So I failed it 3 times. This is why I do this, because I wish that I had something like this when I was studying. All right. I really, really did. But I didn't. I didn't utilize social media the way that I was supposed to, and definitely didn't think about that. So yeah. That's why I created that NCLEX course. It's $48 right now. It's in the pre-launch phase. Once you get it forever. I am currently working on updating my review, as well as getting NCLEX questions and a QBank and all that good stuff. So, hey, once you get it, you get it. I'm just saying. Also, check out thebootnurse.com. I'm kind of cool over there, too. So here we go. On to the next one. All right, I think everybody can see that. Did you get your undergrad in nursing? Yes, I have my bachelor's. I have my bachelor's in nursing. Does clinicals help with NCLEX or the textbook? Clinicals, they help you with both. More towards, more towards like the real world, I guess. And the textbook, the NCLEX is all about the textbook, all about it. Where do we register for the summit? Go to the link in my bio and you'll see the link in there. You'll see the link tree. What is it like? Knowledge and concept reason? What do you mean? What do you mean? I need for you to elaborate for me. Anyways, here we go. Question number 6. A 62-year-old client arrives at the community health fair where the nurse is offering blood pressure screenings. Upon assessment, the nurse notes that the client's blood pressure is 160/96. The client claims that their blood pressure is usually much lower, and they recently started new medication for arthritis. What would the nurse advise the client to do? Is it A, go get the blood pressure check, or get a blood pressure check in the next 15 minutes? Check the blood pressure again in the next 2 months, see the healthcare provider immediately, or visit the healthcare provider within a week for a blood pressure check. We got A's. I know somebody else had asked me a question up in here. Yep. Okay. Yeah. All right, I'll give y'all some time. Melissa says C. Jackie says A. Chrissy says A. Okay. Is it Sadell or Sade? Sade? Spartacus says A. Okay. Is it Yesenia? Says C. Mandy says A. I'm going to give y'all about another 15 seconds. See what we got here. Let's see what we got. Veronica says C. Adverse effect of the meds. Could be. It could be an adverse effect of the meds, or for the fact that he just started it. So, all right, here we go. Make sure you guys like, share, and follow. So here we go with the answer, all right? So the answer is A. Get a blood pressure check within the next 15 minutes. The blood pressure reading is moderately high with the need to have it rechecked after a few minutes to verify. The client states it's usually much lower, thus concerns exist for complications such as a stroke. But you also got to think is like when you have people that walk around, naturally your blood pressure is going to go a little bit higher, right? So, hey, if it's a little high, let's sit down for 10 to 15 minutes and see if it goes down. If it doesn't go down, you need to start making an appointment with that physician saying like, hey, the blood pressure meds aren't working. Okay, because my blood pressure is still high and my resting blood pressure is, 160 over something. That ain't good. I guess we never choose healthcare provider. No, that's what we call passing the buck, and we don't want to do that. Oh, also health promotions and maintenance. That is the category with one of the 8 sections of the NCLEX pie. All right. Make sure y'all share. Make sure y'all follow. Make sure y'all smash that like button. We at question number 7. It's a busy evening shift. Probably a busy quiet shift. No, hey, never say the word quiet or you will get beat the fuck up. And the hospital just sounded an alarm for a disaster drill. The unit manager informs the nurse that they need to make room for potential mass casualty admissions. The nurse is given 4 clients and must decide who to prioritize for discharge to accommodate new admissions. Who should be considered first for discharge, right? So who is the most stable to get rid of for the potentially unstable people that are going to be coming into my emergency room, all right? That's how you have to think about that because we're doing a mass casualty. I have no idea who's coming in, okay? Is it A, a middle-aged client with a history of being ventilator dependent for over 7 years and admitted with bacterial pneumonia 5 days ago? Or is it B, a young adult with diabetes type 2 for over 10 years and admitted with antibiotic-induced diarrhea 24 hours ago? You already know the deal. A elderly client with a history of hypertension, cholesteremia, and lupus, and was admitted with Stevens-Johnson syndrome this morning, or an adolescent with a positive HIV test and admitted for acute cellulitis of the lower leg 48 hours ago. So who we getting rid of first? Who need to go home? Like, you ain't got to go, but you got to get the hell up out of here. Say B, okay. Says D. That sheet says D, okay. Appreciate all the likes. I love the likes. Y'all keep smashing it. D, okay. Say D for question mark. All right, so think about it. Hey, so this is essentially would be like a disaster / management of care question. So who do I get rid of first? Who is the most stable for me to get rid of, right? Think about it. This is where your clinical judgment. A lot of people are saying, you say ABCs, right? So yeah, think about ABCs, level of consciousness, ABCs, right? But you got to think of like, hey, who is the most critical? I'm gonna give y'all about another 20 seconds. ABCs, ABC. It's the easiest 1, 2, 3. All right, we got A. Remember, hey, so there's another term. Avery, where you at? I need for you to help me with this one. RTFQ. RTFQ. Who should be considered first for discharge? Who is the most stable to go home? Yeah. Hey, remember, if you can't 100% definitively tell me why you changed an answer, you better not change it. You say A? Okay, cool. Here we go. Here's the answer in 3, 2. The answer is A. A middle-aged client with a history of being ventilator dependent for over 7 years and admitted with bacterial pneumonia 5 days ago. The best candidate for discharge is one who has a chronic condition. I know that was a toughie. That's a tough one. I ain't even gonna lie to y'all. That's a tough one, right? Where were we at? Best candidate, yeah, chronic condition and is most familiar with their care. This client in option A is most likely stable and can continue medication therapy at home. So has a middle-aged person with a history of being ventilator dependent for over 7 years, right? So that's a chronic issue that they have. And they were admitted for bacterial pneumonia 5 days ago. 5 days ago. And they're already on antibiotic therapy. Yeah, that's tough. 5 days ago, key word for sure. Yep. Hey, what was the other answer that y'all picked? I saw some people pick D. Some people picked, I didn't really see, and some people picked B because they were just like, whoa, you know, the type 2 diabetes aspect. But that antibiotic-induced diarrhea, gonna get to that C. diff. We're going to get to that C. diff, right? So, hey, these are the key things. I'm going to break this question down real quick. I know y'all are going to start rushing me. But the key things that you have to remember, right, when it comes, if you don't understand what's going on in the question, read your answer choices because a lot of the times the answer choices will pop right out to you, okay? But key words, middle age, they were ventilator dependent for 7 years, and they were admitted 5 days ago with this issue, right? If they, like, by the time they come in, if they're ventilator dependent on bacterial pneumonia, they would have already started antibiotics. And by this time, they would have been able to go home. Okay? So think about that. Here we go. Question number 8. Appreciate all the likes, all the follows. Make sure you guys smash that like button, follows. Hey, I need 10,000 people to be my friend. I'm just saying. Here we go. Question number 8. A 25-year-old male is seen in the endocrinology clinic for unexplained fatigue, weight gain, and low energy levels. After a series of diagnostic tests, he is diagnosed with hypothyroidism. Hypothyroidism. Okay, key word. Think about it. What does it consist of? The healthcare provider prescribes levothyroxine or Synthroid 50 micrograms per day by mouth. As the nurse educates the client about the medication, which point should be emphasized? So what is the most important thing that I need to tell the nurse? That I need to teach the patient when in regards to education? Should be taken in the morning, may decrease the client's energy level, must be stored in a dark container, or will decrease the client's heart rate. Okay, all right. Got some A's. I want to say A, but A, it's okay. This is why we practice, baby. This is why we practice around here. All right. Sheena says A. Okay, we got A's all around. Umar, Maine. I was about to say Dr. Umar. Got A's. I'm gonna give y'all about another 20 seconds. Mandy says A. Alex says D. Okay. Sergio says A or B. It can't E. It has to be one. There can only be one. Well, technically they may be all wrong, but these are the only answers that you get. Don't do that, Joanna. A, as someone who works in endocrinology clinic. Ah, come on. Okay, all right. That's kind of cheap, but increase heart rate, I think. All right, here we go. Here's our answer in 3, 2. It is A. Should be taken in the morning, right? It should be taken in the morning. Levothyroxine has a side effect of insomnia. Taking it in the morning could prevent interfering with the client's sleep patterns. Hey, there you go. You said fine A, Sergio. Come on, guy. Come on. Hey, you got A. Put it this way. Have the confidence to answer your question, but don't you ever change it. Don't you ever change it unless you 100% can tell me why you are changing it. I should be taken upon walkthrough. What? I don't know what that means. I'm lost. All right, here we go. Question number 9. Appreciate everybody. Hey, we're doing NCLEX questions right now. My name's Kevin. I go by the Boot Nurse. Make sure you guys like, share, smash that like button, and follow me because I need 1 million follows so I can stream, so I can be unghetto. Yeah, I want to know who you are, where you're from, where you're at in your nursing journey. So let us know down in the comments. Here we go. Question number 9. A 3-year-old child was brought to the pediatric clinic after the sudden onset of findings that include irritability, thick, muffled voice, croaking on inspiration, hot to the touch, sit leaning forward, tongue protruding, drooling, and suprasternal refraction. Like they literally just gave you everything. What should the nurse do first? Is the priority question. What is the very first thing I should do, or my patient's gonna die? All right. So is it prepare the child for X-ray of upper airway, examine the child's throat, collect a sputum sample, or notify the healthcare provider of the child's status? What is the very first thing I want to do? Got B's, got some D's. D. Okay, I got you. There's only one D. You ain't got to put so many. I got you, though. I'm picking up what you're putting down. This is epiglottitis. Okay. B, because of airway. Okay, all right. I like it. B is the first, but is a priority. So this is a priority question. Who do you see first? Or what do you do first? I'm going to give y'all 15 seconds. Got to maintain that airway. Okay. All right. Macy says she thinks it's D. ABC first, airway issue for sure. Okay. All right. Appreciate the follows. Thanks, Sammy, for the follow. It's B. All right, here we go. In 3, 2, and the answer is D. And let me tell you something right now. You may not agree. You may not agree with what these are, and that's okay. This is why we practice. All right. Jess is saying, what? Right? This is why you read the rationales. Right? I can tell you right now, I could give you 100 questions. Right? But if you don't answer them, out of those 100 questions, there could be 5 or 10 of them that are just out of this fucking world. Right? This is why you got to read the rationales. You may not agree with them, but this is what they are. I'm using, what is this? This is nurselabs.com. So it's D, notify the provider. These findings suggest a medical emergency and are due to epiglottitis. Right? Any child with an acute onset of an inflammatory response in the mouth and throat should receive immediate care. Of course they should. Right? This is contradicting everything I've learned as an EMT. Let me tell you something. I'm a hospital corpsman. I've been in the Navy for 16 years. I've been on 2 deployments. It contradicts everything that I've ever learned. Because I would have been like, hey, let's maintain that airway. But they said, hey, we need to call the doctor. But you got to think, what is the very first thing that you should do? Hey, I'm going to call the doctor, maintain airway. Because you got to think, we already know that this is happening. We already know that they have they laid out everything. Wouldn't immediate care be the airway? I would agree with you because I would have picked that. Right. But it's not about what I want. It's about how the questions are laid out and what they say. All right. What website can I use for medical assistant? Right off the top of my head, I'm not sure. NCLEX, and that's another thing. NCLEX is all about perfect world. I don't care about how you feel. I don't care about what you say. I don't care about you complaining about it. NCLEX is perfect world. NCLEX is perfect world. Even with the new generation NCLEX, with them giving you scenarios, doesn't matter. Okay? Does not matter at all. All right, here we go. Question number 10. A concerned mother brings her 8-year-old son to a pediatric clinic. She has noted that her son is constantly thirsty, eats more than usual, and has lost some weight despite increased food intake. Given these observations and suspecting diabetes, which symptom is most likely to prompt parents to seek medical evaluation for their school-aged child? Is it polyphagia? Is it dehydration, bedwetting, or weight loss? It's blurred. I'm sorry. Here we go. See, this is why I said y'all got to follow me because I got to unghetto. There we go. Is that better? Got A, got C, weight loss. Okay. Okay. All right. That should be better for y'all. Focus. I got you. I better stop yelling at me, okay? Stop yelling at me. All right, here we go. We got D's. We got A's. Okay. All right. A, C. Hey, remember, and here's the thing about NCLEX. You're not going to get them all right. You're not expected to get them all right. If you got every question right, they're going to start pulling out questions you've never heard before, and then you're really going to be mad. D, this is a strange question, okay? All right, I'm going to give y'all about another 15 seconds. All right, appreciate the follows. Appreciate the follows. What else we got? We got A, we got C, bedwetting for school. Okay, all right. C or D, depending on the parent. It ain't depending on the parents. It depends on the question. Answer the question. All right, here we go. In 3, 2, no, it's A. I lied. All right, look, here we go. It's C. It's bedwetting. So A is wrong. The real question is what's making him eat so much? Well, they said it's because he has the type 1. The first symptom of type 1 diabetes in children is bedwetting. Bedwetting in a school-age child is readily detected by the parents, right? Polyphagia and extreme hunger is one of the common symptoms of diabetes. So that's why, like, hey, why is the hunger? It's because they've developed diabetes. Yeah, wow. This is why I don't like tests. So here's the thing. All of y'all are going to be nurses if you're not already nurses. I promise you, even when you go up for credentials, like certification exams, like CCRN or CN or CEN or whatever, the questions are going to be worded like how the NCLEX are going to be. I'm just letting y'all know. All right, just letting y'all know right now. Hey, so we're taking another break. It looks like I have them every 5 questions. All right. So hey, check this out. We're doing NCLEX questions. These are specifically for the RN, but if you're an LPN, let me tell you something right now. The only thing you really need to understand is your role, what you can and can't do, your roles and responsibilities. And then you're able to answer any kind of question because let me tell you right now, all of the content that you learn in LPN school is the same shit that you learn in RN school. It's just all about how you apply it to you and what you can and can't do, your roles and your responsibilities. All right. Hey, so we're doing NCLEX question. Participate. I'm kind of funny. I talk a lot. I love to talk. That's obvious. There's no other way for me to kind of communicate with y'all, okay? So the more likes and gifts that I got, the more questions y'all got. I may have 25 questions. I may have 50. Hell, I may have 100. I don't got 100. But so yeah, give me all them likes. Hey, don't troll my chat. You come into my chat and you act a fool, I'm going to give you a 600. A 600 is a ban. If I ban you, that's that ass. And I'll ban you forever. So don't be rude, all right? And if you decide that you want to tell me to go on to the next question, make sure you give me a smiley face or some love or something like that. You know what I'm saying? So I don't gatekeep. I got these questions off nurselabs.com. Okay, got them off nurselabs.com. I am also going to be on a nursing school summit, which is presented by True Learn and Picmonic. That link is in my bio. Once you hit the link tree, it's the one at the top. You can register for it. It is free to do. So go out there, get that information. I'm one of many panelists, one of many nurses that are going to be doing it. So much information is going to be done. And you already know, if y'all come to my lives a lot, nothing's going to change. I don't give a damn who's sponsoring it. I go up there and I act a fool. That's what we about. All right. 7-day NCLEX course. That's an NCLEX course I created. I failed my NCLEX 3 times, y'all. 3. And that's why I created it, because I never want nobody to feel how I felt. So I put all the information that I want, that I know is relevant for you guys. Also, links in the bio. It's $48. Once you get it, it's yours forever. Also, check out thehootnurse.com. It's kind of cool, too. So here we go. Question number 11. I'll let y'all read that. I'm going to look at some of y'all's questions because I don't want y'all to think that I'm ignoring y'all. Appreciate all the love. I'm so glad I came across this. Love Jordan. Jordan, I appreciate you being here. Thank you for the love. How do I like what, Lisa? Can you be an online LPN? I think they do have LPN in online schools. The road to an RN is so hard in my state. Oh my God. Hey, hard, but not impossible. Back to nursing school on Monday. Glad I came across your live. I'm glad, Emily. I'm glad you're here. Have you ever used UWorld? Yes, Christine. I've used UWorld a lot. You're awesome. No, you're awesome. I failed my NCLEX 3 times. All right, cool. So my question is, what are you going to do? What are you going to do about it? Is this good for NGN? Yes, it is good for NGN. What was the last answer? I don't remember. I see B's, 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 B's. All right, I think I'm caught up now. A. All right, cool. So we're all caught up. I'm not even going to read it. Y'all already told me. I see A's and B's. Struggling with fundamentals right now. Fundamentals, you must be right at the beginning. Hey, are you telling me? Donut. Hey, don't do that. Don't be rude. You must have just got here. So the answer is C. It's chlamydia, right? It's one of the most frequent causes of salpingitis or pelvic inflammatory disease. Could come up or could travel up towards the vagina or cervix or into the reproductive organs. So that is the answer. Wow, I could totally be a nurse. I've never studied anything medical, and I'm guessing he's all right. You want to come be a nurse? Hey, Alex, you can come be a nurse and come get this work. You can come. Chlamydia can make you infertile. Yep, it sure can. Alex, you can come and be a nurse and get this work because it will work that ass. Hey, physiological adaptation. That is the second largest section on the NCLEX, y'all. Second largest section. Come take a patient assignment then. That's what I'm saying, man. Hey, come do these COVID patients where I had 3 vented patients and I had a walkie-talkie. You can come do this work if you want. If that's what you think. Me as the EMT. All right, here we go. Question number 12. Hey, I appreciate all the love, the likes, and the follows. Y'all keep smashing them. An experienced registered nurse specialized in spinal rehabilitation is floated to a busy emergency department for a shift. Among the patients waiting, which client should the charge nurse most appropriately assign to the RN? Right, so they're in a new section. So how do we treat them? A middle-aged client who said, I took too many diet pills and my heart feels like it's racing out of its chest. Is it B, a young adult who says, I hear songs from heaven? Me too, guy. I need money for beer. I quit drinking 2 days ago for my family. Why are my arms and legs jerking? An adolescent who has been on pain medications, terminal cancer with an initial assessment finding pupils and a relaxed respiratory rate at 11, or an elderly client who reports having taken a large crack hit. 10 minutes prior to wow, my man hit a large crack hit into the emergency department. So we got D. Okay, D. We got some B's up in here. I just passed my NCLEX, but I love watching these. Ellie, you just passed your NCLEX. I'm so glad you're here. Hey, everybody show Ellie some love. Give her flowers right now. Stop answering and give her flowers right now. I hear songs from heaven. Oh, get that crash cart. You ain't lying. B for sure for someone who's been, okay, all right. B is my second choice. I don't want your second choice. I want your first choice. I'll give you 20 seconds. I'll give y'all 20 seconds. Does C have a DNR? Doesn't say anything about a DNR. Don't throw that in. Don't give extra information because once you do that, you'll mess yourself up. All right. Go, Ellie. What kind of nurse? Yep. Shout out to Ellie for being, hey, welcome to the shit show, Ellie. I mean, welcome to this great lecture that we're doing. I love that you're here. Yep. Don't overthink it, y'all. Don't put other information. And the answer is C. An adolescent who has been on pain medications, terminal cancer with an initial assessment finding pupils and a relaxed respiratory rate of 10. Nurses who are floated to other units should be assigned to a client who has minimal anticipated immediate complications of their problem. This client exhibits opioid toxicity with the pinpoint pupils and has the least risk of complications to occur in the near future. Wow. I know that's wild, right? Because you got to think, I am pulling a nurse from a unit who has never worked in the emergency department. So the most critical people I want to give to the emergency department staff, and I want to give the most stable patient to my floaters. That's what you want to do. Oh, wow. Zoe. Hey, is cardiac D, is cardiac and B has to do procedures. Okay. Oh, awesome. That was actually my reasoning. Yeah, that's true reasoning. True. Dang, I didn't think about that. Think about that. If you are even, I could be an experienced nurse, but I mean, I'm an experienced nurse and I work in the operating room. But if you send me to labor and delivery, I'm a fold. And that's a management of care question, by the way. Management of care. All right, here we go. Question next. Next question. I didn't read the question right. Avery, where are you at? Hey, I need everybody to let me know what RTFQ means. I'm going to say it all the time. RTFQ. Hey, I want to know. I want everybody to tell me right now before I see RTFQ. What does it mean, Avery? What does it mean? And you can say the bad word. You can say it. Oh my God, what is it? I ain't gonna tell you. RTFQ. I'll let Avery tell you. Avery is my she's the read the there you go. There, yes. Read the question. All right. Just like I'm about to do. Question number 13. A 60-year-old male client is admitted to the cardiology ward following an angioplasty for coronary artery disease. Nutrition education is a part of his discharge planning. What dietary advice should the nurse prioritize? Is it 3 balanced meals a day, add complex carbs, avoid having heavy meals, or limit sodium to 7 grams per day? Right? Got D. Got D. Hey, RTFQ means read the F in question. Read it. Read it. And once you don't understand it, read it again. And then once you read it, if you don't understand it, read the answer choices, because the answer choices really could help you understand what the question is actually asking you. Appreciate all the love, all the likes, all the follows. Make sure you guys smash that like button. The more likes I get, the more questions y'all get. I may have 100 questions. I don't, but I might. So I'm just saying. Make sure y'all follow. Hey, I need more people to follow me. I need 10,000 people to be my friend. The more people that follow, the more I can unghetto myself and do it from the computer. I'll give y'all 10 more seconds. If you know what everyone knows, you're good, right? That's the point. The biggest thing about NCLEX is you need to know what everybody else knows, right? And even if you don't know it, you need to apply what you do know, okay? Here we go. Answer is A. I'm sorry, it's C. I said A because I saw avoid. It's C. Avoid heavy meal, very heavy meals. Large or eating large heavy meals can pull blood away from the heart for digestion and is dangerous for the client with coronary artery disease. Too much plaque may accumulate in the arteries and block the delivery of blood and oxygen in major organs of the body. You. That's okay, Coco. That's all right. That's okay. 7 grams. 7 grams is too much, y'all. Yep. So what does it say right here? So question number C, I'm sorry, question C, where it talks about they want less than 1.5 grams per day of sodium. I got it right. And I'm a nurse. Wow. Anna, you're a nurse now? Or are you a nurse now? I don't know. Let's give you one of these assignments and let's see how well you do. All right, here we go. Question number 14. A 45-year-old patient in the intensive care unit has a pump set to deliver a basal rate of 10 milliliters per hour of morphine plus PRN doses for breakthrough pain. Which observation indicates that the pump may not be functioning correctly? The client complains of discomfort at the IV site. The patient states, "I just can't get relief from my pain." The level of the drug is 100 mLs at 8 a.m. and is 8 mLs at noon, or is it D? The level of the drug is 100 mLs at 8 a.m. and is at 50 mLs at noon. B. We got B's. We got B's. Okay. What else we got? The fabulously sad person with the B word says A. Jackie says B, baby. All right, girl. I see you. All right. Hey, if y'all are new here, we're doing NCLEX questions. I don't know how B could be wrong. You know what? I just don't understand it either sometimes, because I'll be like, yo, that's right. And I'll be like, how is that wrong? Look, I'm telling you right now, every educator, they are not perfect. Let me tell you. All right, here we go. I'm gonna give y'all 10 more seconds. They are not perfect, and we get questions wrong. I did an NGN quiz last week, and I got very high to pass, but I still missed. I know I missed like at least less than half. All right, and the answer is C. Remember, it says it's not function. Yes, who said that? Not functioning properly. Who said that? Oh, the pump. It's C. Why are you crying? It's a math question. Kinda. C, it's about the pump not being effective. Hey, remember where I said RTFQ? So what is the biggest? So hey, which observation indicates that the pump may not be functioning correctly? Right? And the answer is letter C. The level of the drug is 100 at 8 and 8, or at 80 at noon. The minimal dose of 10 mLs per hour, which would be 40, in a 4 hour period. Only 60 should be left at noon. The pump is not functioning when more than the expected medication is left in the container. You got it right, but still, I'm trying to. Hey, look, studying for the NCLEX will upset you. It'll upset you, and honestly, that's what it's supposed to do, right? But, and I do say but, a big old but is you can't let those few distract you and deter you while you're pushing through doing your 85 to 150 questions a day or every other day. God, I love IV caffeine, right? It's delicious, ain't it? All right, here we go. Question number 15. During a community meeting on health promotion, the nurse is asked about the effectiveness of chiropractic treatment for various alignments. In response, what should be the focus of the nurse's answer? Electrical energy fields, spinal column manipulation, mind body balance, or exercise of joints. We're doing NCLEX questions. Hey, if you're new here, we're doing NCLEX questions for nursing, for LPNs and RNs. My name is Kevin. I go by the Boot Nurse. Make sure you guys let me know who you are, where you're from, where you're at in your nursing journey. Make sure you guys participate and answer those questions, all right? So in response, what is the most important thing that we need to focus on when we're answering the patient's question? We say B, spinal column manipulation. Somebody said D, okay. All right, I'm gonna give y'all about 15 more seconds. Hey, I need the likes, I need the shares, I need the follows. Hey, the more that you guys share, the more that you guys follow and like, the more questions you guys get. I think I got 100. I don't. B, please be correct for me. All right, here we go. In 3, 2, and the answer is B. Somebody's over there just like, please, God, please. So it's B. The theory underlying chiropractic is that the interference with the transmission of mental impulses between the brain and body organ produces diseases. Such interference is caused by the misalignment of the vertebrae. Manipulation reduces subluxation. All right, that's a health promotions and maintenance, right? And then, of course, remember, when you read these questions, read the rationale. Even if you got this question right, read it, because somebody's like, hey, please, God, hey, God, it's me again, right? So you need to read them, and then also read the rationales on why they are incorrect, okay? Here we go. Do you also do something for T's? I just took mine and passed, but that was for me. I don't do anything T's related. I don't do anything T's. I don't do anything HESI. I hate HESI, actually, if you want to be completely honest. You pass your, well, who's that? Pass my NCLEX. Thanks for your help. Ma'am, hey, let them know. Let them know. Hey, shout out to you is O Baker. She passed her NCLEX. Y'all give her flowers. I need all 400 of y'all to give her flowers right now. Stop playing games with me, okay? So, hey, we're doing NCLEX questions, y'all. My name's Kevin. I go by the Boot Nurse. We're doing NCLEX questions. This is good for RNs and, of course, LPNs. Make sure you guys participate. All right, participation is the key. I need them. I need that participation, y'all. I need for y'all to smash that like button. I need for y'all to share it, and I also need for y'all to follow. I need 10,000 people to follow me, man. That way I can start streaming off of the computer. All right. I want all of them likes. Give them to me. Don't troll my chat. If you troll my chat, I'm gonna ban you. That's simple. I got these questions from nurselabs.com. They're really great. They have a bunch of test banks out there, as well as if you're a nursing student just started school, they have nursing diagnosis. They have all that good stuff over there for your care plans. All right. I will be doing a nursing school summit presented by True Learn and Picmonic. That's going to be on October 1st. That link is in my bio. Click the link tree. It's the first one up top. It's free to register. Go be a part of it. Come be a part of the greatness, because I act a fool here. I will act a fool over there. I'm just letting y'all know. 7-day NCLEX course in its pre-launch phase. Check that out. Link in my bio. Whoever sent me that. Pearly, thank you for the heart. I appreciate that. 7-day NCLEX course. It's my NCLEX course I created, full of content right now. You're getting the new generation NCLEX stuff up and running. And links in my bio. It's for $48. Once you get it, you get it. It's yours forever. And also check out thebootnurse.com. It's cool over there too. Here we go. So question number, can we continue? Look, I don't know. You in a rush? You better take your phone with you. My God. Lord of mercy. All right, here we go. Question number 16. A 55-year-old client is admitted to the neurology unit after a right-sided cerebrovascular accident. The nurse is performing a neurological assessment. What finding should prompt the nurse to take immediate action? Which means, like, what do I need to do? What is first? Decreased level of consciousness, loss of bladder control, altered sensation to stimuli, or emotional liability. We got A's. A's. Monica says B. Okay. SB says A. Is it Angeline says C, I think? Is that what she said? She did say C. Okay. Queen B says B. It's a fam. Okay. Got C. Ebony screaming C. Okay. A or C. Hey, Vicky, it's either or. Which one? Which one are we doing? Which one are we doing? All right. I'm going to give you all about another 15 seconds. Call it. Call it. This fucking guy. Oh, my God. You can't just call it just yet. All right. Here we go. In 3, 2. The answer is A decreased level of consciousness. A further decrease in the level of consciousness may indicate an increase in intracranial pressure, leading to inadequate oxygenation of the brain. A decrease in LOC may also reveal the presence of a transient ischemic attack, which may warn of a impending thrombolytic CVA. Okay, increase. Yeah, it is bad. Increase ICP, bad ICP. Reperfusion injury. So shout out to everybody that got that question right. Hey, if you got it wrong, this is where you got to learn it. All right. Hey, physiological adaptation. That is a section of which it follows. Appreciate. Oh, wait a minute. Y'all gave me all the hearts. Appreciate you, sassy. Whoop, whoop. Glad I'm a nurse for 14 years and getting most of these correct. Hey, look, Crystal, you on it. You on it. Here we go. Question number 17. So the answer is LOC, potassium monitor for vitals. Well, yeah, we'll just say LOC since that was the only answer that was there. So that's cool. Appreciate all the follows. All right, here we go. Question number 17. A 6-year-old child has recently been diagnosed with cystic fibrosis. All right, now I need for y'all pathophysiology. Then you probably tell me what that is. And is at a pediatric clinic for an initial assessment. Considering the early age or the early stage of this disease, what later stage symptom would the nurse not expect to observe at this time? Right? So 3 of these the nurse is going to expect, but there's one of them that the nurse is not going to expect. So what is it? Is it positive sweat test? Is it a bulky, greasy stool? Moist, productive cough? Or is it meconium ileus? Right? Whose favorite word in here is moist? Because I know some people don't like that word and they get triggered. I thought it was D, was a baby first bowel movement. I could be wrong. Okay. C seems fishy. Is it though? Is it though? Okay, you say D. We say D. Crystal, I thank you for the like. Oh, I'm sorry. Thank you for the follow. Appreciate everybody jumping in here. We're doing an NCLEX question. That word is, oh, you don't like, who said that? Who said that? Tiana, you don't like that word? Now I'm going to say it to you the whole time. I'm just going to add the word moist everywhere. I'm just playing. All right, I'm going to give y'all 10 more seconds. All right, Karen says C. Brittany says C. Okay. All right. Appreciate you. Thanks for the love. Thanks for the heart. All right, here we go. Answer in 3, 2. No, that and secretions. Secretions are great. Oh my God. So the answer is C. Hey, look, that's all we do is have fun out here. RT says A. Oh, RT, you're wrong. All right. Here we go. Noisy respirations and a dry, non-productive cough are commonly the first of the respiratory signs to appear in a newly diagnosed client with cystic fibrosis. The other options are the early findings. Cystic fibrosis is an inherited condition affecting the cells that produce mucus, sweat, saliva, and digestive juices. You know, those moist things. I'm sorry. Normally these secretions are thin and slippery, but in cystic fibrosis, a defective gene causes the secretions to become thick and sticky. Instead of acting as lubricants, the secretions plug up tubes, ducts, and passageways, especially in the pancreas and lungs. Respiratory failure is the most common or the most dangerous consequence of CF. I'm sorry, y'all. Look, as soon as she said secretions, I swear they popped up like 3 or 4 times and I couldn't stop laughing. You know what? We're going to fight. Look, hey, fisticuffs. I'm just saying. All right. Here, that's so fun. Hey, physiological adaptation, y'all. That's the second largest section on NCLEX. So don't be surprised if you see a question that is like this. All right. Here we go. Here we go. Question number 18. All right. During a home health visit, a nurse arrives to find a male client, lethargic and confused, right? His wife mentions that he fell down the stairs approximately 2 hours ago, but had seemed fine immediately after. Which action should the nurse take? Select all that apply. So you better select them. Select all that apply. Right? Hey, if I can't answer you guys' question down there, make sure you guys answer each other's questions. That's what the chat is for, baby. Make sure y'all do that. All right? Is it place a call to the client's healthcare provider for instructions? Send him to the emergency room for evaluation. Reassure the client's wife that the symptoms are likely to be transient and will resolve soon. Instruct the client's wife to monitor his condition and to call the doctor if symptoms worsen, or assess for other signs of head trauma like pupil dilation and irregular breathing. B and E, breaking and entering. Oh, okay. All right. DEB. Okay. DEEB. EBT. Shout out to the food stamps. I wish I had some. Hey, I'm gonna give y'all about another 20 seconds. Shout out to everybody that's in here. We're doing NCLEX style questions. My name is Kevin. Been a nurse for about 3.5 years, y'all. I worked in ICU. I worked in the OR. So yeah, got a little bit of background. Don't collect $200. Okay, girl, I see you. All right, here we go. BDE. All right, make sure you guys like, share, follow. The more likes, the more shares, the more follows, the more questions y'all get. Here we go. Answer. Remember, select all that apply. And 3, 2, took that NCLEX today. Oh, we about to talk about that, Audrey. All right, the answer is A, B, and E. A, the healthcare provider should be contacted immediately for a situation like this where a fall and altered mental status is reported. B, given that the patient has shown signs of lethargy and confusion post-fall, immediate emergency evaluation is necessary to rule out potential complications such as the brain injury. And E, other signs of head trauma could give more complex to the severity of the fall. So this should be part of the immediate assessment. Who just said, was it Aubrey? Aubrey, you just passed your NCLEX? Is that what you just said? Hey, shout out to y'all. Shout out to all y'all. That's what you said. All right, Candy, I heard you. I'm doing bad today. Avery, it's okay. We all have our bad days. I promise you. Hey, Aubrey, that's what hey, everybody right now, all 300 plus of y'all, give Aubrey her flowers. Show her some love. Tell her welcome to the shit show. You know what I'm saying? Welcome to it, because that's what it's about. Everybody want to be a nurse until it's time to do nurse shit. You know what I'm saying? I'm just keeping it all the way 100. I love y'all. I appreciate y'all. Here we go. Remember, physiological adaptation. Physiological adaptation, y'all, second largest section. I will always recommend that. All right? Smash that like button. Here we go. Question number 19. A client is scheduled for a KUB, which is a kidney, ureter, and bladder X-ray, okay, in an outpatient setting. Which of the following actions should the nurse take to adequately prepare the client for the test? Select all that apply. She said, "Welcome to hell." I cannot. Do you want to instruct the client? Instruct the client that they must be NPO for 6 hours before the examination. Administer an enema the evening before the exam. Administer furosemide 20 milligrams IV half an hour before the examination. Inform the client that no special preparations is needed for this exam. Or is it E, ask the client to drink fluids and empty the bladder just prior to the examination? I just started the what? You just started the what? I just started my first semester in nursing school. Ashley! You just started your semester? Hey, you got a long way to go, but that's okay. Got A and C. Nisha says A and C. Hey, if you guys are just now joining, we are doing nursing style questions, NCLEX questions. All right. Make sure you guys like, share, follow. Smash that like button. Hey, I need at least 10,000 people to follow me. I think I'm close. I'm at like 7,000 followers. I need at least 10,000 so I can stream from the computer. So got A. Hey, remember guys, this is select all that apply. And of course, and in case you didn't know, select all that apply questions are now these are part of the partial credit. Hella confusing. Staying girl, staying gal. Girl, I see you up in here. I see you. A and B. I'm going to give y'all about 10 more seconds. 10 more seconds, y'all. 10 more seconds. You're welcome, Ashley. All right, here we go. And 3, are these NGN? I'm going to, yes, these are essentially NGN, but I'm going to explain a little bit more about what NGN is. All right, here we go. So the answer is D and E. Usually KUB x-rays do not require special preparations such as being NPO or receiving an enema. There are no special orders for this procedure. However, the client must be instructed of the general rules during x-ray test. Remove any clothing, jewelry, or objects that may interfere with the test. Drinking fluids, like just moist fluids, and and emptying the bladder could provide a clear, but it's generally not a stringent requirement. They are contradicting each other. Hey, I didn't make the rules. However, like I said, if we did 100 questions and there were 10 of them that just didn't feel right, you still have a 90%. Still have a huge chance of getting through those. All right. Hey, I got this one right too. Okay, shout out to you, Lara. I see you, Gary. I see you out here. Hey, so I want to explain something about the new generation NCLEX. I'm going to go on to the next question. All right. So here's the thing about yes, they are. I thought just the select or apply. So the new generation NCLEX, all of the old type of questions or the old question types such as this one, like select all that apply, multiple choice, dosage calculations, they're all still there. They haven't gone anywhere. The biggest thing that has entered there, it is the case studies. The case studies, the multiple responses, the highlights, the close, the fill in the blanks, stuff like that. They haven't, your multiple choice ones aren't going away. As a matter of fact, 70% of the NCLEX is still multiple choice. All right. So don't get it confused. If you guys decide to register for the summit, this is what I go over. I'm going over the new generation NCLEX. All right. Partial credit for SATA. Yep. Facts. All right. Y'all are already answering. So I'm going to just give y'all about another 15 seconds. Hey, I appreciate all the love, all the likes, all the follows. Make sure y'all smash that like button. Make sure y'all share. The more shares, the better. It gets out to more people. All right. Today's Friday. We're going to be here for a while, baby. We're going to be here for a while. Here we go. Here's our answer in 3, 2. And the answer is B. When you climb 2 flights of stairs without a problem, it is generally safe. This is a risk of cardiac rupture at the point of the myocardial infarction being about 6 weeks. Scar tissue should form about this time. Waiting until the client can tolerate climbing stairs is the usual advice given by healthcare providers. Anger management taught me that one. Thanks, Keanu. I'm done with nursing school in 6 months. I have 5 classes left. Shout out to you. Is it Gabriel? Gabrielle? I'm assuming it's Gabrielle. If it's Gabrielle, just give me like the number 2. Sometimes you got to be blunt with them. That's right. You do have to be blunt with them. I'll give you an example. My grandmother has coronary artery disease, and she didn't want to take her meds. She didn't want to listen to anything that I wanted to say until I had to turn off grandson and turn on nurse, and then she really wanted to pay attention to what I was saying. So I'm just being all the way real. Hey, if you're new here, we're doing NCLEX style questions. Therapeutic communication, right? You're right. It will only get you so far. It will only get you so far. All right, here we go. Remember, hey, health promotions and maintenance. All right. Hey, break time. So we've already done 20 questions. I appreciate everybody for hanging out. I appreciate everybody participating. Keep participating, right? Hey, make sure you guys smash the like button. Make sure you guys share. Make sure you guys follow. All right. Biggest thing, I need the shares. I need the follows. I need people to love me. Okay. I need all the likes. I need them all. Give them all to me. Don't troll my chat or I'm going to ban you. I got these questions from nurselabs.com. I saw somebody else say something in there about UWorld. UWorld, they have really good questions. So does Archer. I can recommend any review out there because I probably have used it all. Not even gonna lie to you. So also I'm doing a nursing school summit, which is presented by TrueLearn and Picmonic. That's going to be on October 1st. Link is in my bio. Go over there to register. Registration's free, doesn't cost you anything. And I'm going to be going over I'm going to be going over the new generation NCLEX, y'all. Like the new generation NCLEX, I already have PowerPoints inside of my review, which is the 7-day NCLEX course. It is in its pre-launch phase. It's $48. Once you get it, it is yours forever. Can you repeat the review websites one more time? I'll get back to it. Also check out thebootnurse.com. But yeah, they got Remar, they got Mark Klimek, they got mine. Right? They got freaking UWorld. They got Archer. They got Kaplan. They got so many of them out there. Karen, when is what? Okay. All right, here we go. Make sure you guys go over there and you check out all the. Hey, if you guys want to know about anything, go over to my link in my bio, my link tree, and everything that you need to know is in there. I have Kaplan. It's great. I used Kaplan when I was in school. As a matter of fact, I used Kaplan and I made a review about them. I liked them so much. So you guys can go over there. Check me out on YouTube as well. Question number 21. In the emergency department, a triage nurse is faced with 4 clients arriving within a 15-minute window, each presenting with distinct symptoms. Given the symptoms and potential severity of each case, which client should the triage nurse prioritize to be seen first? Who am I going to see? I don't even know why I just hit my desk. My bad. Who am I going to see first? If I don't see them first, they're going to die. All right? How often are you on here spreading the love? Ma'am, I spread the love 3 times a week. Monday, Wednesday, Friday. 5:30 Central Standard Time, Texas time, 'cause that's the only time that matters. So Macy said, I'm a medical student and I enjoy this life. That's what I'm talking about. Macy, what kind of doctor are you going to be? Tell us right now. A 2-month-old with a history of rolling off the bed with a bulging fontanelle when crying. A teen who got a singed beard while camping. Okay. All right. So think about this. Think about what is being presented to you. An elderly client complaining of frequent bowel movements, and then a middle-aged client with intermittent pain behind the right scapula. Back, what is it? Back at it with the increased ICP. All right, Tiana. B, airway. Barb says airway. Night nurse says airway. Coco says A. All right. B, burn will cause so many issues. Hey, I worked in a burn ICU for 6 months, and I definitely already know what the answer is. A is obvious? Maybe. Right? All right, I'm going to give you about 15 more seconds. Age doesn't matter. Boom, the paramedic gets the nurse question. That don't mean nothing. I got paramedics. I got med students that come in here. They're just like, what's the answer? All right, here we go. In 3, 2. And the answer is B, a teenager with a singed beard while camping. All right, the client is at greatest. Oh my God. This client is in the greatest danger with the potential of respiratory distress. Any client with singed facial hairs that is exposed to heat or fire in close range could have severe damage to the interior portion of the lung. Note that the interior lining of the lung has no nerve fibers, so the client will not be aware of swelling. Yes, it's an inhalation injury, right? I'm gonna be all right. Anybody that has a burn to the face, or if they're burned more than 15% of their body, they're gonna be considered an airway compromise. And so think, I had a flame blow up in my face, right? And it singed my nose hairs. What do you think it's gonna do to my airway? What do you think it's gonna do? Yes, Candy, the airway, right? Next thing you know, you're gonna start hearing shit like this. That's what you're gonna hear. Then they're gonna start being stridorous, right? So that airway is gonna start to close up on you. And then by that time, yes, stridor. By that time, you're gonna be like, oh shit, I guess I should have done something, right? So you want to get them intubated as fast as possible to protect their airway. I'm telling you right now. All right. Here we go. Shout out to everybody that answered. It says prepare for later issue within 24 hours, I believe. No, that answer was wrong. Yep. Here we go. Question number 22. You're a pediatric nurse. Not really, but you're a pediatric nurse working with a family who has recently adopted a 2-year-old named Mia. This is the family's first time adopting, and they are particularly concerned about ensuring they provide the right environment for her developmental needs. Mia is an active toddler who loves exploring, but has had minor falls. During your nursing education session, because all nurses are educators, you emphasize the importance of balancing safety, exploration, and skill development at this stage of Mia's life. Which of the following statements made by Mia's mother indicates that she has a clear understanding of her daughter's developmental needs at this age? So what is she saying that is correct? We agree with it, right? So what is it? I want to protect my child from falls. I want to set limits on exploring the house. I understand the need to use those new skills. I intend to keep control over my child, aka helicopter parent, right? So what are we thinking? What are we thinking? Hey, if you're new here, thanks for joining. My name is Kevin. I go by the Boot Nurse. Make sure you guys like. Make sure you guys especially share and follow. Okay? I need 10,000 people so I can unghetto myself. All right? So we got B's. We got B's. We got C's, B, but possibly C. Okay? I'll give you about 15 more seconds. It's B, right, Kevin? I don't know, Candy. We about to find out. We about to find out together. Hey, so this is probably one of those good therapeutic communication skills, right? You know, good best responses. All right? Natalie's saying B. All right, here we go. In 3, 2. So the answer is C. I understand the need to use those new skills. Erickson describes the stage of the toddler as being the time when there is normally an increase of in autonomy. The child must use motor skills to explore the environment and develop autonomy. Anybody that has little kids. Anybody? Oh, see, Cass, did you change your answer? Look at you. Anybody that has little kids, like toddlers, like I have an 18-month-old. Let me tell you, this dude puts his hands in the door. He puts his hands in the fan. He be trying to beat up the dog. Like he be trying to touch the stove. He be like hot. That thing hot, daddy. You see what I'm saying? It's just like he be everywhere. All right. So you got to think about it. You got to think about those things when it comes to the age levels of these kids. Okay. All right. Here we go. Safety is always the first priority. All right, cool. Here we go. Remember, health promotions and maintenance. Health promotion and maintenance is one of the lower sections. I want to say it's like 8 to 12%. All right, here we go. Question number 23. In a specialized medical surgical unit, you're assigned to care for Mr. Johnson, a 72-year-old male who recently suffered a cerebral vascular accident that has led to dysphagia. No, remember your terminology, right? What does dysphagia mean? He is being temporarily nourished through a NG feeding tube. His current medications include anticoagulants, and he has a history of peptic ulcer disease. Given the client's complex medical condition, what is the most important action for the nurse to take when administering an enteric feeding via the nasal gastric feeding tube? So what is the one thing that I could do? If I only do one thing and leave, what would it be? Is it A, verify the placement or the correct placement of the tube? Is it B, check the feeding solution matches the dietary order? Is it C, aspirate abdominal contents to determine the amount of last feeding remaining in stomach? Or is it D, ensure the feeding solution is room temperature? It says A, then C. Okay, ensure that it's star. Okay, I see you. Michaela says A. Paige says A. Is it Pageria? Paige and then Pageria. Hopefully I said that right. Y'all both said A. Okay. All right, got A. Hey, if you're just now joining, we're doing nursing style questions. Make sure you guys like, share, follow, all that good jazz. Got A. I'll give you about 10 more seconds. Beauty says D. Caesar says A. Is it Xavier says A? Okay. A, but I also think D. Okay. A would be, okay, it's already gone. I lost it. Here we go. Answer in 3, 2. So the answer is A. I want to verify the correct placement of the tube, right? Proper placement of the tube prevents aspiration and entrance of food content into the lungs, right? Ensuring the correct placement of the NG tube is critical to prevent complications such as aspiration. Because remember, the NG tube is going where? It's going down the nose, right? Nasal gastric, going down the nose into the stomach, right? Which can be life-threatening, especially given Mr. Johnson's history of a stroke and anticoagulant use. The definitive way is that you want to have the definitive way to know where the nasal gastric tube is with X-ray, right? That is how we know it is in the right place. Another method is to aspirate stomach content and check their pH. Aspirated stomach content can also be tested for bilirubin to confirm it is in place, or it is placed in the stomach. Sorry, I'm all over here, all over the words. So, but yeah, think about that. Gold standard is X-ray. Yep, X-ray is to confirm placement for NG tubes, for trachs, for ET tubes, all that good stuff. You can also put the air in the tube, auscultate. Yup. Normal pH 1 to 5. Usually 1 to 5. All right, here we go. Question number 24. Shout out to all 300 plus of y'all up in here. Make sure y'all like, share, smash that like button, y'all. Smash it. I had 50,000 likes last time. Let's see where we can get, baby. Let's see where we can go. I need all the follows. I need all y'all to like me, or at least pretend to like me. So follow me anyway. Question 24. You are a nurse in a cardiac unit caring for Mrs. Thompson, a 62-year-old female with a history of chronic kidney disease and hypertension. She has been admitted for acute heart failure and has a potassium of 3.5 milliequivalents per liter on the lower end range of 3.5 to 5.0 milliequivalents per liter. Considering her clinical history and current condition, she is placed on a cardiac monitor and receives an infusion of 40 milliequivalents of potassium chloride in a 1,000 ml bag of 5% dextrose in water IV. When monitoring her EKG, Which of the following patterns should prompt you to discontinue the potassium infusion immediately? Do we have a narrow QRS complex? Do we have a shortened PR interval? Do we have a tall peak to T waves, or do we have prominent U waves? We got C's all over the place. Lori Harvey Jr., what's she doing up in here? We got C's, peak T waves, hyperkalemia. Okay, sorry, I'm kind of going back and seeing what y'all are putting. There we go. There we go. We got C's all over the place. I'm going to give you about another 20 seconds. Shout out to all 450 plus of y'all up in here rocking with me. Listen to me run my mouth. Make sure y'all share. Follow. Did they say hyper jalapenos? I've never heard that one. All right, here we go. Here's your answer in 3, 2. And the answer is, of course, tall PT. I kind of gave that answer away because I said, anybody hear me scream tall? Or I yelled tall, like tall. Tall PT waves are a classic sign of hyperkalemia. Given Mrs. Thompson's chronic kidney disease and acute heart failure, continuing to infuse potassium with this EKG finding could be dangerous. The infusion should be discontinued immediately. Discontinue that thing. Hyperkalemia. Kevin was what? What'd I do? I don't know what happened. Pharmacology, second largest section on the NCLEX. Pharmacology, second largest section on the NCLEX, y'all. All right, let me see. Does that look better? Okay, good. Here we go. Shout out to all y'all. Here we go. Going on to the next one. Question number 25. While working in a pediatric oncology ward, Nurse Ramirez manages care for Leo, a 4-year-old boy newly diagnosed with, rhabdomyocarcinoma. Carcinoma. There we go. Leo's parents are anxious as they have been reading extensively online, because Google knows a lot more than your nursing degree, and are overwhelmed with information. They express concerns about potential metastasis and how the cancer may affect Leo's overall function. Given the primary site of rhabdomyocarcinoma, Nurse Ramirez should emphasize monitoring the functions of which area of the body and educate the family about its prevalence. Is it all striated muscles? Is it the cerebellum, the kidneys, or the leg bones? Got A. Sorry, I just saw a whole bunch of answers just scroll back past me. A, C. Okay, Brandon says A. Lenny says A. Brittany says C. Paige says A. Okay, I'm gonna give y'all about another 20 seconds. Tissue soft. I didn't even see that whole thing. Got A. Casey says A. Aaliyah, rock the boat. I'm sorry. So Aaliyah says C. All right, cool. Here we go. Hey, I appreciate all y'all rocking in here with me. All right, about to give y'all the answer. Here we go. In 3, 2, and the answer is A. All striated muscles. Rhabdomyocarcinoma is the most common children's soft tissue or sarcoma. Oh my Lord, have mercy, I don't know how to talk. It originates in striated muscles and can be found anywhere in the body. Symptoms include, if the cancer is in the head or neck area, sudden bulging and swelling of the eyes, conjunctival, chemosis, and headaches. I've never worked in oncology, so I stay messing up the words all the time. It can also affect the urinary and reproductive system. It's common site of metastasis is in the lungs. Leo's muscle strength, function, and any pain in areas of striated muscles should be continuously assessed. Educating the family about the origin of this cancer can help them understand the primary areas of concern. Clock shot, say no. What? Bloop. All right, physiological adaptation, second largest section on the NCLEX. Lactate increase, hence DIC. Yup. I'm very checked out today. Avery, it's okay. It's okay if you're checked out. It's okay if you're checked out. A lot of times I tell people to take a break, which is what we're doing, right? Hey, I recommend studying 5 to 6 days a week if you're studying for NCLEX, with 1 day. No more than 2 days off, because if you start studying and then you take more than 2 days off, you start to lose what you gained, okay? So hey, we're doing NCLEX questions. These questions are for RNs and for PNs, as well as these are good for new generation NCLEX, right? Because they still consist of multiple choice. They still consist of select all that apply, the drag and drop, the dosage calculations. They still consist of those, okay? So make sure y'all participate. I'm kind of funny. sort of. I know I talk a lot, but that's kind of what you get. You either get it or you don't. The more likes I get, the more questions y'all get. We're at like I think like 25 now, so give me all them likes right now. Don't troll my chat at all. Don't do it, because if you troll my chat, I will ban that ass. And don't be rude. And I'm just giving y'all fair warning right now. I'm just letting y'all know. All right. So I don't gatekeep. I got these questions on nurselabs.com. You guys can go over there and check them out. I will be doing a nursing school summit presented by Picmonic and TrueLearn. That link is in my bio. It's free to register. There's a lot of panelists that are over there talking about stuff. I'm specifically going to be talking about the new generation NCLEX. So make sure you guys go over there, sign up. It's free. And also make sure you guys like, share, and follow me, because I'm kind of sort of, whatever, funny. 7-day NCLEX course. Y'all, I failed my NCLEX 3 times. I mean, 3 times. I just did it that way like it's a mirror, but 3 times, right? None of y'all would have ever known that unless I told y'all that. And here's the reason I created the 7-day NCLEX course is because I failed, and I never want anybody to feel how I felt, like a failure, like they didn't belong here. Because trust me and believe me when I tell you, no one will ever ask you at a job if you how many times you failed it. They just want to know that you got that license so they can put that ass on the floor. All right, all my nurses, if you're in here, agree with me. All right, and then so hey, that's for $48. Once it's yours forever. All right, so that's my little gift to the people that are helping me go from Spirit to Emirates Airlines. You know what I'm saying? Trying to go first class, baby. All right. And also check out thebootnurse.com. It's kind of cool over there too. Here we go. Question number 26. It's always funny when I do a break, everybody leaves. They're like, fuck you. I don't want to listen to what you got to say. All right, here we go. Question number 26. While working in the oncology ward, Miss Parker, cares for Mr. Lee, a 65-year-old patient diagnosed with colon cancer. Mr. Lee and his family are deeply rooted in their cultural beliefs, emphasizing the traditions of Chinese medicine in their approach to health and healing. In addition to the prescribed cancer treatment, Mr. Lee's family seeks to incorporate complementary therapies that align, or incorporate complementary therapies that align with their cultural beliefs. And developing a holistic care plan in collaboration with Mr. Lee's family, Nurse Parker should prioritize understanding which fundamental goal of Chinese medicine. Is it achieve harmony, maintain balance of energy, respect life, or reach or restore yin and yang? Yes, you can be an RN in 2 years. You sure can. What do we got? Shout out to all 200 plus of y'all. Yo, we literally had 500 people in here, and the moment I went on a break, they were like, "Nah, shut up. I don't want to do nothing what you got going on." We got D's. I'm gonna give y'all about another 20 seconds. I wish I had give y'all another 20 seconds. Sorry if you guys hear my son. He's a nuisance. All right, we're about to answer this question. All right, here we go. A lot of people saying D. All right, here we go. Here's our answer in 3, 2. And the answer, of course, is D. We want to restore that yin and yang, Mortal Kombat style. The principles of yin and yang are foundational to Chinese medicine. Yin and yang represent the opposite and complementary forces that exist in nature and the human body. An imbalance between these forces can lead to illness. Restoring the balance between yin and yang is a primary goal in Chinese medicine and is often seen as essential for overall health and healing. Traditional Chinese medicine is a medical system that began being developed in China about 5,000 years ago, which makes it the oldest continuous medical system on the planet. So one thing I will tell you guys is I've dealt with a lot of different patients from cultural backgrounds, and they are very much involved, very, very much involved. I had an 80-year-old patient at one point in time who had never been to the hospital, never had an issue, and she came in for an NSTEMI. And once she came in for an NSTEMI, when I tell you the family was very much involved, and then she started to have like orthostatic hypotension, they were freaking the fuck out. And they were freaking out on me. I was like, whoa, calm down. I got it. Like, she's doing good. We're good. We had to do some adjustments to her medication, and she was Gucci out there. Do you have to do it at university, or you can go to a community college and become an RN. All right. So appreciate all the likes, all the follows. Make sure y'all smash it. Hey, share, follow, like, follow. All 3 of them. Here we go. Question number 27. Nurse Johnson is reviewing Mr. Garcia, a 58-year-old client with a history of hypertrophic cardiomyopathy and a recent episode of upper respiratory tract infection. During today's assessment, Nurse Johnson notes that Mr. Garcia's systolic blood pressure has decreased from 145 to 110 since his last visit. His heart rate has risen from 72 to 96 beats per minute, and he has been experiencing periodic dizzy spells when standing up. Mr. Garcia mentioned he has been trying to drink less due to the concerns about fluid retention. Considering his clinical picture and history, Nurse Johnson should advise Mr. Garcia to what? Increase fluids that are high in protein, restrict fluids, force fluids, and reassess blood pressure, or limit fluids to non-caffeine beverages. We got A. Great. I plan to apply to a community college. Maribel, you should apply everywhere. Apply to every place that you could think of. All right, because I can tell you right now, as long as you go to a school that's accredited, don't nobody care. As long as you get your degree, and it's accredited and you get your license, don't nobody care. You say you're not a nurse, but you're interested. Hey, come do it. My friend did the NCLEX. Okay, start my clinicals today. All right, I'm gonna give you about 15 more seconds. 15 more seconds. See what we got. Force them. Oh, Lord of mercy, Emma. Force them with such force. Here we go. Answer in 3, 2. And the answer is, I wouldn't say force them, but it says force fluids and reassess the blood pressure. Oh my goodness. Given the drop in systolic blood pressure, increased heart rate, and dizziness, it might be appropriate to advise Mr. Garcia to increase his fluid intake. After doing so, reassessing his blood pressure can provide valuable feedback on his volume status. Orthostatic hypotension, a decrease in systolic blood pressure of more than 15, and an increased heart rate of more than 15%, usually accompanied by dizziness, indicates volume depletion, inadequate vasoconstrictor mechanism, and autonomic insufficiency. I hate the word. Oh, hold on. What am I saying? Force means to bolus. Damn right it does. Like, go ahead and open it up. Go ahead and open that thing wide up. There you go. I just like the way she said force them, like force feed them. Like, what you mean? Like, oh my God. All right, here we go. Shout out to everybody. Make sure you guys like, share, follow. Like, share, follow. More follows than shares. Y'all know what the deal is. Here we go. Question number 28. Nurse Matthews is caring for Mr. Turner, a 72-year-old client with chronic heart failure and recent episode of pulmonary edema. Given Mr. Turner's deteriorating condition, the cardiology team has decided to insert a pulmonary artery catheter, a Swan-Ganz catheter, to obtain more specific information about his heart's functionality. When explaining the procedure and its purpose to Mr. Turner, Nurse Matthews should emphasize that the catheter will primarily be inserted to provide what information? Stroke volume, cardiac output, venous pressure, or left ventricular thickening. We got D's. We got D. And we got some C's out here. I saw some people put some C's. It's pulmonary pressure. Look at you, Barb. Paramedic answering nursing questions. Look at you, girl. I don't know what I'm talking about. Answer them questions. All right, I'm gonna give y'all another 25 seconds. 25 seconds. Do I need to take the NCLEX to become an RN? Is it required? Yes, you have to take the NCLEX to become an RN. You have to take the NCLEX to become a LPN or a licensed practical or licensed vocational nurse. You can't just go up in here and think this is catch me if you can, thinking that you could be a nurse. There was a kid that did that in Corpus Christi. Did y'all see that? All right, so the answer is D, left ventricular functioning. The catheter is placed in the pulmonary artery. Information regarding left ventricular function is obtained when the catheter balloon is inflated. I'm about to take my NCLEX this week. Is that Catherine? Shout out to you, Catherine. Hey, you're going to rock that test. You take it this week or this coming up week. Hey, the day before your exam, I better not see you. You better not come in here. You better just be relaxing or trying to relax. Okay? Sir, in high school, been guessing, but getting them right. Shout out to you, Haven. Haven been getting them all right. Yeah, Catherine, you got this. You got this. All right. Hey, reduction of risk potential. All right. That's one of the sections of the NCLEX pie. All right. So be aware of that. Here we go. Question number 29. Question number 29. In the middle of her night shift, Nurse Swift, Taylor Swift, I don't know why I said that, I'm sorry, is alerted by a telemetry alarm from room 1989. She rushes in to find Mr. Taylor, a 72-year-old patient with a history of congestive heart failure and recent pneumonia, unresponsive in his bed. The monitor shows ventricular fibrillation. After urgently summoning assistance using the emergency call system, essentially how I got most of y'all in here, the Nurse Swift has to quickly decide her immediate course of action. What should be her primary intervention? What's the first thing she's doing? Right? We start in a peripheral IV, initiating chest compressions. Are we establishing an airway, or are we going to obtain the crash cart? I say the answer is B. Okay, you say the answer is B. All right, I'm gonna give y'all another 20 seconds. Got B. Shout out to all 260 y'all that are rocking with me. Make sure y'all share. Make sure y'all smash that like button. Hey, I had 50,000 likes last time. Where y'all at? Smashing that button? I need all the follows. Give you another 5 seconds. All right. And answer in 3, 2. The answer is B. Initiate high quality chest compressions. Staying alive, or I think it's a P.D. Pablo song now that I heard on TikTok. As per guidelines, the American Heart Association recommends beginning CPR with chest compressions. Start CPR with 30 chest compressions before checking the airway and giving rescue breaths. Hey, so if you're ever by yourself and you're doing CPR, that's the very first thing. You start chest compressions, right? And then you do the airway. You want to keep that blood, so you want to keep that blood circulating and that heart pumping. Starting with chest compressions first applies to adults, children, and infants needing CPR. Sorry if y'all hear my son, he be crying. But not for newborns. CPR can help oxygenated blood flow to the brain and other vital organs until more definitive medical treatment can restore a normal heart rhythm. All right. B-fib. Pulseless tachycardia are shockable rhythms. You are correct. Remember, hey, what does it say there? The monitor shows V-fib. Hey, remember, for V-fib, you defib. You're welcome. Keep that nugget. I'm just saying. Physiological adaptation, that's where we at. All right, here's our next one. Nurse Martinez is tending to Mr. Rodriguez, a 67-year-old client with atrial fibrillation. He has been on digoxin 0.25 milligrams daily to control his heart rate. His cardiologist, aware of his medication regimen, has added metoprolol 25 milligrams twice a day. Remember, hey, know your acronyms. Twice a day to further manage his condition. Before Nurse Martinez administers the two medications, she carefully assesses Mr. Rodriguez's vital signs. Which of her findings would be of greatest concern and necessitate immediate communication with the cardiologist? Is it a blood pressure of 90/60? A heart rate of 76, urinary output 50 milliliters per hour, or a respiratory rate of 16. Staying gal, you say A. Got a systolic blood pressure less than 100, not good. MAP goal not achieved. Let me stop. I worked in the ICU for way too long. I'll give y'all another 20 seconds. Beta blocker is going to drop that blood pressure even more. Look at you, Tiana, knowing your stuff about farm. That beta blocker is a moist liquid of a medication. I'm sorry. All right, here's your answer. Here's y'all's answer in 3. We got A's. Listen. Let's start calling you Linda now. So the answer is the blood pressure, 96/60. Both medications decrease the heart rate. Metoprolol affects the blood pressure. Therefore, the heart rate and blood pressure must be within the normal ranges, right? In order to safely administer both medications. The combination of both medications may further decrease his blood pressure. This is a significant concern and should be reported. Order to hold, exactly. Hey, if you're working on the floor or if you're on NCLEX, they're going to be like, hey, you need to take these medications, or you need to take their vital signs before you give these medications. And the order will say hold if the blood pressure is below or above a certain range. Same thing with the heart rate. All right. Not given due to patient condition. Exactly. And you got to make sure you notate that, right? We'll continue to monitor. All right. So shout out to everybody that got that. Shout out to everybody that got it right. Shout out to everybody that got it right. Here we go. Hey, we're on another break. Hey, I'm just going to go through this one quick. Hey, we're doing NCLEX questions. If you guys are new here, make sure you guys go over to my link tree. Follow me. I got a YouTube. I got an Instagram. I got an X. You know, it's going to give it to you. I got a thread. I got all those. Participation is the key. Give me all them likes. Don't troll. I got these questions from nurselabs.com. I'm doing a nursing summit. That link is in my bio. Go check that out. Also, check out the 7-day NCLEX course and thebootnurse.com. Both links are in my bio. Here we go. Question 31. Hey, and just like that, in 15 seconds, I lost 50 people. They're like, fuck that, bro. I'm going away. Never chart. We'll continue to monitor. Please, CYA. Of course. No, you don't do that, because you're gonna end up in court somewhere. They're gonna be like, oh, so you're gonna continue to monitor them? How? Trust me, I've seen that. I learned real fast about my charting in regards to that. A pediatric nurse is performing a routine assessment of a 1-month-old infant during a well baby visit at the primary care clinic. The infant's mother reports no concerns and states that the baby has been feeding well and has had regular bowel movements. Upon assessment, which of the following findings warrant further investigation by the nurse? Which means, what is bad? What is standing out to me that I need to take care of? Is it abdominal respiration, irregular breathing rate, inspiratory grunts, increased heart rate when crying, nasal flaring, cyanosis, or asymmetric chest movement? Cat says ACEF. And I'll give you guys 30 seconds. I'll give y'all 30 seconds. Appreciate the follow, Courtney. Okay. Hey, this is select all that apply, so throw all them answers in there. Brooke says all of them. Okay. Okay. Abdominal respiration is common in infants. Look at you, Tiana. Girl, you're so smart. Look at you. Infants breathe abdomen. Okay. Tiffany says ACE-FG. Okay. Another 10 seconds, y'all. Babies have abdominal respirations. I'm assuming that's what you mean, Kai. All right, here we go. Here's our answer, y'all. It's coming. It's coming in 3, 2. So we got C, E, F, and G. C, E, F, and G. If they're not crying, it's not normal. You're right. Abdominal reputations, you're right. They got a reputation to have abdominins. All right. So these are long. I'm not going to read them all. Y'all should be able to read those. I'm gonna go on to the next question. I'm trying to make sure, like, my son is dying of screaming, like dying over there. He breathed from his belly. He got a big old belly. Let me tell y'all. Damn, I originally didn't want to pick B, but then I added it. Hey, if you're not 100% sure, don't pick it. Don't pick it. All right. Here we go. Health promotion, and maintenance. That's what the category that it falls under. Okay. Here we go. Question number 32. During her shift in a maternity ward, so paint the picture, think of where you are. Nurse Jackson cares for Miss Green, who is at 42 weeks of gestation and shows no signs of labor. That baby said, bro, this apartment ain't evicting me. Rent is high. Given that the fetus is now considered post-mature, Nurse Jackson recalls the risk associated with post-maturity. Among the following potential complications, which one is primarily linked to the post-mature status of a fetus? Is it excessive fetal weight? Is it low blood sugar levels? Is it depletion of subcutaneous fat? Or is it progressive placental insufficiency? It's between A or D. Morg. I'm assuming that's short for Morgan. Morgan, I need an answer. You got to give me one. Got a lot of D's on here. Appreciate the follows, y'all. Appreciate the follows. Make sure y'all smash that like button. Give me the follows. The follows will allow for me to stream on the computer. All right. It'll allow for me to stream on the computer. We got A, C, D. Kelly, thank you for the follow. Is it Kaylani, thank you for the follow. I'm going to give y'all 15 more seconds. I'm so bad at OB. OB was definitely one of the ones I had to spend an extra 30 minutes to an hour on when I was studying. The baby going to be big, right? Hey, the way that rent is set up in these mortgages, I'm just saying. Here we go. Answers in 3, 2. And the answer is D, progressive placental insufficiency. Post-mature or post-term pregnancy is prolonged and exceeds the limits of 38 to 42 weeks. Infants of such gestation are considered post-mature or dysmature if there is evidence that a placental insufficiency has occurred and interfered with fetal growth. It occurs in 12% of all pregnancies. The placenta loses its adequacy to function after 42 weeks, after which it acquires calcium deposits, which decrease the blood perfusion, supply of oxygen, and nutrients to the fetus. Just going to push out the placenta. Yeah, push it. This is why I'm not in labor and delivery. Same. I can't do. I went into labor and delivery, especially when I was in nursing school. I was like, bro, I cannot. All right, here we go. Shout out to all y'all. Hey, if you guys are new here, we are doing nursing NCLEX style type of questions. My name is Kevin. I'm a nurse. I'm an educator. Just about to start my master's program. Hey, so I'm doing this for y'all. I failed my NCLEX 3 times, so I gotta find a way to give back. All right, so here we go. Question 33. In the post-surgical unit, the nurse is attending to a client who has had a total hip replacement 7 days ago. This client has a history of hypertension, mild asthma, and is on anticoagulants. The client provides feedback about their current condition. Which of the following statements by the client is most concerning and necessitates the nurse's immediate intervention, right? So, what did they say that the nurse was like, whoa, playboy? No. We got to fix that. Is it, I have bad muscle spasms in my lower leg of the affected extremity? Is it, I just can't catch my breath over the past few minutes, and I think I'm in grave danger. I have to use the bedpan to pass my water. What? Oh, to pass my water at least 1 to 2 hours. It's tiring, and it seems that the pain medication is not working as well today, and I'm scared. It's not select all that apply. Or are you just saying ABCs? Impending doom. Okay. Feel like so be always. All right. Hey, so that sign of impending doom. What are we? Tucci. That's what I'm talking about. That's what we're thinking about, right? That's what we're thinking about. I'm gonna give y'all about 10 more seconds. Airway, breathing, circulation. Okay. All right. So here's our answer. Let's see what the answer is, y'all. 3, 2. I can't catch my breath over the past few minutes. I think I'm in grave danger. Yes, that is the correct answer, right? Clients who have hip or knee surgeries are at high risk for the development of postoperative pulmonary embolism. Sudden dyspnea and tachycardia are classic findings of pulmonary embolism. Without prophylaxis, deep vein thrombosis can develop within 7 to 14 days following the surgery and can lead to pulmonary embolism. The nurse should be aware of the other signs of DVT, which include pain and tenderness at or below the area of the clot, skin discoloration, swelling, or tightening of the affected leg. Signs of pulmonary embolism include acute onset of dyspnea, tachycardia, confusion, and pleuritic chest pain. I'm telling you right now, the very first time you ever see a pulmonary embolism, you will never forget it. We're all going to pass. Hey, Cass, I'm just saying, we passing. I mean, I already passed, but y'all passing. And that's on the dead homies. You know what I'm saying? Everybody in here passing, all 327 of y'all. You see what I'm saying? I appreciate all the follows. Thank y'all. Hey, I'm telling you right now, when you hear somebody go, and then they turn as white as this, I'm trying to tell you, you'll never forget it. You will never forget it. Let you know right now. It says knock on wood, so we aren't jinxed. What you mean? I'm telling you, it's going to be part of the territory if you ever see it. My father-in-law had surgery for PE this afternoon. Damn, Mary. I hope he's doing okay. I'm taking my NCLEX tomorrow. Amanda, go away. Go away, Amanda. You don't need to be here. You don't need to be here, Amanda. You're going to pass that NCLEX. And when you pass it, I want you to come back and I want you to tell us. But if you're taking your NCLEX tomorrow, you need to go away. You need to be trying to relax and clear that head. So bye, Amanda. Don't make me block you. Don't make me do it. So far, yeah. There you go, Amanda. I appreciate the follow. Hey, but go away, though. For real, though. Goodbye. Question 34. In the cardiology unit, a nurse closely monitors a 33-year-old male client diagnosed with heart failure. The client, a previously active triathlete, was recently started on furosemide due to the increased fluid retention. The client mentions a few changes he noticed over the past week. Which of the following statements from the client would suggest he has been experiencing a negative side effect from furosemide? I was surprised to see my weight jump up by 5 pounds in just a few days. I've noticed some swelling around my ankles by the end of the day. My stomach has been feeling upset lately, especially after I take one pill. Or I'm sorry, especially after I take the pill. I haven't been as hungry the past week, even for my favorite foods. So what are we thinking? What are we thinking? So think about it. What are the signs and symptoms of somebody who has heart failure? They're given furosemide, which is a what? What is furosemide? It's a what? It's a diuretic, right? So if it's a diuretic, what am I looking for, right? Yeah, so what am I looking for in regards to a diuretic? You know, like somebody with heart failure, you're going to see those extremities that are going to swell up, right? Furosemide takes fluid off the body. Maybe B, okay? This is how you have to break it down. This is how you have to break it down. This is how you have to follow the trends. And then luckily on NCLEX, they give you the lab values. But even I could give you the lab values, but I need to know that you know what they mean when they are outside of those lab values. Furosemide, yep. Furosemide. So what is furosemide, y'all? Lasix. Is it a K wasting or a K sparing? NCLEX, yes, NCLEX gives you the labs. But here's the thing is that if you don't know how to interpret your labs, it doesn't matter. So it's K wasting, right? Which also it gets rid of fluids as well as it gets rid of your potassium, right? Strong's diuretic. There you go. All right, so here we go. We're going to answer this question. 3, 2. So the answer is D. I haven't been as hungry this past week, even for my favorite foods. Furosemide is a loop diuretic that is used for pulmonary edema and heart failure, nephrotic syndrome, and hypertension. Furosemide causes potassium loss, unless a supplement or a potassium-rich diet is taken. A decrease in appetite is caused by hypokalemia, right? Signs and symptoms of hypokalemia include anorexia, fatigue, nausea, decreased GI motility, muscle weakness, dysrhythmias, reduced urine osmolality, and altered level of consciousness. So that is why it is important that if I gave you a potassium of, we'll say 2.8, I need to know that you know what that means. Dang, I overlooked that one. That's what I'm saying. I need to know that you know what that means. That's why it's so important that you understand the lab values. And I'm telling y'all this from personal experience. Hey, this is part of pharmacology, by the way, pharmacology and parenteral therapies. And I'm telling y'all this is because pharmacology was a monster for me, y'all. It was a monster. Okay. And so I really had to dig deep when I was studying. All right, here we go. Question 35. You need to replace the potassium with this one. Correct. Yes, you do. Yes, you do. Farm is hard. Second largest section on the NCLEX. Question 35. A 32-year-old pregnant woman comes to the clinic for her prenatal visit. The nurse gathers data about her obstetric history, which includes 3-year-old twins at home and a miscarriage 10 years ago at 12 weeks gestation. How would the nurse accurately document this information? Fill in the blank. G2, P2. First of all of y'all, most of the people that are in here are women. And I'm not going to assume that y'all have kids, but I'm pretty sure since all of y'all are just like, look, I done already been there. You know what I'm saying? Like, I know this answer. You would think, so happy I'm done with this, right? You got G2, P2, okay, 3-2, 3-2, 3-2. Only miscarriages count at 20 weeks, okay? 3-2, P2. You just had maternity, no kids, but I love maternity. You're like, you ain't got no kids yet. 10 seconds, y'all, 10 seconds. Thanks, appreciate it. Make sure you guys smash that like button. Hey, shout out to everybody that's joining. We're doing NCLEX style questions. Make sure you guys like, share, follow. Here we go. Answer. It is G3, P1. G3, P1. All right. Gravida is the number of confirmed pregnancies, and each pregnancy is only counted one time. Even if the pregnancy has a multiple gestation, even if you have, triplets or twins or whatever, para indicates the number of pregnancies that somebody said it, that has reached viability, which is 20 weeks, regardless of whether the infant was born alive. Thus, for this woman, she is pregnant now, had two prior pregnancies and one viable birth, which was twins, right? So it's G3P1. Preterm was a miscarriage, so this is one. Okay. Appreciate the follows. Thanks for the like. Shout out to all 300 plus of y'all. Now let's go to the next one. Hey, we're on a break, but I'm not even gonna do it. So we're just gonna go on to the next one. Here we go. Hey, make sure you guys like, share, follow. Make sure you guys go follow me on YouTube. Hey, all of these questions that I'm going over, they're gonna end up on my YouTube. Okay, just letting you know that right now. Question 36. In a wound care clinic, Nurse Palmer is assigned to Mr. Harris, Miss Harris, a 27-year-old female client with a history of deep vein thrombosis. Paint that picture for yourself. Miss Harris presents with a venous stasis ulcer on her left lower leg, which has persisted for the last 3 months despite home care efforts. Miss Harris has been managing the ulcer with over-the-counter dressings and is concerned about the lack of progress. She has also mentioned that she has been feeling fatigued lately and has unintentionally lost 5 kilograms over the past month. Based on the assessment of the client's history, which nursing intervention would be the most effective in promoting the healing of the ulcer? Apply dressing with sterile technique, improve the client's nutritional status, initiate limb compression therapy, or begin, proteolic debridement. Got B's. B for B. She needs proper nutrients. Okay. All right. Who said that? Is that Chelsea? Is it Chelsealyn? Or Chelsea Lynn? Is it Chelsea Lynn? I don't know which one it is, but I saw what you said. Christina says B. Greg says C. Can I call you Greg? I'm going to call you Greg. Brittany says B. More protein. Okay. I like where y'all heads are at. All right. I'm going to give y'all another 15 seconds. She need protein. Okay. All right. Emerald says B. Judith says B. Chelsea Lynn, got you. I'm tracking. I'm picking up what you're putting down. More protein. All right. Here we go, y'all. Here we go. In 3, 2, the answer is B. Y'all got it right. You want to increase that nutrient status. Venous stasis occurs when venous blood collects and stagnates in the lower leg due to incompetent venous valves. Eventually, low oxygen and nutrients are supplied to the cells of the lower extremities, causing the cell to die or necrose. This ultimately leads to the formation of venous stasis ulcers, characterized by shallow but large round wounds with irregular margins that typically develop on the lower leg or ankle. The goal of clinical management in a client with venous stasis ulcer is to promote healing. This only can be accomplished with proper nutrients. Nutritional deficiencies are a common cause of venous ulcers. Alteration in the diet to include foods high in protein, zinc, iron, and vitamin C and A are encouraged to promote wound healing. Sorry, I've been MA homework. No, you're good. You Gucci out here. That was a long one, y'all. Hey, so that one falls under basic care and comfort. Basic care and comfort aspect of that one, okay? So here we go. On to the next one. Question number 37. Question 37. A nurse is to administer Demerol 100 milligrams, atropine at 0.4 milligrams, and Phenergan at 50 milligrams IM to a pre-operative client. So essentially somebody who's going into the operating room. List the order in which the nurse must carry out the following actions prior to administering the pre-operative medications, right? So put them in order. I want to see at least 4. You need to see at least 4 of them down there. Is it place the call bell within reach? Place the call bell in reach, raise the side rails of the bed, instruct the client to remain in bed, and have the client empty their bladder. Got DBCA, DCBA. Lisa, I need all 4 of them. You got to tell me what order. What order? You got D, B, C, A. Okay. Shout out to all 300 plus of y'all that just joined us. Shout out to all y'all joining us. We're doing NCLEX style questions. My name's Kevin. Go by the Boot Nurse. Hey, I want to know who everybody is. If you're new, I want to know who you are, where you're from, where you're at in your nursing journey. Let us know down in the bottom while you guys are answering. All right. I'll give you guys about another 10 seconds. This one's a little bit long. A little bit long. Make sure y'all like, share, and follow. Smash that like button. Virginia Beach. I got some friends over there. Here we go. 3, 2. The answer: A, C, B, D. There's your answer. First step in the process is to have the client void. That is not. Wait, hold on. Let me go back. That's definitely wrong. It's D. It's D that's first. D that's first. I may just omit this one because I don't like the way I put this one in order, but it's D first. So the very first step in the process is to have the client void prior to administering any medications. Have them go to the bathroom, right? If the client does not have a catheter, it is important to empty the bladder before receiving preoperative medications to prevent bladder injury. The next one should be to instruct the client to remain in bed. So that one was C, right? So we got DC, right? DC. And then it says do the side rails and then do the call bell. So what was it? DC. So it was DC BA. Yep, DCBA. There you go. Retired nurse Kit Kat. Ma'am, welcome. What type of nurse were you? Let us know. Let us know down there what type of nurse you were. All right, here we go. Question number 38. Question number 38. Nurse Jackson has recently taken. Hey, y'all, hold on one second. Don't go nowhere. Hold on one second. Woo! All right, y'all. Hey, I'm just telling. No. We're good. We're good. Hey, I just want to let y'all know. Have kids, they said. It'll be fun, they said. My son, he doesn't want to listen. You know, obviously because he's 18 months and he's grown and he can do what he wants. He's climbing, on the back of the couch and on the window and hit his head, or hit his ear. So now he's in there screaming bloody murder. I'm pretty sure you already answered this question. So let's make it happen. Hey, does he pay bills? Well, I mean, he act like he pay bills up in here. You know what I'm saying? So. Have you guys read this question. I'll give you guys some time, and you guys can go ahead and answer it. That baby is grown. I'm trying to tell you, he be out here acting a whole fool. Let me tell you. Every single time I get onto a live, he's in there acting up, doing something. I'm like, bro, you want to come in here and do this and start teaching folks? Okay. All right. What are we thinking for this answer, y'all? What are we thinking? We got B. Okay, Morg, I see you. What are we thinking? Tiana says A. Appreciate everybody still rocking with me. Had to take a little minute and a half pause to go make sure, even though he's breathing, make sure he's still got all, 5 fingers, 10 fingers, 10 toes, and all that good jazz. That fatherly duties. So appreciate everybody rocking with me. We're going to answer this question in about 10 seconds. All right. Here we go. In 3, 2, 1. The answer is A. We should provide specific feedback immediately after a task is completed or observed. Feedback is most useful when given immediately. Positive behavior is strengthened through immediate feedback, and it is easier to modify problem behavior if the standards are unclear. If they are unclear. All right. Yep. Specific feedback. Right. I want to see something. So here's the thing too. I was way off. I'm not all about that nurse eat your young shit, or, you know, like, if you have to, like, we as people have to learn how to talk to each other better. And that nurses eat their young shit where they talk down to you, you know, when, you know, you don't have really good, when they don't have really good communication, that's a problem. Same thing with a preceptor. So let's, like, you know, as everybody starts to go forward, as you start to go forward in your nursing career, do better, and don't be that person. Do not be that person. And definitely don't be that person working around me, because I check people on the daily. Here we go. Question 39. Fundamentals teaches that be nice to everyone. Yeah, they teach you that, but most people. Okay, here we go. Question 39. Nurse Martinez is caring for Mr. Reyes, a 45-year-old client newly diagnosed with multiple sclerosis. Mr. Reyes is an active individual and has voiced concerns about how this diagnosis will affect his fitness regimen. During a teaching session about safety exercises and physical activity for MS patients, Nurse Martinez provides various recommendations. She later evaluates Mr. Reyes' understanding of the information that was provided. The nurse determines that the client needs additional teaching if Mr. Reyes makes which of the following statements? Select all that apply. So, which one? The question is, it's just like, he needs additional teaching. So something he didn't understand. So which one of these statements would we pick to help him better understand? Select all that apply. Appreciate all 133 of y'all rocking with me. Appreciate y'all. JK, are you sure? You sure about that? I'm gonna give y'all another 20 seconds. Appreciate all y'all. Hey, make sure you guys smash the like button. Make sure you guys share. Make sure you guys follow. Hey, I need 10,000 people to follow me so I can be unghetto, y'all. And I'm pretty sure some of y'all are mad because I triggered y'all to come in here with a code blue. So I'm sorry. Do you do these? Do you do this every Friday? Go live, Denise. I do these every Monday, Wednesday, and Friday at 5:30. All right. I'll give you. I think we'll answer right now. Here we go. In 3, 2. And so the answer is B and E. And no, I don't mean breaking and entering. All right, patient with multiple sclerosis should not exercise to the point of fatigue, as strenuous physical exercise raises body temperature and may aggravate symptoms. It's essential to exercise, but not to the point of exhaustion. And E, continuous exercise with no rest periods is contraindicated for patients with multiple sclerosis who want to exercise. The patient should be advised to take short rest periods, preferably laying down. After extreme fatigue, extreme fatigue may contribute to exacerbation of symptoms. All right, does the NCLEX give partial credit? Yes, it does. Yes, it does. All right, that was another one from Health Promotions and Maintenance, y'all. Health Promotions and Maintenance. So shout out to y'all. So, hey, how many more questions y'all got? I mean, how many more questions do y'all want? We're at question 40 right now. We're still rocking. Y'all tell me. Y'all tell me. So we're doing question 40. If you guys are new here, my name is Kevin. We're doing NCLEX nursing style questions. Make sure you guys smash that like button. Make sure you guys follow. All right. So here we go. Question number 40. Nurse Anderson is visiting the home of Mrs. Thomas, a 80-year-old woman with advanced Alzheimer's disease. Mrs. Thompson's family, including her daughter and son-in-law, have been primary caregivers and made several modifications to accommodate her needs. Nurse Anderson, assessing the quality of home care provided to Mrs. Thompson, seeks to prioritize the safety and well-being of the patient. During her evaluation, which statement made by the daughter will the nurse reinforce as being of utmost importance? All right, so which one is it? Is it we make sure mom gets at least 2 full meals a day. Sometimes it's challenging due to her appetite. We've been attending a support group discussion every week at our community center, and it helps us cope and learn from others. Understanding the risk, we've installed safety bars in the bathroom and set up a 24-hour alarm on all exits to prevent wandering. Or is it D, administering her medication is streamlined. We organize a pill box, and she takes it 3 times a day without much hassle. We got C. So we have somebody who is an advanced Alzheimer's disease, right? Safety is always not only is safety always paramount in this type of question, but the NCLEX is based off of nothing but safety. Can you perform as a safe nurse? Do you know when and when not to give that medication? Do you know when and when not to inform the provider? You know, are you providing the right education? Right? Here we go. Another 15 seconds. See, the question is asking about safety. Okay. So remember, the NCLEX is all about the NCLEX. What it boils down to is nurse safety. And remember, you're not going to be an expert. Trust and believe me. Trust and believe me when I tell you that. All right, here we go. In 3, 2. The answer is C. We have safety bars installed in the bathroom and have a 24-hour alarms on the doors. It says no. So all of them are correct. It says, however, safety is the most important to reinforce. And this is under safety and infection control. So you are 100% correct. It is about safety. You said farm is the second largest section. What's the first? The first is management of care. What key bank are you utilizing? Denise, I got this from nurselabs.com. Hey, Cass, let her know. I don't gatekeep. I'll let you know. I'll let you know where I got them from. All right, here we go. Here we go. You're welcome, Denise. All right, on to the next one. Oh, we're not going to take a break. We'll keep going. All right, here we go. Question number 41. Hey, if you guys are new here, make sure you guys follow, smash that like button. I need at least 10,000 people to follow me, y'all. I'm almost there. Almost there. Let's make it happen. Smash the like button. All right, here we go. A nurse is reviewing a patient's medication during shift change. Which of the following medication would be contraindicated if the patient were pregnant? Select all that apply. And you already know that this is a pharmacology question. All right, so what are we thinking? Select all that apply. A, B, C, D, E. Okay, that's fair. You're like, all of them. Judith says A. Just select all that apply. Select all that apply, Judith. Hey, if you guys are new here, I want to know who you are, where you're from, you know, like where you're at in your nursing journey. I'm not good at farm. Bridget, you got to get good at farm. It's the second largest section on NCLEX. We got AEC, ABF, ADE. No, Monica. She said ADE. I'm sorry, I couldn't help myself. Hey, name that movie. LVN taking NCLEX in 2 weeks. Shout out to you. I'm an LVN in West Virginia. West Virginia. Sorry, I played a lot of Fallout. How do you get better at farm? Learn the family name, the suffixes, and what category that they fall under. Need to go back to watch. Yeah, okay, ABC or ACE. All right, here we go. Here's our answer, y'all. In 3, 2. The answer is A. Oh, Lord have mercy. It's, where did I go? I went the wrong way. Nope. There we go. Hold on. I do not like that. Something's wrong. Did I go too far? I did go too far. There we go. Lord have mercy. It's A and B. All the above. No, it's not all the above. All right, so it's warfarin or Coumadin. Has a pregnancy category X and associated with central nervous system defects, spontaneous abortion, stillborn, prematurity, hemorrhage, and ocular defects when given anytime during pregnancy, and fetal warfarin syndrome when given during the first trimester. What is this one? Was it a finasteride? Finasteride has a pregnancy category X, which has high risk of causing permanent damage to the fetus. I got partial credit, so I'm cool with that. That's what I'm talking about, Sydney. Hey, you gotta look at the positives around here, baby. That's what I'm talking about. To be honest, I'm not even sure what that one is. I'm not even sure what that medication is for. We can look that up. Hey, look it up. Tiana. Let me know. You already know. I don't got no problem telling y'all if I don't know something. You got 2 right? That's what I'm talking about. All right, here we go. Question number 42. A nurse is reviewing a patient's past medical history. The history indicates the patient has photosensitive reaction to medication. Which of the following drugs is associated with photosensitive reaction? Is it Cipro? Is it sulfonamide? Is it Naroxen? Is it Bactrim? Is it Accutane? Is it a nitro patch? What are we thinking? Oh, BPH? Got it. So what are we thinking about? Scorpio Princess. Scorpio Princess. Hey, when your birthday? Because I'm a Scorpio too. ABF. Okay. Bridget said A for sure, but I don't know about the rest. So here's the thing about select all apply. If you don't know, don't pick it. November 16th. Ill. I'm just playing. I'm just kidding. I'm just playing. You're a Scorpio, so hey, I'm with that. I'm with that. Shout out to all my Scorpios. Hey, Scorpio season's almost here, y'all. E is absolutely positive. Okay. I'm just playing. I'm just playing. Hey, October 28th. Hey, Scorpio season. I'm all about it. That's me. All right, I'm gonna give y'all 15 more seconds. Shout out to all 200 of y'all rocking with me, yo. Hey, make sure you guys like, share, follow. I need 10,000 people to pretend that they like me, so follow me, so I can start to stream on the computer. Yep, you're not 100%. Don't pick it. All right, cool. It looks like we got a bunch of people that answered. All right, B, D, A, E. All right, let's find out what the answer is in 3, 2. The answer is A, B, C, D, and E. Hey, just FYI, it's not F. So it's all of them but one. All of them but one. Photosensitivity is an extreme sensitivity to UV rays from the sun and other sources. A photosensitivity called phototoxic reaction are caused when medications in the body interact with UV rays from the sun. Anti-infectives are the most common cause of this type of reaction. So the antibiotics, Cipro, it'll do it. It'll do it to you. All right, a lot of meds they do have a lot of photosensitivity. So, honestly, like if this was a select all apply where you got partial credit, and then you answered them all, you would have gotten what is that? It's A, B, C, D, E, F. That would have been what, 7 minus 1 point. You would have gotten like 0.6 or whatever, however much it is for 1 point. So think about it like that. I don't mean do it like that on purpose, you know what I'm saying? But sometimes if you just know, you know. So, all right, here we go. Question number 43. A patient tells you that her urine is starting to look discolored. If you believe this change is due to medication, which of the following the medication does not change urine discoloration? Is it sulfasalazine? Is it levodopa? Is it phenol? Is it phenol? Oh my God. Aspirin, and then the phenol one. Which one is it? We got D. Got D. Got D. Does not. D. All right, Lexi, I got you. I got you, Lexi. Lexi Page. Lovely Leo. Leo. Ew. No, I'm just playing. Jenna says D. Kit Kat says D. Caitlin says D. Veronica says D. The phenol one. Me every time I try to pronounce these meds. Look, let me tell you something right now. Hey, just because you learn pharmacology doesn't mean you're going to be exposed to a lot of those medications, because you're going to be working on those floors. That's what I'm trying to tell you. I'm going to be like, damn, I ain't never heard of that medication before. Take NCLEX Friday. Okay, cool. Next Friday, is it Sonia? You take your NCLEX next Friday? All right, so we got a lot of D's. So, Charlie, what's up, girl? How are you? All right, here we go. Answer in 3, 2. The answer is D. It is aspirin. Aspirin is not known to cause discoloration of the urine. Side effects and complications of taking aspirin include stroke caused by a burst blood vessel. The FDA doesn't recommend aspirin therapy for the prevention of heart attacks in people who haven't already had a heart attack, stroke, or any other cardiovascular condition. So here's the thing. So let's just say you have no idea about these, right? So a way that actually can help you, it could give you a little bit of leeway. It's just like, you don't know like what these are, but you have to apply what you do know. And most people know that this does not change your urine, right? So you're like, man, what does sulfasalazine look like? I don't know, but I do know aspirin don't make my don't make my urine turn purple or anything like that. So apply what you do know, okay? I definitely read the question wrong. Quam Courtney, ma'am, I need for you to read the question. Read the effing question. I need for you to read it for me, all right? Because if you don't read it and if you don't understand it, you're going to get the question wrong. That's exactly how I chose D. Exactly, Caitlin. Exactly. Apply what you do know, all right? RTFQ. Hey, who knows what? Hey, let me know what RTFQ means. And some of y'all are new. I ain't said it in about an hour. So, question 44. You are responsible for reviewing the nursing unit's refrigerator, because we all about those pizza parties. Which of the following drugs, if found inside the refrigerator, should be removed? What you taking out the fridge? Pizza, not somebody's name Pizza Hut up in here as just now when I said something about taking pizza. You said forking. Read the forking question. You know what? I got you. I'm tracking. I'm picking up what you're putting down. Lauren says A. Kelly says B. Appreciate the follow. Y. Make sure you guys like, share, follow, smash that like button. I'm trying to get to 50,000 likes, y'all. Trying to get to 50,000 likes. Pizza Hut. You came in. Yeah, you came in right at the perfect time when I said that. No, I changed my answer to B. All right, Lauren. All right. Hey, what's the rule when it comes to changing your answer? What's the rule when it comes to changing your answer? I'll give y'all 10 seconds. B is open. Okay. Using insulin. Used insulin doesn't go in the fridge. Don't change your. There you go. Don't change your answer. So here it is. It is Nadolol. Nadolol is stored at room temperature between 59 and 86 degrees Fahrenheit, away from heat, moisture, moist stuff, and light. Do not store in the bathroom. Why would you put it in the bathroom? Do not store in the bathroom and keep the bottle tightly closed. Answer change. Look at that. You was right. Is it Ernisha? Yeah, Ernisha, you was right. You was right. Shout out to you. Yep, never heard of that bed. Yeah. Me neither. Right? And that's okay, because we all learning out here. We all learn. Hey, the best way, here's another thing, y'all, is like if y'all really want to learn stuff, teach it to somebody else, right? Especially if you guys are in pharmacology. If you want to learn, find out what everything you need to learn about pharmacology and then teach it to somebody else, like people that are in your group. Pharmacology, second largest section on the exam. Second largest section, right? Question number 45. A 36-year-old female has recently been diagnosed with an autoimmune disease. She has also recently discovered that she is pregnant. Which of the following is the only immunoglobulin that will provide protection to the fetus in the womb? Not immunoglobulin. I don't remember anything about that. Girl? All right, what are we thinking? Everybody's saying D. Camille says B. Okay. Is it Floor? Oh my God. Bridget says WTF. What do you say? What you mean, Bridget? What you mean? Dante says essentially says D, so he says IgG. You're guessing? Okay. Ain't nothing wrong with guessing. That was a guess. I got you, Camille. I got you. All right. All the above. Is it Bilin or Billin? I'm gonna say Bilin. I think you said all the above. All right. Here we go. It says G for gestation. Protect that fetus. Look at you, Cass. That's what I'm talking about, girl. IgG is the OG. Oh, y'all Gucci out here. That's what I'm talking about. Hey, the answer is IgG for the OG. IgG for protecting that baby. IgG is the only immunoglobulin that can cross the placental barrier. About 70 to 80% of the immunoglobulins in the blood are IgG. Specific IgG antibodies are produced during an initial infection or other antigen exposure, rising a few weeks after it begins, then decreasing and stabilizing. The body retains a catalog of IgG antibodies that can be rapidly reproduced whenever exposed to the same antigen. IgG antibodies form the basis of long-term protection against microorganisms. It says, oh, I'm going to remember IgG for gestation now. Thank you. That's what I'm saying. That's what I'm talking about. That's why we do these things. You know what I'm saying? Hey, smash that like button and share this. Hey, stop playing games with me, y'all. Y'all essentially give back to each other. You never know what you're going to remember. I promise you that. Thank you for all the tips and saying I'm in here for the first semester. Shout out to you, Charlie, for being up in here. Shout out to you. So we do these all the time. Come be a part of it. Hey, taking a break. No, we're not. We'll go on to look. Hey, we have 46 questions, y'all. 46. Why y'all need to know that? What you mean? Need to know what? Muhammad, what you mean? Don't come in here aggressive, sir. Don't do that. Don't do that. I don't think you're coming in here aggressive. I'm just messing with you. But elaborate for us, sir. Elaborate. Question 46. A second-year nursing student, which is some of y'all, has suffered a needle stick while working with a patient who is positive for AIDS. Oh, Lord. Which of the following is the most significant action that the nursing student should take? What is the most important thing that you do? What is the most important thing that you do? C. Didn't know nursing, need to know. Yeah, they do. It's part of, that's what a lot. Mohammed, what do you do? Let us know in the chat. What do you do? Now I'm curious to know what you do. B, immediately. Okay, got you. Cass said B immediately. Cass, you dying on that hill? Kimberly says C. You'd be surprised on what nurses have to know. Because I can tell you right now, I've seen many nurses save a lot of doctors' asses because doctors think they know more. I mean, they do on a medical aspect, but leave it to a nurse to save you. Got C, D, or A and D are out. Okay, so B or C. I'm gonna give y'all 10 more seconds. Real talk, Lauren. Let them know. I agree with whatever Cass said. You can't take. Y'all ain't taking the test together. What you mean? Is crying an option? Crying is always an option. It's like a secret. It's like a secret option. And the answer is B, because Cass said B immediately. B immediately. Oh, AZT therapy is the most critical intervention. It is an antiretroviral medication used to prevent and treat HIV/AIDS by reducing the replication of the virus. Post-exposure prophylactics, or PrEP, or they call them PrEP or PEP or whatever, for HIV is a treatment to suppress the virus and prevent infection after exposure. PEP should be taken within 72 hours of possible exposure to HIV, so it is important to seek treatment immediately, or quickly, or fast. Cass, good job, y'all. Cass, you carrying the group because they just like, hey, whatever you said. Don't be letting, y'all can't be riding her coattail like that. What if she get it wrong? Then y'all gonna blame her. Look at y'all. See? With us, we're doing NCLEX questions. My name's Kevin. I go by the Boot Nurse. Make sure you guys smash that like button. Make sure you guys share. Make sure y'all guys share. Make sure y'all follow. Let's make her the charge nurse. Cass, they trying to make you charge nurse. What they doing out here? Charlie, hey, you're welcome. This is how I do a lot of my study sessions, like my private study sessions. So, not charge nurse. Hey, I'm just saying. Here we go. Question number 47. A 35-year-old male who is an insulin-dependent diabetic for 5 years and is now unable to urinate. Which of the following would you most likely suspect? Which one that you would most likely suspect? We got C, got autonomic neuropathy. B is with diabetic nephropathy. And you got autonomic neuropathy. All right. And then you got somatic neuropathy. And then, of course, A, you have arthrosclerosis. Stephanie says B. All right, cool. We Gucci out here. All right, I'm going to give y'all 10 more seconds. 10 more seconds. Lexi says C with a question mark. Neuropathy is that a nerve, right? Yeah. So think about diabetes and the pathophysiology in regards to that. Nephro means kidney. Yep. So think about diabetes and the pathophysiology, like how that works. All right. Here we go. 3, 2. I've been reading half the answers and think I know. Look, I'm gonna need for you to read the whole answer and the whole question and then know, madam, playing these games with me. All right, here we go. Hey, look at that. Autonomic neuropathy, right? Affects the autonomic nerves, which controls the bladder, intestinal tract, and genitals, among other organs. Paralysis of the bladder is a common symptom of this type of neuropathy as manifest by bladder urgency and inability to start urination. Let's go. Let's fucking go. Hey, I appreciate all 370 y'all up in here to listen to me run my mouth while I love to teach. Like I said, I've been a nurse for 3.5 years. On the 27th, it'll be 16 years that I've been in the Navy. I'm in the Navy Reserves, y'all, in case some of y'all didn't know. Hey, physiological adaptation, second largest section, all right? So, hey, I love being out here rocking with y'all. I love doing these teachings. I love it. Because when y'all learn, I learn. I said C first and changed it. Ma'am, Rachel BSN, you know better. Angel said, congrats, thank you for your service. I appreciate the support. Tiana, I ain't even read it yet. Thanks for making me study. Caitlin, girl, I got you. You better get that ass in that book, or at least stay here so you can get these answers. So here we go. Question 48. You are taking the history of a 14-year-old girl who has a BMI of 18. The girl reports inability to eat, induced vomiting, and severe constipation. Which of the following would you most likely suspect? Would it be MS? Would it be anorexia, bulimia, or systemic sclerosis? I think it's B. Well, that's what Lauren said. Definitely. Final years of respiratory student here, just saying hello. Britt, what's up? You can stay, you can chat, you can chill, you can follow me because I need 3,000 people. I mean, I need 10,000 people to follow me, so you can do that if you're cool with that. Induced vomiting is key. Right. Make sure you guys like, share, follow, smash that share. I want everybody to know what's going on over here. I'm gonna give y'all 10 more seconds. Hey, did you guys hear about that one lady who was stealing Dilaudid and then she was selling it? Now you do. Now you do. Senior nursing student here. Okay. Hey, did y'all know that Redonda Vaughn is trying to get her license back? Now you do. Hope it doesn't happen. Here we go. The answer is C. It is anorexia nervosa. Right? All of the clinical signs and symptoms point to the condition of anorexia. The key feature of anorexia is self-imposed starvation resulting from a distorted body image and an intense irrational fear of gaining weight, even when the patient is emaciated? Yeah, emaciated, whatever. Anorexia nervosa may include refusal to eat, accompanied by convulsive exercising, self-induced vomiting, or laxatives or diuretic abuse. Oh, shout out to y'all. So think about those things, right? And you got to also think about like what's the nursing diagnosis for somebody who has, anorexia nervosa. And also, let's think about this. This type of question right here specifically. Do you think that this is an NCLEX style question that is above the passing level? Answer that question. Answer that question before I go on. Lexi says no. What you mean, Scorpio? So the NCLEX has different question types, right? This one would be considered like a remembering or a memorization type of question. The questions that are considered passing on NCLEX are what we call their analysis and application type of questions. Okay? Yeah, this is considered a freebie. However, if you start getting questions that are really, really easy like this, you might want to step back and you might want to get your thought process together, because if you start getting really easy questions like that, that means you're going down. That means you're going down below the line. Okay? So think about that. Tiffany, we already answered this one. I'm going on to the next one. It'd be an easy level question. Correct. It'd be an easy level question. All right, we already answered this one, guys. I'm going on to the next one. So here we go. Question number 49. Question number 49. A 24-year-old female is admitted to the emergency department due to confusion, right? So think of level of consciousness, right? This patient has a history of myeloma diagnosis, constipation, intense abdominal pain, and polyuria. Based on the presenting signs and symptoms, which of the following would you most likely suspect? Is it diverticulitis, hypercalcemia, hypocalcemia, or irritable bowel syndrome? Just stumbled across your live. How often do you do these? I do them every Monday, Wednesday, and Friday at 5:30. So just drop a follow, girl. Drop a follow. We party up in here. Hey, I'm gonna give y'all about another 15 seconds. She should have dairy. What the hell? That might help. Hey, everybody that's jumping in here, appreciate y'all rocking with us. We're doing NCLEX style questions right now. Doing NCLEX style questions. Make sure you guys smash that like button. Make sure you guys also share and you guys follow. Make sure y'all do that. The more people that are out there that can use this, the better. Make sure you guys follow me on YouTube as well, because all of these lives that I do, they go up on YouTube once I finish. So go over there and check that out. All right, I'm gonna give y'all 5 seconds. No, I'm not. Here we go. And the answer is B, hypercalcemia. Hypercalcemia can cause polyuria, severe abdominal pain, and confusion. Part of physiological adaptation. Yes, Central Standard Time. Texas time. High cal, hard bowel. Look at that. With a Taryn. Hey, that's a really good one to think about. I actually have never heard that one before. That's really good. High cal, hard bowel. Look at that. Look, Caitlin, you getting all the good stuff today. You getting all the good stuff. Calcium causes constipation. Yep. Calcium is like a sedative. Too much calcium, too much sodium. Yep. That's just like too much of a good thing can be a bad thing. Do you do this every day? Emerald, I do this Monday, Wednesday, and Friday, 5:30 Central Standard Time. So shout out to everybody I appreciate all the follows, all the likes. Make sure you guys share. Caitlin says, right, I've been missing out on these lives. I'm just saying. You can go back and look at some of them. All right, here we go. On to the next one. Oh, here we go. Question number 50. ROGAM is most often used to treat blank mothers that have a blank infant. What are we looking at? Emerald says C. Avery says C. Camille says B. Lexi says B. Lindsay says C. Samantha says C. Okay. What else? Diamond says C. Sneezy Face says C. I know this now because you got it wrong where? I got it wrong on a test. Hey, see, sometimes it takes that. Sometimes it takes that. I read the answer wrong. Look, there you go. That's why I say you got an RTFQ. Read the effing question. Read the question, y'all. Read the question. I got this right on the test. Look at you, Camille. Look at you. Shout out to Camille, getting everything right. I'm going to give y'all another 15 seconds. Love Bryant. Lexi says, good job. Maggie says, the letter C. This is East. No, I actually live in the South. Kaylin says C. This is easy. Hey, it may be easy for you. May not be easy for others. And then also, you're right. This is an easy level question, y'all. So if you see a question like this on NCLEX, what are you thinking? You'll probably see a question like this at the beginning of your exam. But if you're in the middle of your exam and you see a question like that, you might want to start thinking. I didn't say that it wasn't easy. Don't do that. Hey, user, who's that? User 37. Hey, don't do that. I didn't say that the question wasn't easy. But we have nurses that are in here, and we have nursing students, and we have pre-nursing students who don't even know what this is. All right. We don't know. They don't know. So easy money for you, my man. Easy money for you. Make sure you guys smash that like button. I'm gonna give you that answer. Here we go in 3, 2. The answer is C. Rh negative and Rh positive. ROGAM prevents the production of the anti-Rh antibody in the mother that has an Rh positive fetus. I learned this on Tuesday, but I still don't know. That's okay. That's okay. Snow says yes. Yeah, there you go. Who's that? User 37. I'm trying to say it's not. Hey, you say common sense, but common sense isn't always common, my guy. You know. Only for the second baby. I'm a nursing student, and this is on my study guide for my exam on Monday. Look at you. Look at you. All right. I'm taking OB Monday. Thank you, sir. You're welcome. You're welcome. You're welcome. Cool. You're currently pregnant. Oh, I'm sorry. I mean, congratulations, girl. That's what I'm talking about. Pregnant baby. We love babies. Drinks all around. I learned about that this in surgical tech school. Same these. All right, here we go. Hey. Going on to the next one. Here we go. Question 51. I think I'm going to give y'all probably about another 5 questions, and then we're going to roll. I'm sorry. It's crazy. I'm just playing. Hey, smash that like button and tell me y'all love me. You know what I'm saying? Because that's what we do out here. All right, here we go. Question 51. A new mother has some questions about PKU. Which of the following statements made by a nurse is not correct regarding PKU? A Guthrie test can check the necessary lab values. The urine has a high concentration of a phenylpuric acid. Mental deficits are often presented with PKU, and the effect of PKU are reversible. Everybody saying D. Angel says D. Stephanie says D. What else we got? The answer is D. Okay. D. Shout out to the follows. Appreciate all the follows. PKU can cause brain damage, right? Mm-hmm. Whoa. Tweedledee. C. Easy money. Okay. Haley says B. Or is it Hallie? Hallie says B. All right, cool. We good out here. I got you. We got you. Lexi, you've been here the whole time and you just not following me? Rude. I mean, I appreciate you. A special diet for PKU patients. John Africa says B. Okay, here we go, y'all. Here we go. In 3, 2, and the answer is D. The effects of PKU are reversible. So remember, let's read the question. What did the question say? Which of the following statements made by the nurse is not correct? No, you're good, Lexi. You're good. Oh, I read the question wrong. Not Mr. telling me easy money and common sense. Not you getting the question wrong, my man. Come on, bro. Come on, man. Hey, RTFQ that shit, my guy. Read the fucking question. No, I'm just messing with you. We good out here. We good. Hey, that's why I say read the question. Hey, shout out to y'all. Hey, all y'all need to follow me and stop playing games. All right, here we go. PKU is an inherited disorder that increases the level of phenylalanine, right, in the blood. Like somebody said, if PKU is not treated, phenylalanine can build up the harmful levels in the body, causing intellectual disability and other severe health problems. I'm laughing so hard. Look, I'm just trying to tell y'all. Don't be coming up in here fucking with me because I'm a mess with you. Nah, he cool though. He cool. I see where he coming from. All right. The signs and symptoms of PKU vary from mild to severe. The most severe form of this disorder is known as classic PKU. Infants with classic PKU appear normal until they are a few months old. Without treatment, these children develop a permanent intellectual disability. Seizures, delayed development, behavioral problems, and psychiatric disorders are also common. Untreated individuals may have a musty or mouse-like odor as a side effect of excessive phenylalanine in the body. Children with classic PKU tend to have lighter skin. Hashtag, light skin. Never mind. Light skin and hair that unaffected family members, and are also likely to have skin disorders such as eczema, because they got eczema. The effects of PKU stay with the infant throughout the life. And there's that. Shout out to y'all for following me. Hashtag light skin. You already know what the deal is. Hey, health promotions and maintenance, y'all. Health promotions and maintenance. All right. Eczema. Ha! Hey, y'all caught that? Oh my God. Hey, I appreciate y'all. Y'all are a bunch of good sports. Y'all are a bunch of good sports. I'm just trying to say, hey, I don't do roast battles, but I told you, you come in the chat, I will roast that ass, and I will ban you. But I'm not gonna ban him. I like him. I hope he didn't go nowhere. Hey, user37, you still up in here? You better still be up in here. Question number 52. A patient has taken an overdose of aspirin, so they're no longer ever gonna have a headache again. Which of the following should a nurse must closely monitor for during acute management of the patient? Is it onset of pulmonary edema, metabolic alkalosis? Is it metabolic alkalosis, respiratory alkalosis, or Parkinson's disease type symptoms? Camille says B, 95% sure. Okay. No clotting for them. I remember Cat Williams said he's like, aspirin is perfectly legal, but if you take 13 of those motherfuckers, it'll be your last headache. Oh my God, that's not funny. We nurses out here, all right? That's how we gotta be. All right, Cass says D. Ashley says B. I'm gonna give y'all another 15 seconds. It's going to cause metabolic acidosis, which the body will compensate with respiratory alkalosis. Look, Lauren, girl, look at you, little smarty pants. I like how you articulated that. Okay. The boot nurse B. All right, I see you. User 57. Alicia, thank you for the follow. All right, so here's our answer, y'all. Here's our answer. It's coming in 3, 2. Onset of pulmonary edema. It's too much what? It's too much for the kidneys. Okay. Getting humbled real quick. Look, you know I'm about this life. All right, so the answer is A. So now a lot of people are going to be like, oh my God, like what? Kristen, you got it, girl, you got it. So check this out. Remember, we want to read the rationales, right? We want to understand why we got it right or why we got it wrong, okay? So bear with me. Aspirin overdose can lead to metabolic acidosis and cause pulmonary edema development. Early symptoms of aspirin poisoning also include tinnitus, hyperventilation, vomiting, which is where I think you can see the metabolic alkalosis come from, dehydration, and fever. Late signs include drowsiness, bizarre behavior, unsteady walking, and coma. Abnormal breathing caused by aspirin poisoning is usually rapid and deep. Pulmonary edema may be related to an increase in permeability within the capillaries of the lungs, leading to protein leakage and with a transudation of fluid in both renal and pulmonary tissues. The alteration in renal tubule permeability may lead to a change in colloid osmotic pressure and thus facilitate pulmonary edema. Google says rapid breathing, respiratory alkalosis. Well, Google's not taking your NCLEX. There, I said it. Not even that. PE from accidental overdose, definitely good to know. That's what I'm saying. That is definitely good to know. Can a baby aspirin a day cause this? I don't think so because baby aspirin, it's baby aspirin is such a low, has like such a low dose that this is somebody who just like decided to grab the bottle and slam it like with a bottle of tequila. You know what I'm saying? I wish Google would take my NCLEX. Look. You ain't even got to tell me. Google not taking the NCLEX. And that's, hey, I'm just keeping it real. WebMD is reliable. Stop it. Oh, Google don't solve everything. That's facts. All right, here we go. Next one. Question number 53. A 50-year-old blind and deaf patient, which is probably some of y'all that are in my chat, has been admitted to your floor. As the charge nurse, your primary responsibility for this patient is what? Let others know about the patient's deficit. Communicate with your supervisor your patient safety concerns. Continuously update the patient on the social environment. Or D, provide a secure environment for the patient. We got D's all around. Maddie says C. I think Maddie is the first C I saw. Safety is priority. Okay. Lexi says D. Is it Ashlyn or Ash? Is it Ashwin or Ashlyn? That's different. That's a different type of name. A, B, C, D. So you picking all of them? Lord have mercy. It ain't select all that apply. D, easy money. Oh, here we go. Here we go, easy money. Let's see. Let's see. No falling allowed here. That's right. The priority. Okay. D for sure for safety. Okay. Come on. All right. D. All right. All right. I'll give y'all another 10 seconds. Not Lauren saying easy money. All right. Here we go. Here we go. Answer in 3, 2. The answer is easy money. That's what the answer is. Oh, shit. Provide a secure environment for the patient. That's what the answer is. Easy money. This patient's safety is your primary concern. Okay? Safety. Remember, nursing is safety first, safety first, safety first. Okay? Patient safety protocols can help reduce medical mistakes and prevent adverse patient outcomes. When the goal is to help people, it seems obvious. You heard what I said? It seems obvious that it's important to work to protect them from unintended or unexpected harm. But let me tell you something right now. There's some people that just be like, you be forgetting a whole bunch of stuff. I'm just keeping it all the way real. All right? We be forgetting. Call, don't fall. Facts. All right, here we go. Here we go. Appreciate y'all. Y'all are rocking it. Make sure you guys share. Make sure you guys like. Smash that like button. Give me the follows, baby. Give me them follows. All of them. I need all y'all to be friends, minus one of y'all, since y'all think y'all cool as shit. I love this. Where were you when I was in RN school? I don't know. Probably working in the ICU somewhere, maybe. I don't know, probably. But it depends on how long you've been a nurse. All right, here we go. Question number 54. A patient is getting discharged from a skilled nursing facility. The patient has a history of severe COPD and PVD. The patient is primarily concerned about his ability to breathe easily. Which of the following would be the best instruction for this patient? So what is the if I could tell this patient one thing and then dip out, what's the one? What do I want to tell them? Deep breathing techniques to increase oxygenation level. Cough regularly and deeply to clear airway passages. Cough following bronchodilator utilization, or decrease CO2 levels by increased oxygen. Take output during meals. I don't even like the way that I read that. That was terrible. Which I'll answer. I'm torn between A and B. Okay. COPD. Patients breathe shallowly. Bed not do D. Oh, so now we holding each other. Now we holding people accountable inside the chat. Okay, all right. Ashton Parker, Miss Parker, what'd you say? She said A. Okay. Technically A and B. Well, technically you can only pick one. So which one? So which one is more right? There you go. What is flibber? What that is? What is that? I'm gonna give y'all 15 more seconds. Soap says A question mark. B, easy money. Oh, here we go. Hey, just change your name to easy money. Just change it. Like, I don't want to see user 37. Like, after we get off this shit, you better follow me and you better change your name to easy money. And then every time I do this stuff, you better jump in here talking that shit. Okay? Since it's easy money. All right? Here we go. Right? All right, here we go. Here's our answer. 3, 2. And the answer is C. Cough. Following bronch cough will clear. What? What? Savage says party. That's what I'm talking about. I wanted to change it to C. I got it right. Metal girl, go ahead. Yeah. Hey, look, it happens out here. But you want to know what's important? Reading the rationales. I don't care. You could do your very first quiz and you can score really low. But hey, I expect for you to be really low, but a month later for you to be a lot higher than you were previously. All right. So bronchodilator will allow for more productive cough because what will it do? It will open up them sacs. That way when you cough, gets all that nastiness out of there. Short, sweet, to the point. This brings me back memories about 13 years ago. April, we can go back in time. You want to go back in time and go back to school? Nah, me neither. I ain't trying to do all that. I ain't trying to do none of that. All right, here we go. Question 55. A nurse is caring for an infant that has recently been diagnosed with a congenital heart defect. Which of the following clinical signs would most likely be present? Would it be a slow heart rate, weight gain, a decreased systolic blood pressure, or an irregular white blood cell count lab value? I'm a teacher, not a nurse, but I've been getting these right. That's okay. That's okay. Hey, you know what? Who said that? Is it Deanna? Hey, come on. Hey, come over here and get you some of this work. Come over here and be a nurse. Angel says C. Brianna says B. Scott Downey says C. C. Dre says something. I'm studying CNA right now, not nursing. That's okay, because hey, I'm telling you right now, you'll eventually be a nurse. I'm in med school. See, that's why you talking that. Okay, y'all see him, right? Y'all see him, right? He was talking all that mess. So now he's like, oh, he in med school. Look at this guy. Look at this guy. A, B, C, D. Okay, what we got? I'm gonna give y'all 10 more seconds. Make sure y'all smash the like button, y'all. Hey, y'all lacking over here. I'm in paramedic school. I better get some. Yeah, that's right. I can't wait. All right, here we go. Answer 3, 2, and the answer is B. Weight gain. What? Most humble med school. Hey, I'm trying to tell y'all. You got it. Shout out to you, Camille. Look at you. Brittany, like what? Wait, what? All right, let's read the question. All right, which of the following signs and symptoms would most likely be present? So, weight gain. So think about it. They have a heart issue, and they have weight gain. Hey man, you're awesome. This is helping so many people have a great week. You too, man. Hey, I appreciate you being a good sport. All right, so weight gain due to fluid accumulation is associated with heart failure and congenital heart defects. When the heart does not circulate blood normally, the kidneys receive less blood and filter less fluid out of the circulation into the urine. The extra fluid in the circulation builds up in the lungs, the liver, around the eyes, and sometimes the legs. Nurses have to correct MDs daily. Letter A. Hey, easy money, hard money. Hey, the reality is, nurse. Hey, we save doctors, and that's on. I can't say the dead homies. I feel like that's probably not really good for me to say, but I've been saying it. So, hey, on the dead homies, I've been studying for my AA. Okay, a nurse practitioner in the house. Okay, all day, and I feel like this is taunting me. Let me rest, ma'am. Don't even do it to yourself. Go take a break. It's okay. It's okay. Hey, you doing Gucci out here, Courtney? Don't even worry about it. All right, here we go. Hey, so remember, congenital heart defects, falls in the same category as somebody that has a heart failure, right? So you got to think of the fluid retention that they have, right? You got to think it's in babies. All right. I'm not a nurse. I work in the kitchen. That's okay. You can work in the kitchen. Guess what? When you take food up to the floors, if you work in the kitchen of the hospital, you can start to understand what's going on up in there. You know what I'm saying? And then I'll put that ass to work. Since you know this stuff that we're talking about right here, I'll put you to work and tell you to come do some chest compressions. Oh my God. Hey, we're doing NCLEX questions, y'all. I love y'all's participation. Y'all are doing Gucci out here. Appreciate all the likes. Make sure you guys keep liking. Smash the like button. Keep sharing. And make sure you guys follow me. I need 10,000 people to follow me so I can stream off the computer so I can be unghetto. You know what I'm saying? Don't troll my chat. User37 got lucky because I was about to give his ass a 600. But, we was going back and forth. And he got one wrong. So I'm glad. So he got humbled real quick. So, yeah. Don't troll the chat. Don't be rude, because if you're rude, just like it said, I'm gonna ban that ass, and I'm not playing. I don't gatekeep. I got these questions off of nurselab.com. They had a bunch of questions over there. I picked out a set, and I thought this will be super helpful for y'all. So if you guys want to go look at those questions, go over there and look. I will be part of a nursing school summit on October 1st, and it's presented by True Learn and Picmonic. You guys can go over there. The link is in my bio. It's free to register, and I'm going to be specifically talking about the new generation NCLEX because your boy failed the NCLEX three times, and I passed on the fourth. I've been a nurse for 3.5 years, y'all. I worked in the ICU, I worked in the OR, and I've done some PACU. So, I understand what it's like to be in the position that you guys are in, and this is another reason why I created this 7-day NCLEX course, is because I never want anybody to feel how I felt. I'm telling you right now, and I put that on my son's life, y'all. Like, I love this shit. I love sitting here talking to y'all. I love sitting here giving y'all all this info. I make it a point to be here all the time, and I'm glad that you guys are here with me. So make sure you guys go check that out. $48. It's in the pre-launch phase. Once you get it forever. I actually am working on getting a QBank as well as continually working on the NCLEX review. And also go check out thebootnurse.com. I'm kind of cool over there. Kinda. All right, on to the next one. Here we go. I didn't see what your comments. It says, what's your opinion on HCA and Galen? I'm just not going to answer that question. On to the next question. Put it this way, ma'am. If you're trying to go to school, go to school. If that's what you're trying to do. Okay. Question number 56. A mother has recently been informed that her child has Down syndrome. You will be assigned to care for the child at shift change. Which of the following characteristics is not associated with Down syndrome? Which one is not a part of it? What's not a part of it? Alyssa says C. Hey, just FYI, y'all, when we finish with the questions, I'm gonna do an AMA, like a Ask Me Anything type deal for probably about 15, 20 minutes. All right. So whatever question you guys have, you guys will be able to see my glorious face and talk that shit. All right. So we got C. I don't like these terms, but I'm assuming C. Look, yeah, you ain't gotta like them, but you gotta answer them. You know what I'm saying? Chelsea Lynn says C. Okay. We got B. What else we got? What else we got out here? All right. Let's see what the answer is in 3, 2. The answer is C. Oily skin. The skin would be dry, not oily. There. That easy. Y'all. That easy. Yes, sir. You already know. Whoop, whoop. Shout out to you, Brittany, getting the answer right. All right, Camille over there celebrating. All right, Alyssa, I see you. All right, cool. Hey, remember, when you guys are studying, best way to retain the information, read the rationales, depending on whatever you have. If you have Saunders, if you have Kaplan, if you have ATI or whatever, read these. Read the rationales and figure out why you got them wrong, okay? Or figure out why you got them right, but especially the ones that you got wrong, okay? Here we go. A client with myocardial infarction is receiving tissue plasmagen activator altipase. Oh my God, I'm tired already. While on the therapy, the nurse plans to prioritize which of the following? Is it A, observe for neurological changes? Is it B, monitor for any changes of renal failure? Is it C, check the food diary? Or is it D, observe for signs of bleeding? TPA, yep, breakdown clots. Look at you. Look at you, Mary Rose. Okay, shout out to you. Shout out to y'all. All right, what else we got? Question number 57. I'll try to bring this down so everybody can see it. All right, cool. We got some A's, we got some D's. All right, let's see. Here's y'all's answer. Here we go. In 3, 2. And the answer is D. We want to observe for signs of bleeding. Bleeding is the priority concern for a client taking thrombolytic medications. The primary mechanism of all thrombolytics is the conversion of plasmagen to the active form, plasmin, which then degrades fibrin. It can occur with fibrin-bound, plasmagen on the surface of thrombi and the unbound form within the plasma. The unbound plasmin generated, oh my God, who in the world? The unbound plasma generated fibrin, but also fibrogen, factor 5, and factor 8. Even though I'm getting a good chunk wrong, thank you, because this is learning. That's what I'm talking about, y'all. That's all this is a learning process. You guys are not, hey, we're not in the testing center right now. You're not at school, you know what I'm saying? Y'all are in my house. You know, y'all in the TBN University. This is what we're doing right now. All right. I want you to get these wrong. I want you to get them wrong because you're going to learn from it. All right. You're part of TBN University now when y'all are up in here. Hey, as a matter of fact, that's what we calling it. We calling it TBN University. Hey, welcome to TBN University. That's how we do it. TBN stands for the boot nurse. We all got to have a mask or some shit. You know what I'm saying? So here we go. I love this group learning style. It's kind of like the group there. It is like group therapy. Thank you for your support, sir. I appreciate that. Heather, thank you for the follow. Here we go. Question number 58. A patient asked a nurse, my doctor recommended I increase my intake of folic acid. What type of foods contain the highest concentration of folic acid? Is it green vegetables and liver? Is it yellow vegetables and red meat? Is it carrots or is it milk? What we got? Shout out to all 277 of y'all that are in here rocking with me. Make sure you guys smash that like button. Make sure you guys share. And more importantly, make sure you guys follow me. I need all y'all to follow me. I need 10,000 people. 10,000 people so I can start streaming off the computer, y'all. I'm trying to get unghetto out here. Unless you want me to be ghetto, and then I'll just be ghetto. Maxine says A. Is it she says A. Lady says A. Whatever that long ass line is with Peter Griffin is says A. Ghetto is fine, ma'am. I ain't trying to be ghetto my whole life. We're trying to come up. We're moving on up. All right, here we go. 5 seconds, y'all. I don't mind the ratchet. All right, that's fine. Ghetto is fine as long as you're intelligent. I don't know about all that. I'm a little slow. Here we go. Hey, y'all awesome out here. Here we go. And the answer is A. Them green leafy vegetables, y'all. And that liver. Green vegetables and liver are a great source of folic acid. All right. Yeah. That's part of Basic Care and Comfort. Basic Care and Comfort is one of the lower sections on the NCLEX pie. However, the lower sections could definitely help get you over the top when it comes to passing the NCLEX. The Basic Care and Comfort, if I remember right off the top of my head, it's about, I think it's 8 to 12% of the entire exam. 8 to 12% of the entire exam. Remember, management of care, pharmacology, and physiological adaptations are the largest sections on NCLEX. They make up 44 to 49% of the entire exam. Okay, every question does count. I'm just saying, but if you know numbers, you know, I'm trying to tell you, management of care, that'll do it. All right, here we go. Question number 59. A nurse is putting together a presentation on meningitis. Which of the following microorganisms has not been linked to meningitis in humans? Keyword, has not. Right? We RTFQing out here. I'm literally going to put that on a shirt. I'm going to put it on a shirt. RTFQ. Brittany. She said, what'd you say? You said B? Yeah, she said B. Okay. Jasmine, thank you for the follow. Appreciate you. You're like, D is related to the gut. So which one is not? I'm going to give y'all 10 more seconds. D. Just learned about this illness, so it's D. Okay. Is it Lexi? All right, here we go. Answer in 3, 2. The answer is D. C. diff. Clostridium difficile is a germ, bacteria that causes life-threatening diarrhea. It is also a side effect of taking antibiotics, right? I had viral meningitis at 2 months old. Eddie, I'm glad that you're alive. Hey, look who's alive and here with us in the live. So obviously you're not 2 months old, you know what I'm saying? So, but we glad that you made it through that, you know what I'm saying? You can't see the whole screen. Here, let's see. Back up. How's that? Is that better? Let me know if that. Give me a thumbs up if that's better. That was an 88. Oh, okay. 80s baby. I see you, girl. Hell yeah, that shit is. That smell is. Hey, I'm trying to tell you, C. diff is the best smelling thing you'll ever smell in your life. Hey, go ahead and give me a thumbs up if you agree. Hey, I'm just playing. Hey, don't agree with me on that. That shit is terrible. All right, here we go. Question 60. Y'all, we rocking here. Question 60. A nurse is administering blood to a patient who has a low hemoglobin count. The patient asks, how long do red blood cells live in the body? The correct answer is 45 days, 60 days, 90 days, or 120 days. 120. Hey, appreciate everybody. Hey, smash that like button. Make sure you guys follow me. All right. Hey, share it. Share these. Hey, we got a good amount of questions still left on here. We got a good amount of questions, y'all. Good amount. All right. Hey, so what do you guys think? Do you guys think that this was an easy question? This is definitely a knowledge-based question. Yep. So what do you guys think? Is this a passing NCLEX level question? Brandy says easy. Yep, easy. Lola says yes. So this is a passing level NCLEX style question? The answer is 120. Grade school question. Correct. So this is a question that you would get in school. Well, it depends on the patient, the disorders that have shortened red blood cell span. Blah, blah, blah. Okay, so the question, Turtle didn't even ask you all that. Didn't ask you all that at all. Didn't ask you that. Remember, don't put extra information in there. You keep the information that you have. You use it. You utilize the information that you have. Hey, y'all, is this NCLEX for RN? It's for both, Mary. It's for both. Remember, the big difference for NCLEX in regards to RN and LPN is knowing what your responsibility is as a RN, what you can't do, what your responsibilities are, what you can and can't accept. Other than that, all relatively the same. Don't read into the question. Yep, there you go. Scope. There you go, Brandy. Scope. Awesome. Thank you. Doing the Lord's work. Amen. Here we go. Oh, hey, we're at a break. We'll keep going, though. We'll keep going. And interventions. Yep. So, like, hey, I hear some people say, like, oh, well, my school said that I can start IVs. Nope. According to NCLEX, sir or ma'am, you cannot start IVs because NCLEX is on a national level, not on a state level.
Woo. I almost knocked y'all over. Apparently, I'm with the disrespects. Here we go. Question 61. A 65-year-old man has been admitted to the hospital for spinal stenosis surgery. When should the discharge training and planning begin for this patient? Following the surgery, upon admission, 48 hours of discharge, or the preoperative discussion. We got B, the Spencers. How many Spencers are there? Spencer says at admission. Okay. B, nah. You say B, nah. What you mean? D, Brandy says D. Okay. Upon admission, says Lauren. Okay. Orientation phase. I just passed my exit exam today. Tomorrow, LPN graduate. Shout out to you, Amy. Shout out to you. All right. I'm going to give you about 10 more seconds. We'll fly through it. All right, B. We got some D's in there. B and D. Nah. Oh, okay. I got you. This question is on my fundamentals exam. Okay. Here we go. Answer in 3, 2. It is upon admission. Right? That's exactly when you start doing all your education. Let them know at the beginning, too. Discharge education begins upon admission. Ideally, it involves the client and the family as well as the hospital staff. Effective discharge planning can decrease the chances of the client being readmitted to the hospital and also can help in recovery, ensure medications are prescribed and given correctly, and adequately prepare folks to take over the client's care. Can't say it's that simple. AdPi, there you go. I need to stop changing my answer. Camille, I'm gonna need for you to stop changing your answer. The plan is always to get them ready for discharge. That's facts, 100%. Shout out to all 400 of y'all in here rocking with me. Make sure you guys share. Make sure you guys follow, and make sure you guys smash that like button. Smash it. I want y'all to kill that like button right now. Kill it. I need 80 million thousand likes, y'all. Kill it. Kill it right now. All right, here we go. Question number 62. A 5-year-old child has been recently admitted to the hospital. According to Eric Erickson's psychological development stage, isn't he cool? The child is in which stage? Trust versus mistrust? Was it a initiative versus guilt? Autonomy versus shame and doubt? Or intimacy and isolation? We say you learn something new every day. Let me go back. It says, I didn't know anything when I started. I'm advancing and learning something new every day. That's what I'm talking about, Chelsea. That's what I'm talking about. That's why we do these things out here, baby. That's why we do them. All right, what do we think? We got C. The Spencers say C. Is it Jada or Jaya? Thank you for the follow. Oh God, that pyramid. Ain't it great though? Always B. Destiny. There's only one B. What do you mean? C is toddler. Okay. All right, here we go, y'all. Here we go with our answer in 3, 2. The answer is B. The answer is B. Remember, we have a 5-year-old, y'all. 5-year-old. Honestly, I'm guessing out here. That's okay. That's okay for you to guess, right? It is as children enter the preschool age or the preschool years, 3 to 6 years. Old is that they begin their third stage of the psychological development centered on initiative versus guilt. It is important for the children or for the kids of this age to learn that they can exert power over themselves and the world. Okay. How we doing? We good out there? All right, cool. Hello, user 76. It's me. On to the next one. Here we go. Question number 63. A toddler is 26 months old, right? So let's think about that. 26 months old and has been recently admitted to the hospital. According to Erickson, him again, which of the following stages is the toddler in? You say A, we got C, okay. We got C, okay. A, we got C. Okay, well, obviously we know it ain't B, right? Because that was just the one before that, right? So we got A, C, okay. A, C. Camille says it's C. All right, Camille. You sure? Because you've been changing your answers on me. All right, here we go. Here's our answer, y'all. Here we go. In 3, 2. Oh, look at you. All right. Cool. Autonomy versus shame and doubt is the second stage of Erik Erikson's stage of psychological development. This stage occurs between the ages of 18 months to 3 years. According to Erickson, children at this stage are focused on developing a greater sense of control. Let me tell you something. I have an 18-month-old, and this dude is wild. This dude is wild out here. Like, he come over here, be trying to throw hands. Then I got to remember he's 18 months. Man, good thing I'm still going to school. That's okay. Let me tell you something right now. There's nurses that have been out of school for years, and they don't even remember this. It's just like, why would you? Why would you? You know? So it says I got these because I have a degree in. Look at that. See, other stuff be helping out there. Other stuff be helping out. He really do be trying to throw hands. He be out of control. Literally have a PEDS exam in a week on this. That's what I'm talking about. You graduated as an LPN on the 19th. Shout out to you, user 76. Shout out to you. All right, here we go. Question number 64. Lynn, I'm on, what is this? Nurselabs.com. Do NCLEX ask specific stages? They don't really ask specific stages. They ask, essentially, if you got a question like that, it's already presumed that you know what stage it's in. They're not going to ask you, like, what stage is this patient in? If you start getting a question like this, these are like memorization questions, right? Because it's easy. A young adult is 20 years old. Where do they fall in the Erickson stages, right? That's an easy question. That's a memorization question. A memorization/remembering question. So would you think that's a passing level question? Coming from a person in their 20s, that intimacy versus isolation is so real. It is real. These are easy. Camille, you said, these are easy. So here's the thing. If you start getting questions like this that are easy, how do you think that you may be doing on your exam? This isn't to scare you, by the way. This is to keep it very, very honest. And yeah, you're right. D. The answer is D, intimacy and isolation. Yeah, you're not doing so hot. You need to be at the questions that are critical thinking and clinical judgment. So I am the nurse taking care of 4 patients in the emergency room. Who do I see first? That is based off of your critical thinking and your clinical judgment. It means you're not doing good, right? Exactly. I'm in that, and I'm in that stage right now. Well, yeah, that's how we have to develop, right? Intimacy and isolation takes place during young adulthood between the age of approximately 19 and 40. The major conflict of this stage of life centers are forming intimate, loving relationships with other people. I can tell y'all right now that I'm like, how old am I? Fuck, I forgot. I'll be 36 in next month, and I still feel that, like, the isolation aspect. I don't want to be bothered by nobody half the time. Yes, these are next gen. Can we do some hard questions? Brandon, I don't know where you've been at, sir, but we did some hard questions earlier. And you see we at question 65? I'm just letting you know. The nurse is making rounds, taking vital signs. Which of the following vital signs is abnormal? This 100% is a question that you would see if you're not doing well. You want to know why? When I failed my exam the second time, I saw a question like this. My birthday is next month too. Shout out to you. I take my NCLEX in 2 weeks. Hey, Emilia? You're gonna do good. You're gonna do great out there. All right. So what is it? Got B, D, A. Shout out to all 360 y'all rocking with me. If you guys are just joining, we're doing NCLEX questions. These do help for RNs and LPNs, as well as these are helpful for next gen. Make sure you guys smash that like button. Like, kill that. I need y'all to kill that like button right now. I need for y'all to kill it. and I need for y'all to share, and I most importantly need for y'all to follow. I need 10,000 people to follow me on freaking good old TikTok. You're confused? Don't be confused. What is normal? What is something that you would see? Don't let the ages throw you, because the ages will throw you. Who is that? Crystal, thank you for the follow. Appreciate you. All right, I'm gonna give y'all 10 more seconds. 50 is way too low. But look at that. Okay, yeah, 50 is way too low. I think it's B. I'm gonna go D. Okay, it's another memory one. Correct. You are correct. 26 respirations is not normal. 26 respirations is not normal for a 6-year-old. 50 is normal. Hypovolemic shock right there. Okay. Remember, you got to look at all aspects. Like, look at this point, age is a factor. Like, okay, would a 6-year-old have 100? Would they have 100 of breaths per minute or beats per minute? I'm sorry. Would they have a respiration of that? Would they have a blood pressure of this? All right, so here we go. Here's our answer. 13 are close to it. Okay. Kids' heartbeats are faster. Yep. All right, Brandy says B. All right. I think we have a general understanding of this, right? So here we go. Here's our answer in 3, 2. The answer is B, right? Now let's go through it. This is why it's super important to read the rationale. Shout out to all 600 of y'all that are rocking with us. We're doing NCLEX questions. The normal range of vital signs from 11 to 14 years old. Heart rate, 60 to 105. Respiratory rate, 12 to 20. Blood pressure, systolic, 85 to 120. Diastolic, 55 to 80. Body temp, 98 degrees to 98.6 degrees. The client's diastolic blood pressure is lower than the normal range. Both her respiratory rate and heart rate are slightly increased. Thank God for the rationales. That's what I'm trying to tell y'all. That is where y'all get the learning. That is where you retain the questions are great, but when you're studying, this is the most important portion. I promise you. Screenshot the rationales. Screenshot them. Do you, boo? I mean, sir or ma'am or whoever you are. Here we are on a Friday night, y'all. Hey, shout out to y'all. Shout out to y'all being here on a Friday night. Hey, reduction of risk potential. All right, that is one of the 8 sections of the NCLEX pie, and this is where this question falls under, okay? So here we go. Hey, real quick, doing NCLEX questions. I appreciate all the love. Make sure you guys smash. Do I like UWorld? UWorld's okay. Thanks for the participation. Keep participating. I'm kind of funny. We're talking that shit up in here, so that's what we do. Smash the like button. Make sure you guys share. Especially make sure you guys follow. I need 10,000 followers so we can rock. Don't troll my chat. Nobody's done it today except for one, and I almost got rid of him, but he stayed. He cool. You troll my chat, I'm going to ban your ass. Literally, that's what it says. I'm going to ban that ass. I don't gatekeep. I got these questions from nurselabs.com, so make sure you guys check that out. Also, I'll be part of a nursing school summit presented by True Learn and Picmonic. That link is over there in my bio. You can go over there. You can register for it. It's free. We're doing it on October 1st, and I'm specifically going to be talking about the new generation NCLEX. And about how the changes happen so everybody can get a better understanding of that. So like I said, make sure you guys like, share, follow. Also, I created a 7-day NCLEX course. It's in the pre-launch phase. It's $48. Once you have it, it's yours forever. I failed my NCLEX 3 times, y'all. 3. And I created that because I never want anybody to feel like they're a failure, ever. I don't care what aspect of life that you're in. I don't ever want you to feel that way because all your unsuccessfulness is just ways to learn. And you learn from them. I think Archer is really good. Archer's really good. I can go through a list, too. Also make sure you guys check that out. Like I said, $48. Once you have it, it's yours forever. At least for now, for the pre-launch phase. And then check out thebootnurse.com. I'm kind of cool over there. So here we go. Question number 66. I'm going to see what you guys said real quick. Picmonic was so helpful for Patho. I love Picmonic. Picmonic, they're great, honestly. What do you think about Archer? Lin, I think Archer's great, honestly. I think Archer's great. UWorld has gotten a lot better because I think they now have content videos. Their questions are great. What else? And do I like UWorld? Yeah, I think I said that already. A lot of videos that you can review. Yep, they do. A psych question. Yep. I love Kaplan. I used Kaplan when I studied. I actually used Kaplan. I used UWorld. I used Picmonic. I used Hearst Review. I did Mark Klimick. I did UWorld. I did a lot. I failed 3 times, y'all, and I used a lot of stuff. So, all right. So here we go. What are we thinking for our answer? I didn't even read it. I'm currently using Kaplan, but that's what my school provided me. Honestly, I think Kaplan is great, if you want me to be completely honest. What does it say? It says, is there a phone app you can recommend to study? I honestly don't like recommending phone apps because it's not realistic in front of you, like how you would actually sit in front of a computer, but that's just me. But I think it's like Nurse Mastery or NCLEX Mastery. I think they have an app. UWorld has an app. Archer has an app. I'm not a big fan of Hearst Review. So here's the thing about Hearst. That country ass accent she got, not even gonna lie to you. It's distracting as hell. Oh, the NCLEX is easy. All right, Crinkle. I was about to call you Crinkle Fries, but the NCLEX is not easy. However, in my opinion, I love the new generation NCLEX. Simple Nursing is good too. Lippincott is cool. I actually have that book, and I could not do it. I'm still reading the question wrong. Stop reading the question wrong then. What is the most likely to be taken? Most likely, the school used Hearst. So I have, there's people I've coached. I do one-on-one coaching and I do group coaching, and they don't like Hearst, but that's just them. I mean, like I said, it all just depends on you and how you learn and how you absorb and retain knowledge. I used, UWorld, Hearst, Mark Klimick while taking the NCLEX. I pulled from each of them. Yep. I don't recommend using more than two, but like look, Kendall said she loved Hearst. I didn't say Hearst was bad. I just think Aunt Marlene and her country ass accent is just too much for me. Hey y'all, it's Aunt Marlene, or same thing with registered nurse RN. I love Nurse Sarah. But let me tell you something. That country accent, boy, let me tell you. All right. Hey, so what are we doing? I didn't even read that question. Hey, we're talking about, what is it? A tricyclic antidepressants, right? And used to treat symptoms of depression. Nurse Sarah does go hard. I ain't lying to you. Did anyone here pass already? We had a bunch of people that said that they passed their NCLEX. They were in here earlier. So, Gretchen, thank you for the follow. Madison, appreciate the share. Yes, the country accent. I'm telling you, that's one of those physical barriers, or environmental barriers that I have in regards to Hearst. I tried. Nurse Lemmy says she passed in July. Shout out to you. Oh, next gen. How is Select Auto Apply graded? It's graded based on the partial credit, partial points. Which of the following conditions would a nurse not administer erythromycin? Which one? D. Okay. Say D out here. Yeah, they do partial credit. D. Okay. D is autoimmune. Okay. Hey, I'll take that one. Oh, I didn't see it. Lexi says D. Oh, I don't know. That's okay, Lauren. If you don't know, you about to find out. Hey, because the more you stick around, the more you find out. And by that, I mean the rationale and the answers and stuff like that. Give us a select all the apply for real. Well, if it comes up on here, then it will. You missed all the select all the applies, my guy. We had a whole bunch. All right, here's the answer in about 10 seconds. I'm lying. Here we go. Boom. The answer is, of course, multiple sclerosis. It is a potentially disabling disease of the brain and spinal cord. It cannot be treated with antibiotics. Just popped up on my For You page. Shout out to you, Andrew. Hey, Andrew, here's another thing. I put these videos up on YouTube. So if you want to go and look at the lives on YouTube, there's a bunch of other ones that I go through as well. Also, I got these questions from nurselabs.com, so you can go over there and look as well. Yes, NGM practice. Yep. Can you go back to the question one more time? Lauren, no, I will not. Okay, we'll go back. There it is. Bless. I'll go take a look. Yeah, man, I appreciate you. And make sure you follow. Make sure you share. Shout out to all 700 y'all in here rocking with me. All right, Lauren, I'm done. I can't stick here. People are going to yell at me. Here we go. Question number 68. A patient's chart indicates a history of hyperkalemia. Which of the following would you not expect to see with this patient if this condition were acute? Yeah, I know a lot of y'all are not going to like the verbiage. I know you're not going to like the verbiage right now. I'm telling you right now. But I'm telling you right now, which of the follow? So here's the thing. If the verbiage is not how you like it, reword it. Reword it for yourself. All right. Migraines. Yep. What else? Got some C's. Got a D. Paresthesis. Got it. All right. So we got D. Got most people out here saying D. I don't think I saw anything else. I think I saw a C up in here. No. Oh, I did see a C. Okay. Thought I was blind. Nikki said C. Is it J says C? CJ says D. All right, here we go, y'all. Here we go. Answer in 3, 2. And the answer is D. It's migraines. Migraines are not a symptom of hyperkalemia. What are the signs and symptoms of hyperkalemia? Right? Y'all let me know down in the chat. Symptoms of hyperkalemia when present are nonspecific and predominantly related to muscular or cardiac functions, right? So here's a really good thing to think about understanding, oh my God, potassium, like the potassium deficiencies, right? So think about kalemias do the same as, except for heart rate and urine output. So everything that with the prefix, so if we're talking about hyper, everything is up except for heart rate and urine output. With hyperkalemia, everything is up except for the heart rate is down and the urine output is down, right? And then if you go back and if you do hypokalemia, everything is down except for the heart rate and urine output are up. Okay? Think about that. That's a really good way for you to remember it, especially if they start throwing out signs and symptoms of you when you start to get a really good critical thinking type of question. All right? All right, here we go. Question number 69. A patient's chart indicates a history of ketoacidosis. Which of the following would you not expect to see with this patient if the condition were acute? So essentially, somebody's going to present to you with diabetic ketoacidosis, right? What are the signs and symptoms of that? Whatever those signs and symptoms are, those are the ones that are correct. So which one is incorrect? We got C, weight gain, okay. C, Kristen says B. Is it Kurduk says C, Maxine says C, Madison says C, Lauren says C. Lauren already answered, y'all. That's the answer. The keyword is acute, correct. The keyword is acute, but what's the other keyword? What's the other keyword besides acute? Everybody saying D, okay? Yes, the answer, acute and not. The answer is not. The real big one is not, right? That is the key word. All right, so here's our answer, y'all. 3, 2, and the answer is C, right? Weight gain. Rapid weight loss occurs in patients with newly diagnosed with type 1 diabetes. In people with diabetes, insufficient insulin prevents the body from getting glucose from the blood into the body's cells to use as energy. When this occurs, the body starts burning fats and muscles for energy, right? Causing a reduction in overall weight, as well as, other not so good stuff. I'm trying to tell you, anybody, if you ever see a patient come through the emergency room that has DKA, you'll see their heart. I've seen them as high. I saw one who had DKA and their sugar was like at 1,000. And I was like, bro, what in the hell is happening here? And, they got brought in via ambulance because they started having an altered mental status and all kinds of craziness going on the highway. So, yeah, you'll see. Yeah, Lauren, it's crazy. It's crazy. Just like I've seen people, normally when I see people that have hyperkalemia, when they would come into the ER and we would get report, their Ks would be like 9 point something. I'm like, well, let's get them on. Let's see what that EKG look like. But all right, here we go. Patient. A patient's chart indicates history of meningitis. Which of the following would you not expect to see with this patient if the condition were acute? Appreciate all 500 y'all rocking. Yeah, that is insane. Appreciate y'all rocking with me. Make sure you guys like, share, follow, smash that like button, share. But I need the follows, y'all. I need the follows, y'all. Hey, y'all are all part of TBN University now, baby. So we got A. Okay, I saw some D's in there. Throw some D's on it. Hey, some of y'all are probably too young for that. I'm sorry. Shout out to all my millennials out here. You know what I'm saying? That's how we do. Fever is a cardinal sign. Okay. All right. I followed you about a month ago. You followed me about a month? Oh yeah, you did. I remember. Yo, I see you. EMS. We good out here. Not all too young. Hey, Camille, come on now. Here we go. Here's y'all's answer. Here we go. In 3, 2, 42 here. And she's like, I feel so out of place in school. That's okay. That's all right. Hey, remember, you're never too old to go back to school. So, hey, it is an increased appetite. Loss of appetite would be expected. Most causes of meningitis are caused by an infectious agent that has colonized or established a localization infection elsewhere in the host. Potential sites of colonization, unlike Wakanda, because we don't go there. Or infection include the skin. The nasopharynx, the respiratory tract, and the GI tract, and the genital urinary tract. The organism invades the submucosa at these sites first by circumventing host defenses. Yeah, by circumventing the host defenses. There we go. There it is, y'all. There it is. We Gucci out here. We Gucci. All right. Hey, remember, always answer your questions, and if answer your questions to the best of your ability, as well as read your rationales. You got to read your rationales. All right. Cool. Here we go. Here we go. Hey, y'all. Hey, we at question 70. Hey, by the way, this is the most questions that I've ever done on a live. I usually stop at like 25 or 30. But hey, y'all was Gucci out here. Y'all got me to 50,000 likes. I would like 100, but you know, whatever. And y'all are out here sharing. Y'all get me to 10K. Rocking out here. All right, here we go. Question number 71. E, I appreciate you being here. A nurse is reviewing a patient's chart and notices that the patient suffers from conjunctivitis. Which of the following microorganisms is related to this condition? B, H, pylon in the stomach. What? You're still on here? I cooked dinner, ate, and showered, and on question 46. Look, I just said that, Scorpio. I'm trying to tell you, we still on here. We still on here. We still on here. We almost done. We almost done, though. We almost done. I got 400 plus people up in here rock with me, listening to me run my mouth. Man, you're still alive. Avery, girl, you already know what the deal is. Hey, you the real one. Y'all too nice out here to me. Y'all too nice. All right, I'm gonna give y'all about 10 more seconds. Avery, I thought you done went to sleep and ain't getting, you know, I thought you was just like, I'm going to bed, you know, old lady style. Here we go. Wait, hold on, let me go back. And the answer is D. It is not C, whatever y'all said. It was B. The answer is D. The answer is D. This has no business being on NCLEX. So here's the thing. A question like this is on NCLEX. Because think about it. If you get a question like that on NCLEX, is it considered passing? Totally guessing. I got it. Yeah. Hey, shout out to you, Angela. I'm gonna start calling you Big Ange. Can I call you? I don't know why. I feel like I call everybody Big Ange. I don't mean that. I got. Is it you got vertigo from oysters? Is that what you said? Did I read that wrong? It's easy. You're right. It is easy. So my question to everybody that's in here, which for people that I already know have been answering, you will get question. If you are not doing well on NCLEX, you will get a question like this. And if you're just like, damn, that question is easy, that's where you need to reevaluate yourself. As in like, well, shit, I'm probably not doing so well. I should probably figure it out. Please don't call me Big Ange. All right, Angela, I got you. I won't call you. I will call you Big Ange. Emily said, I'm done with LPN on Monday. Thank you. Needed this. Hey, I'm here for y'all. Not an RM, but let me see if this RTT can hang. Hey, you can hang. I've had plenty of RTs hang up in here with us. So here we go. Question number 72. A nurse is reviewing the chart and notices the patient is suffering from Lyme disease. That good old Justin Bieber. Oh my God. I'm sorry. I didn't mean to say that. Which of the following organisms is related to this condition? But as a nurse, there's no reason for this to be on an NCLEX exam. I'm just saying. So once again, the NCLEX exam is for people who are going to become a nurse. If you are not doing well on the exam, that's the type of question that you will get. I got mad respect for RTs there, but I love RTs. I love them. I learned so much about the vent from RTs. Actually, my friend, I learned everything from the vent from all of my RTs that I had. Everyone's saying A, so A. Avery, what you mean? Oh, yeah, they are saying A. Okay, I took micro during the summer and made an A. Shout out to you. I'm going to give you about 10 more seconds. Oh, I'm sorry. I didn't know we was on Avery in your time. Okay, cool. There we go. And the answer is A. Lyme disease is the most common vector-borne disease in the United States. Lyme disease is caused by the bacterium Borrelia, was it the Burgdorferi, and rarely whatever. I'm a nurse. I'm not part of a spelling bee. So I got question on Hep A and acid when contacted and standard precautions. I have to look that one back up. Did you hear some RTs in the house? Yeah, we got RTs up in here. I'm an RT in training. Hey, look, we got RTs up in here. I've had plenty of RTs. Yeah. So when you think about hepatitis A, think about hepatitis anus. So, you know, people that don't want to wash their hands, standard precaution type deal. So make sure you nasties are out there washing your hands, you nasties. All right. Here we go. Question number 76. A fragile 87-year-old female has recently been admitted to the hospital with increased confusion and falls over the last 2 weeks. She is also noted to have a mild left hemiparesis. Which of the following tests is most likely to be performed? Is it a CBC, a ECG, thyroid function test, or a CT scan? You got D's. Throw some D's on it. CT scan, okay. Okay. Hey, remember, it doesn't matter if it's easy or not. This is just training. This is what we do. Train till you're tired of it. Train till you're tired of it. People that don't realize, hey, I'm a military guy. I'm very regimented. Like you train all the time, all day, every day. CT to look at that, look for a bleed, right? They will probably do all of them. Yeah, you're right. They probably will do all of them. But which is the only one that you're doing? Hey, shout out to all the love. Ashley, Brittany, thank you for the follows. If you're just now joining us, we're doing NCLEX questions. Make sure you guys like, make sure you guys follow, make sure you guys share. All right, here we go. Our answer is do a CT scan, right? It's performed for further investigation of that hemiparesis. Non-contrast CT scans is the most common used form of neural imaging in the acute evaluation of a patient with apparent acute stroke. Also, she had, a hemiparesis. Also, she has a history of falls and all that good jazz. So we want to make sure that everything is ruled out. Everything is ruled out. If you only had the chance to do one thing on the test, what would that be? Yeah, if you only had one thing to do, if you could only do one thing and leave, what would it be? That's when you hear the word like most. Most is the key word for that. I'm not gonna lie. Is it Camaria McNair? I'm telling you right now. I swear I thought your name was Chlamydia. No lie, and I don't mean no disrespect. I was looking at a glance. Please don't unfollow me. I swear I was like, wait, who name is that? Like, girl, what the hell? Hey, we all good sports up in here. All right? Got an 85-year-old male who's been losing mobility and gaining weight over the last 2 months. The patient has also had the heater running in his house 24 hours a day, even on warm days. Not in this 112-degree heat we had in Texas. Which of the following tests is most likely to be performed? Is it a CBC, a ECG, a thyroid, or a CT scan? So everybody's saying C, thyroid, hypothyroidism. Okay, all right, I see y'all. Appreciate the follows. Let's see, and the answer is thyroid function test. Weight gain and poor temperature tolerance indicate something may be wrong with the thyroid function. Thyroid function tests are designed to distinguish hyperthyroid or hyper and hypothyroidism from the euthyroid state. To accomplish this task, direct measurements of the serum concentration of the two thyroid hormones, most commonly known as thyroxine, are extensively employed. Hypothyroidism. Think about the things about hypothyroidism as well. Right, so what are signs and symptoms of somebody who has hypothyroidism? What's another name for hypothyroidism? Who can tell me? What's another name for hypothyroidism? Slows everything, right? Obtundance, slow, weight gain, Hashimoto, right? What's another one? Or what type of who said it? Myxedema. There it is. Ferb said it. There you go. No. So yeah, there we go. Myxedemic coma, right? They can get myxedema. Myxedema. There you go. Myxedema. Right? Hey, so what's Graves' disease? Which one is Graves' disease? I'm going to read this question while y'all answer that. A 20-year-old female attending college is found unconscious in her dorm room. She has a fever and a noticeable rash. She has been admitted to the hospital. Which of the following tests is most likely to be performed first? Blood glucose, a CT scan, blood cultures, or arterial blood gas. Let me see what y'all's answer are. Yes. So for Graves' disease, it's hyperthyroidism. Everything is up. Like they're agitated, they're hot. Like the good old saying is that with hyperthyroidism, you're gonna run. You run, right? Because everything is so high, heart rate, you name it. So you're gonna run yourself into the grave. Okay. Bring out the leeches. No, you did not. Blood sugar, could be blood. Yeah. Oh, who said that? Maybe septicemia. Okay. Realistically, be a CT scan, a possible fall. I love where your head's at. I love where it's at. All right, I'm gonna give y'all about 15 more seconds. Blood sugar, rash. So what does the rash mean? A fever and a rash. So distinctly the rash. Think about that. What sticks out to you when you think about rash? All of them? Okay. What are we thinking about? Got toxic shock syndrome? Okay. All right, well, let's see what the answer is. Here we go. And 3, 2. Listen. All right, I ain't got nothing else. That's it. Here we go. And the answer is C. It is blood cultures. All right, it is blood cultures would be performed to investigate the fever and rash symptoms. A blood culture is a test that checks for foreign invaders of bacteria, yeast, and other microorganisms in the blood. Having these pathogens in the bloodstream can cause signs of a blood infection, also known as bacteremia, y'all. Bacteremia, damn it. The positive blood culture means that there's bacteria in the blood. There you go, septicemia. Yes, I got this right. All right, let's see. Hey, and that is a wrap, ladies and gentlemen. We did 70. Hey, this is the most questions that I've ever done. I appreciate y'all rocking with me. Thank you for hanging out. Thank you for participating. I love all the love. I love all the likes. I love all that. I appreciate every single one of y'all that came. I don't think I banned nobody, because I'm trying to tell you, if I did ban you, I'm not sorry. I'm petty. Over 9,000 petty. You feel me? So once again, I don't gatekeep. I got these from nurselab.com. Please go over and register for the Nursing School Summit presented by TrueLearn and Picmonic. I will be one of the panelists over there. So it's free. Make sure you guys go over there and register. I did 75 questions. What you mean you want more? I do these every Monday, Wednesday, and Friday. What else is on here? 7-day NCLEX course, $48, pre-launch phase. Once you get it forever. Help me go from Spirit and Frontier. By the way, I will never fly them. But help me analogize from Spirit and Frontier all the way to Air Emirates, baby. That's what we're doing. Make sure you guys check out the 7-day NCLEX course, as well as check out thebootnurse.com. That's where your boy be. And now that we're done with that, let us, y'all look at me and tell me that I look like Jason Derulo, or technically he looks like me because I'm older than him. So, you know, that's how we do. I do the lives every Monday, Wednesday, and Friday at 5:30. So shout out to everybody that was rocking with me. I appreciate y'all. But hey, this is my glorious face. I'm pretty sure one of my TikToks with the code blues brought a lot of y'all up in here. So it says not bad for a software nerd. Hey, that's all good. That's all good. Damn, I was late to the show. You were late to the show, Eddie. You were. Where the baby? The baby sleep. Thank God, because he acting crazy. He acting crazy out here. Handsome face. Man, I appreciate you. Derulo, like, girl, you the one. We ain't doing that. I should do that doppelganger freaking damn filter and tag him and see what he says. Hey, so who are y'all? Who are you? Where are you from? What questions do y'all got for me? All right. And by the way, if you come in here and you troll me again, just because the review's over or just because the question's over, don't mean I'm not gonna ban that ass. Okay? Believe me. I'm ready for bed. Avery, go to bed then, girl. Go to bed. Is he your twin? I don't know. He's my doppelganger, I guess. Shout out to Texas. I live in Texas too. I appreciate these lives so much. Ma'am, you are very welcome. Ohio. What's up there? Cleveland, Boston. Okay, it's cold up there. I always wanted to be a nurse, but thanks. And anxiety. Hey, don't let your anxiety and all that other stuff. Is it Madeline? Don't let that distract you from the goal. Florida. Hey, I lived in Florida for a couple years. I lived in California too. Virginia. Shout out to VA. Oklahoma. Go Horns. I appreciate you. Kentucky. Okay. You're from Georgia. Masters of Nursing. That's what I'm talking about. What you getting your masters in, Cass? Because I'm getting mine in nurse education for obvious reasons, right? How long did it take for you to get comfortable as a new grad? I feel clueless. So who is that? That's Allie. Allie, you're going to go through, shout out to Chirac. You're going to have imposter syndrome. You're going to have it bad. And it's going to be like that for about 9 months to a year. But that's okay, because we all go through that. Every single one of us go through that. So the biggest thing is don't take work home with you, number one. And then number two, Take notes and learn from your mistakes. All right. And then always, 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 I don't give a fuck what people tell you. Always ask for help. And then if you don't get it, or if you don't get the training that you need, document it and then confront leadership about it. That's what I'm trying to tell you right now. You came on my For You page. I was finishing up my prerequisites for a nursing program, and now I'm in law. Oh, look, see, I wish I would have came across the page a long time ago. I offered to care for my Mimo before she passed, instead of hiring help. That's okay. That's okay. You took care of your grandma, and that's noble. There's nothing wrong with that. I thought you were Jason Derulo. How do you know I'm not? How do you know I'm not, Lauren? You're in the entry level RN. Oh, so you're doing okay. I'm tracking. You're getting your DNP. I'm in my last semester of nursing school. Shout out to you, Jasmine. Shout out to you. There's nothing else to do in Oklahoma other than TikTok. I believe that. I believe that. I graduated in December. Any advice for med-surg 2? I'll say to everything that I always say to everybody is get into a small group of people. So you and 3 other people split the notes up, because med-surg is like the whole fucking book, and they'll give you like 15 chapters that you have to do. So split them up like, evenly, and then put all your notes together. You learn more in clinical setting than you do in school. Experience is where it's at. That's true, but you got to get the academics down, and that's what they'll harp on. I don't disagree with you at all, though. Just forget it. What do you mean? Lynn, forget what? What are we talking about? The lives are uploaded on YouTube. Yes, they are on YouTube. Actually, there was one that got uploaded today. And I think I have 2 or 3 more from this, or the ones from this week I have to upload as well. I just got into nursing school. I started in January. Hannah, congratulations to you. You are about to embark on a journey, so you better be ready for it. You graduate in 10 weeks. Shout out to you. I'm a newly retired MP, 5 years early. So proud of you. I appreciate you, sir. I appreciate you. Sir or ma'am, I can't really tell because there's 2 people in that photo. So I appreciate it. I'm a big words of affirmation guy. So it helps me, know that I'm doing something great for everybody. How many questions do you think is good doing daily for preparing for NCLEX? 85 to 150 every day or every other day. Kevin, can I get some advice on how to be as handsome as you? Man, I don't even know how to answer that. Like, wait, I used to be the ugly duckling, man. If I showed y'all some pictures from when I was younger, you'd be like, what the hell? Any advice for complex care? It's the last semester, and I did well on my first exam, but it's crazy. Give me a little bit more context, Cass. My YouTube name is The Boot Nurse. Every social media platform that I have, y'all, it is The Boot Nurse. So Instagram, TikTok, Thread, X. My website is thebootnurse.com. I have a Facebook called The Boot Nation. You can go check that out too. What type of nurse are you? So currently I work in the operating room, so I'm an OR nurse, but I worked in the ICU for a little bit over a year, worked a little bit in the PACU, and then now I work in the operating room. 3 exams away. Shout out to you, Victoria. Hi, I graduated this class and I'm set my NCLEX, but I failed. Okay, Cassandra, so you failed, so what are you going to do to fix it? You're going to run away? Run away? What the hell? I am preparing to retake my NCLEX. Any tips? Okay, Cassandra. So the one thing I'll say is get your NCLEX breakdown. You look like Jason Derulo. Ma'am, where have you been? Jason Derulo looks like me. Don't do that. He's giving young dewy skin. Okay. I'm so mad I missed the review. That's okay. It'll be on YouTube. I can see Jason Derulo too. Yeah, that's what a lot of people say. Complex care like med-surg, ICU. Oh, okay. So you're talking about the learning aspect, like you want the academic aspect, or you want the clinical aspect? I didn't study, just going off nursing school knowledge, and I got a 1-2. So let's see. Okay, cool. Let's see. Everybody retains and holds information different. So why did you leave the ICU, Avery? Go look on my TikTok and look at my ones where it says why I quit the ICU. I actually have 6 videos up, and I'm working on the 7th. You look like actor from Lost. I've never watched Lost, so I don't even know what actor you're talking about. I'm glad you chose education. Teaching is a skill itself. My name is Loretta. Oh, okay, ma'am. Thank you. I appreciate that. I've been an educator for 8 years. I was a surgical tech instructor for 3.5 years. Then I became an instructor for I'm a trauma nurse instructor, as well as pre-hospital trauma, tactical combat care. I did ABLS for a while, BLS and ACLS. So I've done a lot of teaching. ICU is heavy. It definitely is heavy. Sorry, man. I'm a dark, sarcastic nurse. It's okay. I'm dark inside. I kept it real PG. Trust and believe me on this live. Academic aspect, any study tips to retain is fat. So I'm going to recommend a really good YouTube channel, Cass, and it's ICU Advantage. It's ran, what is that dude's name? I forgot what his name was. But ICU Advantage is a fantastic YouTube channel that helps in the critical care and ICU aspect. Do you advise me to read my physiological book before starting my RN journey? I would recommend definitely brushing up on anatomy and physiology for sure. Cassandra says, okay, thank you. I'm doing Saunders and ATI currently using Archer, but I wasn't retaining information. I like Archer. I like Archer a lot. I need help choosing a specialty too. I'm stuck between L&D, MB and Peds interviews tomorrow. Well, Cass, I'm gonna tell you right now, it all just depends on where the heart is gonna take you. You know, are there any requirements before becoming an OR nurse? No, there are none. There are none. Thank you for the rose, Miss Loretta. I really appreciate it because I have so much other stuff going on. I trust and believe me, we all got other stuff going on. It's called life. That's how it happens, right? I used to be a clinical adjunct professor for a BSN program at a local university. How'd you like that, Miss Ratcheted? Appreciate all the follows. My end goal is CRNA light at the end of the tunnel. You're almost there. User 76, where you at? Like, where you at? Tell us where you at in your journey. I do miss teaching from time to time. I love teaching. Like, it's an obsession. Like, I have to have some type of aspect of teaching or mentoring. It's probably the military aspect of me. Can you tell us a cool story on the OR, like an interesting surgery? Okay, so I worked specifically in the operating room, but I worked in general surgery and I did OBGYN. I've done a little bit of ortho and some neuro. So like we have these big robots that we use. They're called the Da Vinci robots. So essentially it's like a spider. You can actually Google it. It's called the Da Vinci robot. And essentially, you know, the robot is like playing, it's like they have a dock or wherever they sit and then they play a video. It's like playing with a fucking video game and they just do all kinds of stuff with it. I've seen some really crazy shit that's happened in the OR, but any tips on how to sharpen your critical thinking skills? So the biggest thing about critical thinking skills is knowing the trends of how the pathophysiology happens within a patient, right? So and the critical thinking aspect will come in time, but really honestly, if you want me to let you know, it's content. Like look at content, like tons of content. I like it too, but I don't want to overdo the studying at this time. I have been an LPN for 18 years. Oh, that RN is right around the horizon. I'm just beginning, but I want to be a CRNA too. Okay, I'm tracking. So that's the main reason why I went to the ICU is because you couldn't tell me nothing. I wanted to be a CRNA. And then when I got to the ICU, I worked in the ICU during the second wave of COVID. Now, if you want me to tell you some shit that I saw in the ICU, I couldn't, not saying I couldn't handle that, but there were so many unethical things that I just was not ready for in the ICU. Every ICU is built different, but some of the things I saw, I was like, bro, I can't do all that. Me as well, but not military tracking. I passed my CNA skills. What should be my next step? I don't know. What's the next step in your curriculum? Do you think it makes sense to do LPN then RN or just go straight RN? So a lot of people will tell you to go straight RN. However, do whatever your pockets tell you that you can afford. Because guess what? School ain't going nowhere. There will always be an RN program, either it be a 2-year RN or a 4-year program. It's always there. It's not going anywhere. I promise you. Wear your merch, Boot Nurse. Go to thebootnurse.com, or as a matter of fact, go to the link in my bio, and then it'll say merch, and it'll take you right there. No, it's a while away from me. It may, 8 years. Okay, but I graduate LPN now. Okay, I'm tracking. I got you. Hey, have that goal. Mad respect to you, men and women, and thank you for your service. I appreciate the support. Thank you. It gets hard with family and kids. It does. Trust and believe me, it does get really hard with family and kids because when you go to CRNA school, that shit is not a game. Like you have to really have a lot of people. You really have to have a really good support system. I couldn't imagine what you saw. Look, I'm trying to tell you, you know what? I'll share a story with y'all. I'm gonna share a story with y'all right now. Okay, I'm gonna share a story. I didn't even see that you said that. So there was one guy. He was an older guy. He was probably about in his 60s. He was like a volunteer firefighter, really nice guy. So he knew that he had COVID and he knew that he was gonna die at some point, right? And we had him on BiPAP and everything, and He was cool. He used to play his music loud. I mean, loud through the ICU. And we would be like, "Hey man, can you turn that down?" And he'd kind of ignore you, give you the finger. And I was just like, "I like that guy. I like him." And then, he was very sarcastic, and I understood him. Like I loved him. He was a very nice guy. A former paramedic too, so he knew what was happening. Long story short, one day he started really decompensating, like really bad. Like, I mean, even with the BiPAP on, he was like in the high 80s, getting into the mid 80s. And if you guys start to learn about, hypoxemia and you start to go brain dead, that, due to the lack of oxygen being fed to your body, that's a real fucking thing. So long story short, we were trying to code him, but he was fighting us. He was just like, no, no, no. And then his music was blaring loud. And then next thing you know, he didn't want us to intubate him. And then he lost consciousness. And then what happened? We coded him. And so as we started to code him, we already knew what was going to happen. The doctors were already there. So we started to code him. And when he coded, we coded him. You could see him crying. And then next thing you know, they turned his music down. And when they turned his music down, like somebody was like, it was like one of those shits that you see in a movie. They like held his hand. They were just like, no, like just leave it there. And so they kept his music up. And in the moment that they kept his music up, like it was like everybody in that room started bawling their fucking eyes out. Like it was fucking terrible. And like it's just like you can't help but feel the emotions from other people, especially the people that you work with when it comes to that. And that's one of the ones that's really stuck. It sticks with me like all the time. And so, like that was the craziest thing. He was a cool dude. He used to be like, "Kevin, what's up?" And I was just like, "Hey man, I'm here for you, baby. What we doing?" I was like, "You need help? You got to go to the bathroom?" I was like, "I don't want you to shit on yourself." And he was just like, "No, no, no, we're good, blah, 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 yada, yada." So, So he went out like a G. He went out like a gangster. So that was definitely one of those tough days. And I definitely went home. And that was like my day 3 or 4 or 4. Let me tell you, I needed that weekend. I needed that. So, Amanda, you passed your NCLEX. Welcome. Welcome to the shit show. Welcome. Congratulations, everybody. All 100 of y'all give Amanda her flowers right now. Right now. So, but yeah, that's one. I actually have only told one or two other people that story. So I'm glad I was able to share that with y'all. Because, like, here's one thing I'm going to tell y'all is that nursing is not necessarily about working at the bedside. I'm telling you right now, nursing is so much more than that, y'all. Nursing is so much more than working at bedside. What's up, Victoria? Can you cover nursing fundamentals? Taylor, where you been? We done with the questions. I failed my first attempt of my farm HESI. I feel defeated. I get another attempt on Friday. Okay, Kari, so what we about to do about it? I'm sorry, I just got in. I know you just got in here, Taylor, but we went through 75 questions too. 75. You missed it all, girl. You missed it all. I'm scared that I'll get my first job as a nurse and be lost and clueless. That's okay though, because it's part of the development. It's part of the imposter syndrome. You're gonna feel it. It's okay. You're gonna study hard. I know that. So you need to figure out where you had deficits at. Okay. Oh my God, what time do you usually go live? I went live at 5:30, and so what? We're 4 hours now. 4 hours. I have a desk job. I'm an RN. Look at that. And what days? Monday, Wednesdays, and Fridays at 5:30. So here's the thing: like being an RN is so much more than being at bedside. Trust and believe me. In my opinion, if you are a nurse, a registered nurse, or an LPN, and if you aren't trying to move around out here, then, you kind of just stay. Like, a lot of people were just like, yo, these travel nurses are making like, $5,000 a week. And I was just like, yeah, but what if you don't want to travel? What if you find yourself a really good desk job that's paying you, $120,000 a year? Or if you live in San Francisco, they're paying, $100 an hour and you're making over $200,000 a year, AKA only $80,000 a year. You know what I'm saying? So is that Analia or Ania? Whatever, Maria. I'm just gonna say Maria. This is so amazing. Can we do this again? I do these every Monday, Wednesday, and Friday. I do questions, and then I do this, Q&A type deal. So hey, if you're new here, my name's Kevin. I go by the Boot Nurse. Check out my link in my link tree. All of my stuff is in there. YouTube,
my website, my NCLEX course. Check out all that stuff. Go check it out, okay? I want to know who you are, where you're from. My name's Ken. It's Kevin. Kevin. But, Ken works too. I like the black Ken doll, I guess. But yeah, like I said, being a nurse, LPN or RN or LVN, it's so much more than just working at bedside. Trust me when I tell you that. Like, I got a buddy who works. You're welcome. I have a buddy who works for a cardiac catheterization medical device company, and all he does is go around and teach people how to use it. Loving his job, making 3-4 times the amount of money, and able to be home with his kids all the time, and not have to take the stress and mental anxiety of being, working in the hospital. All new grads undergo orientation and internship, especially ICU, surgery. Yep. They sure do. Nurses are heroes, and RNs do everything. The right-hand side of the MD, facts. I'm telling you right now, without a nurse, there would be so many doctors right now that would be up shit's creek without a paddle. Do you come from a medical field family? One of my aunts is a nurse. My cousin is an LPN, and then I'm a RN. And I think that's it. I don't know about anybody else necessarily. So I love how there's so many things you can do as an RN. Not just as an RN, you could do it as an LPN as well. There's a lot of things you can do out here as an RN, as an LPN. So many things. Trying to tell y'all, y'all are so valuable. Y'all are so valuable on every aspect. I'm a first generation, other than my second cousin. Shout out to you. What can I do as an LPN? So a lot of the things you can do. You could travel. You could. I'm trying to think right off the top of my head. Hold on one second. Somebody said, I've been an LPN for 9 years. I'm in BSN right now. Then bridging over to LPN. It's a lot. It is a lot. 100%. I am a dialysis PCT. What field of nursing would you recommend? I don't know, James. It depends on what you want to do for yourself. Do you want critical care? Do you want perioperative care, like the surgical realm? Do you want to not do that at all? Do you want to work in a clinic? Do you want to go back and do dialysis as a nurse? Work as an EMT now? Okay. Man, I know it'd be rough out there for EMTs. Everything except push IV meds. I'm assuming that's what you said. Assessment. Yeah. Oh, you're talking about in that regard. Oh, yeah. You're welcome. I thought you were talking about, they can't hang blood. I thought you were talking about in regards to like what they can do like outside of actual bedside nursing. But yeah. So the biggest thing about an LPN versus an RN is what you can and can't do, your roles and responsibility, what you can accept and what you can't accept. Once you understand those three, you're good. EMTs don't get paid enough. True. That's facts. Paramedics don't get paid enough, especially with the level of autonomy that they have, where they get to push pressors and they get to push opiates and they get to intubate. But they get paid like shit. And they have this massive level of responsibility, right? Only thing you can't do as an LPN is push IV meds and hang blood. That's not necessarily true. There are a lot of other things that you can't do or you can't accept according to NCLEX. I'm not talking about state. I'm talking about NCLEX. What was your first nursing job? My first nursing job was in a burn ICU. And I worked there for about 6 months. And then I went to a neuro and a medical ICU. And I did that for about 7 or 8 months. That was my first, Amanda, that was my first nursing job. It depends on the state you live. Law. Yeah, it does depend on the state that you live, 100%. Well, if we're talking about NCLEX, because that's what I talk about, then you can't do none of that. Your state will depend on, hey, if you can do IVs, if you can start IVs, if you can do blood, or if you can do EKGs. They have certain certifications for that. So all of my LVNs that are in here that have been here a while, I know that you guys know that, but other people don't know that. A paramedic is basically a doctor in a way, kinda. They're kind of a doctor in a way, but they don't have the doctor pay and they don't have the doctor credentials. And remember, a paramedic can't do shit without a doctor, without working under the direct supervision or the direct license of a physician. Can't happen. I just want a job as an LPN that won't hurt my back. Look, so you could do a remote job. So here's another one for everybody. Go on Instagram and look up is it the remote nurse? I think it's the remote nurse. And they post remote jobs every single day. They have a Facebook page, all that stuff, not just for RNs, but also for LPNs as well. Hell, I even see some on there for
for physician's assistants, for PAs, and for nurse practitioners. All remote jobs. Or look at, you could work at an insurance company. You could do medical devices. You could do consulting. You can create your own stuff. Just a whole bunch of other stuff. There's so many other things that you guys can do out there. So shout out to y'all. Got 96 people up here that are still rocking with me. You said remote nurse. I did say remote nurse. Make sure you guys go check that out, right? Shout out to all 96 of y'all that are in here rocking with me. Yo, we got to 57,000 likes. We got to 355 shares. We got through 75 questions today. Y'all getting an AMA. We Gucci out. And y'all know exactly what I'm about to do. After I get off here, I'm about to turn this camera on, and I'm about to start recording some content for my course. So working on my second half of my pharmacology content. So we're going to be doing that. So who are y'all? Who are you? Where are you from? Let me know where you're at in your nursing journey. Make sure you guys go check out my links in my bio. 7-day NCLEX course is my baby. I am creating that from the ground up, and it's $48 right now. $48 for early adopters. So if you just started school and you graduate in 6 months to a year or whatever, and then you take your NCLEX, it's good for LPN and RN. Just saying. So is it Chastity? Chastity says I'm a nursing student from Alabama. Hey, I heard in Alabama that they ran out of folding chairs. Hey, I'm sorry. I couldn't. You already know. You knew it was coming. I couldn't help myself. Nursing school, Camille. And he's right. The LPN because made a killing traveling. Yeah. And no travel. Hey, by the way, those travel COVID numbers are coming back up because COVID's going back up too. I'm from Montgomery too. Ain't that a damn shame? It says, any advice for slow test takers? It takes me a while to answer, but I answer correctly. So here's the thing. You need to get down, in my opinion, you need to get down to answering your questions anywhere between 60 to 90 seconds. Because that's a really good optimal level to keep you at the 75 question mark at the hour and 15, hour and a half mark, right? Because the last thing that you want is to get all the way through your questions and you haven't even made it to 75. But then again, it all just depends. Remember, with your NCLEX, you have 5 hours to take the 5 hours to take the test, and you have a minimum of 85 and a maximum of 150. Okay, so the one thing I would say is to increase your answering ability. So once the question pops up, read it again, read your answers, answer, boom. So you want to be answering your questions between 60 and 90 seconds. Okay, I recently tested out of my first dosage. Shout out to you. Got to get those 100. You're from Montgomery. That's funny. 12 years. LVN finally going. Finish my. BSN. I was like, your band. What are we talking about? Okay. Shout out to you. I in my 4th term. What's MI? Is that Mississippi? That's Mississippi, right? Loving this Wild Friday night. We're all having. Look, we here just chilling. Yo, you missed it. I don't know if you were here earlier. But we went through 75 questions, and we was and people coming here trying to act up. Thought I was playing with them. All right, Cassandra from South Carolina, 18 years. What part of South Carolina, Cassandra? I got family that live like in Chester and Raleigh. No, that's in North Carolina. But Columbia, Stephanie said I just recently passed my NCLEX RN. Yo, everybody give Steph her flowers. Congratulations for passing your NCLEX, Stephanie. Welcome to the greatest shit show on earth. Welcome to this niceness of nursing. I'm just keeping it all the way 100. I got all 150 yesterday. It was tough. Let me tell you, Amanda, you didn't experience this maybe, but I got my second time I took the exam, I got 265 questions. Let that sink in. If it's me taking a while, does that mean I'm lacking content then? No, not necessarily. It just means that you're just trying to be thorough and you're trying to understand the question. Now, if you start not doing well, then that means you might have a content issue. How accurate are exit exams in predicting NCLEX performance? I guess they're there for a reason. I did my exit and I didn't do well on it, and then I finally was able to figure out how to do it for myself. Like I said, everybody learns differently. I had no math problems on my NCLEX either. Yep, I didn't have any on mine either. The last time I took it, the first time I took it, I think I had 3. So, are you from Columbia? Okay, shout out to you. I think MI is Michigan. Is it? Is it though? Thank you. I'm pumped. Oh, Stephanie, yeah, you are pumped. Whoo, girl, you better be ready. better be ready for what's about to come. Thank you. Lots of maternity insight, guys. Okay. Hey, so remember that your test is computer adaptive. So what you got, they may not get. All right. Amanda said that's insane. It's hard to stay concentrated after that long. I'm trying to tell you. First time I took my exam, 75 questions. Second time, 265. Third time, 106. And then the last time it was 60 because I took mine during COVID, or like right around when COVID had happened. So I thought I bombed because my computer shut off at 85. Nah, that's usually the normal feeling. That's usually the normal feeling that people have. So shout out to y'all. Appreciate the follows. Make sure, hey, if you guys haven't followed me, make sure you guys follow. I need at least 10,000 people to like me, or at least pretend to like me. You know what I'm saying? At least pretend to like me. I mean, I'll sing you a Jason Derulo song. You know. So, I need at least 10,000 people, y'all, so I can stream from the computer. So, how long after test do you get the results? So it depends on the state. There's some states you get it like immediately, but on average, I think it's like 48 hours. I live in Texas, and it took 48 hours for me to get it. Stephanie said, "How long have you been a nurse?" I've been a nurse for 3.5 years. Eric says, "Hi, NCLEX review you recommend for Mexican nurses." I don't know what that means. Do you have a language barrier, Eric? Like, is that why you're asking, or? Because I can tell you right now, Eric, it doesn't matter what review that you get. The majority of it is going to be based off of English. My specialty, I work in the operating room, so I'm an OR, surgical, scrubs, circulating nurse. Let me see. I'm going to be back Monday, 6:30 Eastern Standard Time. Look, you got to be, because I'll be here at 5:30 Central Standard Time. I will never test on a Friday again. I tested on a Wednesday, and then I got my results on a Friday. Probably not the best, because if you get your results on a Friday, you know, at that point, you're either going to go into the weekend cool or not. So, yeah, it's going to be the longest weekend ever. So, you could do it that way too. But to answer Eric's question, it doesn't really necessarily matter what review you get. If you have a language barrier, then you know, like, that's kind of like one of those things you have to like navigate, of understand. You have to really understand like what they're asking you. And so there's a lot of people that have that issue, like especially for nursing students or graduates coming from the Philippines, from Africa, and from Mexico, or if they're Spanish speaking first. You know what I mean? When you go back live, I'll log in and tell you how my NCLEX went. Please do. I would Lilo, I would fully expect for you to do that. I would fully expect for you to come in here and not hog all the glory and tell us what the deal is. Do you plan on getting your doctoral or PhD? It's funny because my dad asked me that. My dad asked me that question too. I haven't decided, honestly. I thought about the doctoral route, you know, to focus more on the educational aspect. I'm like I said, I'm a master instructor in the Navy, and so I know all about curriculum rewrites, revamps, how to write different level questions. I know, you know, do all that stuff, how to, you know, break a curriculum and a program down to build it back up. Like, I understand all that. So I don't know exactly what level of the doctoral route, if I even want to go to, but it's definitely not off the table. It was difficult. I did the test 3 times. Okay, so my question to you, Eric, once again, is like, what do you feel like your issue is? I'm on your website now. How long is the $48 special? It's, put it this way, it's pretty much gonna be there until I get my NGN videos up, my NCLEX review videos up. Once those are up, it's going up. So Cassandra, like I said, once you have it now, if you buy it now or get it now, you have it forever. Like, you have it forever. And there's going to be things that are going to be changing here in the next couple of months with it. So if you get it now, it's yours. I wish I would have known about you before I took my NCLEX. Would have been less nervous. Look, I'm all about the motivation. I'm all about giving it to you. It's a Shanika. It says, I've been out of school for 6 years. I want to take my NCLEX. Please tell me where to start. Well, first of all, if you've been out of school for 6 years and you haven't taken your NCLEX, you might want to get yourself a really good review. I would definitely start with learning content. Like, you're going to have to start all over. You're going to have to learn content. You're going to have to put yourself on a schedule, create a study schedule for yourself. You got to cut people off. You know, you got to be very regimented. Like, I'm a very regimented person. But the biggest thing I would say to you is that you need to start doing content. Start learning content, because you got to learn the bread. You got to learn the bread and butter. right? And then before you get to the meat and potatoes, right? So the bread, butter, meat and potatoes, questions and answers, rationales with content. But I would definitely start working on content for sure. Start working on content, right? That would be my advice. Medicine changes so much all the time. I was going to say I need a refresher course. So medicine does change all the time. However, I'll give you, as a nurse, when you work in the hospital, they have continuing educations and they have, all this stuff all the time, all the time. So not necessarily saying that you wouldn't like need a refresher, but they have continuing education things like this all the time. Not saying like what I'm doing, but they have, like where I work at, they have health streams, stuff like that. I'm off all social media except for TikTok. Cut all family and friends off to refocus on passing the NCLEX. Look, I'm telling you right now, you already made one huge giant step, because guess what? That license is not going to say no one's name but yours. It's not going to, your degree don't say no one's name but yours. So now you got to put you first so you can take care of so you can take care of the people that you need to take care of. And that's a huge, huge, huge fact. So, support system, I hope you have one. I'm pretty sure you do. And now it's just all about refocusing. So the very first thing I would recommend is content. Content. You're welcome. Rationales were a lifesaver for me. I always made sure I read them, and it really helped me. That's where I'm telling you, that is where the retainability aspect is. It's like you have to read them. You have to read them. And then you reinforce reading your rationales by looking at more content that relates to that. You know what I mean? So what else y'all got? Shout out to all 75 of y'all in here rocking with me. If y'all are new here, my name's Kevin. Go by the Boot Nurse, just like my nice little shirt says. Been a nurse for about 3.5 years. Worked in the ICU, worked in the OR, worked in the PACU. I love. Hey, first of all, if anybody wants to know where to go and love it, it's PACU. PACU is I liked the PACU when I was there. Yeah. So I want to know who you are, where you're from. Make sure you guys go check out the link. We're doing there's a nursing summit that's coming up on October 1st. It's free to register. Check that link out in my bio. I'm going to hang out here for about another 13 minutes. Hey, if y'all are on the East Coast, y'all are rocking with me until what? 11 o'clock? It's almost 10 o'clock here in Texas, right? So make sure you guys follow. I need 10,000 people to follow me, y'all. 10,000 people. I need y'all to follow me. Be my friend. At least pretend to be. I drop some funny stuff here and there, now and then, you know what I'm saying? So I start my PM program in August from Mississippi. Okay, all right, Summer, Nicole, girl, I see you out here. Oh, you started. So you just started. So you've probably been in school about a month. Okay. Them tests get you yet? They get you yet? Oh. Hey, y'all, TikTok is about to kick me off. I don't know. Oh, wait, hold on. Let's see. Let's see, because I don't need them kicking me off. There we go. Oh, Gucci out here. Okay. What does it say? Rationales. Rationales is what I didn't think about when I sat for NCLEX the first time, writing them down for the first time. So here's the thing: is like you don't necessarily have to write them down. Also, think about what type of learner that you are. Think about what type of learner that you are. Are you an auditory? Are you kinesthetic? Are you visual? Are you a read-write? Are you a combination of all four of those or a few of those? Right? Like me, I know that I acquire knowledge very well with audio. So like if I'm in the truck, if I'm driving, if I'm in the shower, if wherever, I could turn on an audio and I'm focused on that, right? But I also like visual. Majority of us are kinesthetic as well. So you got to think to your, like, you can't open up a book in front of me and tell me to start writing notes. I will fall asleep. I will fall asleep. Trust and believe me. Fastest way for Kevin to go to sleep, put a book in front of me. Definitely a combo. So now you have to figure out, okay, now that you figure out that you're a combo, capitalize on the way that you learn, right? So if you know it's visual, you need something visual. So maybe you need to have the content kind of like how I did it, where I went through questions, right? Or, you need like a lecture base, like somebody to virtually tell you, or like virtually in school or whatever. And then auditory, like let's just say there's a really good podcast that's out there that you like, that's super helpful, or, turning on Registered Nurse RN, or, let's just say you bought my course and then I had a 15-minute video talking about, anticoagulants and antiplatelets. Turn it on, put it down in your car while you're driving. Now you're acquiring the knowledge. You are absorbing the knowledge while you are driving. How do you remember the difference between RA and OA? What is that? Rheumatoid arthritis and osteoarthritis? I'm assuming that's what you mean, right? I'm great at taking notes, but definitely hands-on learner. I pass skills with no problem. Honestly, there should be no reason that anybody ever fails skills. There should be no reason. Off the top of my head, is that Taryn? Off the top of my head, I don't know. Like I tell you right now, off the top of my head, I do not know. Amanda said, I also watched review videos of each body system separately. They were very helpful. Yep, that helps as well. That helps as well. So the thing about my course is that I honed in on the really important things that you needed to know based off of the different systems. So for example, pharmacology, got a whole bunch of videos in there. Endocrine system, whole bunch of videos in there, like, diabetic ketoacidosis, talking about hypoglycemia, talking about the different insulins, like all those things. In the pharmacology, talking about antibiotics, talking about antifungals, talking about neuromeds, cardiac meds, all the important things, all of the fluff is gone. And it's all the important videos that you need to know content-wise, which are going to really, really rope you in for when you're studying the questions and doing your and doing the other reviews. They're definitely super helpful, super duper helpful. So shout out to all 56 of y'all that are in here rocking with me. I appreciate y'all still smashing that like button. Hey, if you have not followed me, make sure you follow. All right, because I do these every Monday, Wednesdays, and Fridays. I was gonna take it down to twice a week, but then I had some people like, please, and I kind of made it within my schedule to where I could do that. So 3 days a week, y'all get Monday, Wednesday, Fridays at 5:30. Some people wanted me to do it every day, and I'm just like, what? I mean, I could do it every day, but who knows? That could come. Hey, that could happen real soon. That could happen real soon. What else y'all got? We got a couple minutes. We got another 8 minutes before I get off here. What else? Thank you so much, your knowledge, for sharing it. Of course. So here's the thing. I don't gatekeep. I don't gatekeep at all. I'll tell you where I found information. I'll tell you what other reviews are out there besides mine. If I don't like a review, I just won't tell you about it. And it's not gatekeeping. It's just like, I don't think that they're a good review. As a consumer, if they're not good, why would I tell you, someone else, to go buy it? And if I've never heard of it, I'll be like, I've never heard of it. And that's just real. I think I have y'all see that? It's all silvery. Man, I'm old as fuck. Here we go. So shout out to y'all. What other question y'all got? Hey, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Are you a prerequisite nurse? Did you just start school? Are you a nursing student, like in second semester? Did you just graduate? You taking an NCLEX, taking it multiple times? Are you a brand new boot nurse, baby nurse, new grad, about to go out here and start working in these hospitals or clinics? Let us know. How old are you? How old do you think I am? I actually said my age earlier. I don't know if you were here for that, Apple. So I don't know if you were here for that. Y'all see my teleprompter up there? Like, hey, we keep it real professional right here. We keep it real professional. Do you think Mark Klimic lectures and notes are great? 100%. I love Mark Klimic. I love his stuff. His review just makes remembering things so much more relevant. Like, and when I teach, he is my motivation to keep it relevant. You ever heard that term, KISS, keep it simple, stupid? There should be no reason why we should make electrolyte imbalances difficult. There should be no reason for it. That's why we come up with the acronyms and we come up with the little nursery rhymes, if you will. Apple, I am, oh my God, how am I? I'm 35. Do you know anything about Hearst review for NCLEX? Do you recommend? Okay. So I didn't like Hearst. Who said that? Leslie. I didn't like Hearst. And here's the reason why. It wasn't because of necessarily the review, but I couldn't even get through it because Aunt Marlene, y'all, has a thick ass country accent. And she was very much an environmental barrier for me. Not saying that her review is bad, because I've coached people who had her stuff and they passed. Like Manasa, she used Hearst. Candace, she used Hearst. So I've had a whole bunch of people use Hearst. And I don't shit on her review because it's good. It's a good review. It's just that for me, Kevin, it did not work. But could I recommend it for you? Yeah. So much content with a 50-question test. I'm trying to find a way to get all the info without overwhelming. All right, Summer, I'm going to break it down for you here in a second. Hold on. Do you recommend NCLEX Mastery app? I am the type of person that doesn't like to do NCLEX questions on my phone because when you go and take your NCLEX, you're going to be sitting in front of a computer. So why not practice that way? You know what I mean? But if you're on the go and if you're trying to get your quick 5-10 minutes in for you to do what you do, I use NCLEX Mastery. At one point, I think they were giving away free questions, but then it's like it's on a time limit now or something like that. So if you're trying to go on the go, I would recommend it. Summer, I'm going to answer your question. Hold on. I started listening to his lectures, impressed. His lectures are great. Those lectures came out like in 2008, by the way, like 2008, 2010, something like that. I'm supposed to be in my senior year of nursing school, but on medical leave because of a car crash. Let me tell you something, Al. Your health is more important than anything. Trust and believe me when I tell you that. Your health is more important than anything. You want to know why? Because nursing school, there are plenty of other nursing schools, but there's only one fucking you. There's only one of you. Who gives a fuck about that nursing school? Get better and then go back to nursing school. Trust me. My nursing license was suspended. Lady V. Why? What other things do you recommend? How should I break down my studying for NCLEX? Before I answer that question, Leslie, let me go back up to Summer's question. Summer, you had asked, how do you 50 questions? Because you're in med-surg or something like that, I think you told me. So get in with a group of people. And by that, I mean like 3 or 4 other people. Okay? It's nice seeing a black male as a nursing student. It's nice hearing, what you mean? Oh, I was like, I ain't a student. I take that back. I am still a student. We're all still a student of the game. All right. But Summer, the one thing I'll tell you is that you need to get into a group of people. I think you're still in med-surg, if I remember that, or something like that. 4 people to include yourself. Split up the notes. Have them do their portion. You do 25%. Bring them all together. All the notes are done. Al, I got you. I got you. I did nothing on a job, a DUI. Okay, Lady V. So I don't know what state that you're in, but according to the National Council of State Boards of Nursing, any type of alcohol or drug-related incidents that happens for a registered nurse, you legally have to let the Board of Nursing know. You have to. It is a part of the ethos. It's a part of their guidelines. You have to let them know. You have to let your state Board of Nursing know that you were involved in some type of alcohol-related incident or drug-related incident. Why? Because you are a servant of the public. And yes, your personal life can affect you 100%. And so I'm sorry. I'm sorry that you had that happen to you. But I'm going to tell you a quick story. I had 2 of my friends. Both of them were in the Navy, and both of them were surge techs, and both of them I worked with, and both of them were killed by drunk drivers. And so I'm going to tell you something right now. Is that people that drink and drive, I don't condone it. I don't condone it at all. So the one thing I will tell you is I'm glad that you got a DUI. I'm glad that you got a DUI because you could have got something worse. You know what I'm saying? Like you could have got something worse, which is, you could have hit somebody. You could have really, really hurt somebody, killed them, or even yourself, And I always try to tell people, if you need help, go seek out the help, And that's why I like to do these things too. Somebody else got on here and told me that their mom died while they're in nursing school. And I was just like, I'm really sorry to hear that, because I don't understand I can't empathize with that, because my mother's still alive and I'm blessed to have that, right? But I couldn't imagine having my mother, having a close relationship with my mother like she did, and her mom passed away on her while she was in school. That's devastating to people, right? But how are we going to pick ourselves up? So you had a DUI, all right? You reap the consequences of doing that. So now how are you going to pick yourself back up? So you have your license suspended, but it doesn't mean your life is over, I can tell you right now that somebody that has a DUI while working as a nurse, you are one of those people who could jump into public speaking and to tell people the awfulness of what a DUI can bring to people, right? And what it can bring to people in regards to their lives and somebody else's. You know what I mean? So I'm just saying, I'm just trying to keep it all the way real. Like, I ain't gonna sit here and I ain't gonna sugarcoat nothing and be like, oh, you got this, you got that. No. We don't coddle. And, we don't condone, stupidity. And that's just real, So shout out to 69 of y'all up here rocking with me. I stayed on until 10 o'clock. let me see what y'all are saying. The comeback is greater than the setback. Ooh, I love the way you said that. You could always use your experience to bring awareness. Facts. Al said, what type of nurse are you? I want to go into psych. I'm an OR nurse, and I'm working towards being a strictly nurse educator. That's what I'm doing. Did your instructors actually lecture, or was it a brief chat, then learning groups? So when I went to school online. So we taught ourselves. They were just like, hey, here are the chapters, go read. Literally, that was it. So did you answer my question? Leslie, I'm sorry. What was your question? Somebody said something about a DUI, and that definitely took my priority. Would not have shared to anyone to approve, just awareness. No, absolutely. No one's saying that we expect approval at all whatsoever, but the awareness is 100% real. My job requires a clean driver's license. DUI, I get fired. Yep. Not only will you get fired, they'll report you. How do I break down my studying for NCLEX? All right, so first of all, you need to recreate the testing center, number one. So everything that's around you needs to go away. It needs to be on the computer because that's how your exam's going to be. You need to first, in my opinion, start with the sections that you have the most difficulty with. Mine was pharmacology. I've made videos on YouTube about this, but mine is pharmacology and maternity. So I started with nothing but pharmacology content. So this is how I started it. Content in the morning, I took a break, and then I did my NCLEX style questions, took a break, did my reading and my review, took a break, and I was done for the day. And then I did questions every day to every other day. And that's how it should be. You have to be regimented when you do that. So when you break it down based off of the sections that you have the most difficulty with. Right? Remember, there are 8 sections of the NCLEX pie. 8. All right. So most people have a problem with management of care. Start there. Most people have a problem with pharmacology, like me. Start there. Even in class lectures, we are teaching ourselves. Was just curious. Mama Murphy, trust and believe me, you are not the only one who has ever said that and who will ever go through it. Good evening, Texas Lakers. I said I was going to get off here, and y'all started asking me questions. I need to get off here anyway. But yeah, ladies and gentlemen, I am going to call it a night. I really hope I was able to answer your questions. I appreciate everybody coming to the Q&A that we had earlier, or I'm sorry, to the NCLEX questions that we had earlier. I will be back on Monday at 5:30 Central Standard Time. And I hope I was able to answer everybody's questions. Make sure you, like I said, you guys like, share, follow. You did. You missed it. You missed it, Laker. You missed it. Look, I've been on here for 4.5 hours already. So, like I said, I appreciate everybody. Y'all are going to do great. Hey, it takes nothing to be kind to one another. Remember that. And remember, those setbacks, they don't, we learn from them. All right? So, if I don't see you on Monday, I will see, hopefully I'll be able to see you guys some other time. Make sure you guys go over to my bio, check out all the links that I have available there. And I hope to see all you guys. Yeah, remember your goals and your purpose. That's right. I hope to see everybody in the live. Make sure y'all go over there and follow me on Instagram and stuff too. But anyways, y'all have a good night. Have a safe weekend. Bye.